because obviously they have not performed well on most of their performance indicators. And so I won't touch everything on their performances because the only analysis that happened is their non-achieved performance indicators. So the Department of Health, under this period, has planned for program 1, 2, 3, 6, and 7. The department has 8 programs: administration, district health services, emergency medical services, provincial hospital services, central hospital services, health sciences and training, healthcare support services, health facilities management, which entails infrastructure. Then on the program analysis, program 1, their output indicator is the percentage of own revenue collected. The APP target was 95%. The target for the period under review is 25%. They achieved 11.28%. On HR capacitation, most of the revenue units at the facility are not adequately capacitated, and this hampers the activities. On revenue management system, most of their district hospitals still not have a billing system for patients' fees. This means that they use manual spreadsheets to record the billings. On percentage of invoices paid within 30 days, the APP was 100%, the target was set at 100%, but now during this period under review, they achieved 61%. In the first quarter, the department's efforts were to settle invoices that were outstanding at the end of the 2024-25 financial year, but this didn't happen. This presents the risk that as the prior year invoices are prioritized, the current year's invoices might also fall behind. On the procured goods services, on the works awarded to women owned businesses, their target was 40%, the target also was 40%, the output is 18.57. It's because they have insufficient number of women-owned business with 51% shares for goods, services, and works procured. On program 2, district health services, the department has a percentage their target was set at 95 for this period under review. They achieved 64.3. The problem was high loss to follow-up rate. The patients don't come for their follow-up rate. And also on child remaining in treatment care of ARTs, they couldn't reach their target because of non-adherence to appointments, as children depend on parents or caregivers to bring them to follow-up visits. On HIV for adult viral load suppressed, they They didn't also reach their target. The target was set at 95%. They reached 83.3 because of the non-adherence to appointments and treatment. And on TB, rifampicin, they said the target was 226, which is very high, but now the target for the period under review is 57. They reached 50. All 50 patients tested positive were initiated on treatment, but now they continue this weekly alerts meeting to ensure that all TB rifampicin, rifampicin resistant cases are initiated on treatment. Honorable members, please note that there are questions that have been crafted to the department to come and respond on all of these targets that they didn't achieve. So they will come in to come and respond on them. On the maternal, child, and women's health, nutrition, a couple-year protection rate. Some facilities were out of stock for contraceptives due to budget constraints. They reached 72.5% at the target of 80%. Due to stock availability, the stock wasn't enough available, and the conduct of contraceptive open days campaign were lacking. On the antenatal visits for pregnant women, the target was 70%, and they reached 63.9%. It's because they initiated at first contact with healthcare, and then the appointments on the case of diagnosis were not enoughly initiated. And in immunization under 1 year coverage, they achieved 90%, they targeted 90%, and the achievement was 62%. The medical depot delays in delivering medicines due to logistical challenges, and also the budgetary allocation for medication is not reflected on the BAS report, and the low primary healthcare utilization under 5 years rate. And let me quickly run to the next slide of the child under 5 years pneumonia case fatality rate. Also, they had a high fatality rate in pneumonia cases where the target was 1.5%. They reached 2.5%, which is very high because of the delays in health-seeking behaviors that lead to disease progression and poor prognosis. And child under 5 years severe acute malnutrition case fatality rate, the target was 10%, but it was high to 13.8. So meaning malnutrition fatality rate was high because of poor prognosis due to delay in seeking health care by communities. And there were 9 deaths in Thabo Mofutsanyana district due to late detection of disease and weight loss at the primary healthcare level. On vitamin A dose, the target was 65%, they reached 53.8%, underreporting that there was underreporting data on the community outreach services, and it's still a challenge to report on that. Honorable members, on cervical cancer screening coverage, the target was 50%, and the output is 41.7% because of poor marketing and staff shortages. Because also there was daily screening outreaches, Women's Day campaigns and all that, but they couldn't still not reach their target. Quickly running to the percentage of autopsies formed within 5 working days. The target was 99%, and they reached 69.95%. Due to that, the Bloemfontein mortuary was only closed in October 2024 and reopened on the 18th of June 2025. The Botshabelo mortuary was closed on the 14th of May 2025, which still they didn't explain whether the mortuary was opened or there was any infrastructure going on. Honorable members can note on that one as well. On program 3, it's emergency medical services. The EMS response at level 1 rural response was 82 planned, and 73% was the output for this period under review because of shortage of skilled EMS officials. to increase rostered ambulances. Under 60 minutes rate, also there's a challenge still the same as the shortage of skilled EMS officials, even under the number of rostered obstetric ambulances for the gynecologists and staff. On program 6, health science and training, number of clinicians trained on the ESMOE, they have planned for, actually for the annual performance target it was 250, but now for this period under review they planned 400, but the output is 54. The challenge was 3 of the 4 planned sessions were done, with 1 session having far less participants than planned. Session in usual Putswa did not happen as participants did not pitch up on the day of training. Running to budget program 7, healthcare services under MedPass, medicine trading account. Service level for normal orders. The target planned for annually was 65%. Then for this quarter, it's 65%. Output is 17%. Lead time, the problem was lead time to facilities was long due to the following: delay in budget approval, upgrade of bus from V5 to V6. That was the challenge. Under findings, shortage of skilled EMS officials to increase rostered ambulance. That is the finding that honorable members can note, that there's shortage of skilled EMS officials to increase rostered ambulances. On budget sub-program MedPass, medicine trading account, lead time to facilities was long due to the following: delay in budget approval, upgrade of bus from V5 to V6. Also in Mohokare at Matlakeng Clinic, interrupted water supply is a problem. So recommendation, it is recommended that honorable members can conduct oversight at Mohokare sub-region in Zastron, especially at Matlakeng Clinic, where there is an interrupted supply of water. In conclusion, the department has planned for 52 indicators. Number achieved is 22, number not achieved 3, and the percentage at 43.3, not achieved is 57.7. Thank you, Chair, and thank you, honorable members. That was all for health. I'm going to quickly run through education. On the Department of Education, an introduction on our members. The Free State Department of Education derives its mandate from the Constitution of the Republic of South Africa, 1996, Section 29, subsection 1, 2, 3, 4. The background of the performance analysis. The purpose of this analysis of the first quarter is non-financial matters of the Department of Education is to help enhance the oversight function of the legislature over the department and to assist members of the portfolio committee to optimally discharge their duty of holding the department accountable. The Department of Education focus during this period under review is on program 1, 2, and 4. The Department of Education has 7 programs as they appear on the presentation. On program 1, the department, the performance indicators that are planned are those that the department couldn't achieve. As I have mentioned earlier on our members, there are questions that I have crafted for the department also to come and respond on the questions based on the non-achieved performance indicators. On output indicator 103, percentage of expenditure going towards non-personal items under program 1, the annual target was 13% and the actual output is 5.12% because of higher spending more than 6% is due to transfer payments to schools paid for 2 first and second quarters during the first quarter, as well as payments of accruals. On output indicator 104, number of smart schools provided with additional ICT devices, the target was 10, and there's no percentage that is showing the output indicator percentage. Honorable member may probe on that one as well because of procurement process in progress. Number of teachers on the output indicator 105, number of teachers provided with ICT devices, the planned target was 400 and the department achieved 95. Submission to procure, that was the deviation, because the submissions to procure approved requests for codes have been made, awaiting appointment of service providers. On output indicator 106, number of office-based educators provided with ICT devices, they were 25, but the output is 0 for this period under review because of submissions to procure. Approved requests also for codes have been made, awaiting appointment for service providers. On output indicator 108, number of schools reached through advocacy campaign on gender-based violence and femicide, 150 was the planned target. They only achieved 8. Additional advocacy sessions to be conducted during quarter 4. So there are questions also probed on these all deviations to tell the committee why were they planning for second quarter. Output indicator 109, number of district and of provincial officials reached through advocacy campaign on GBVF. The planning was 90 and they reached 8 because the deviation was advocacy sessions to be conducted during quarter 2. Output indicator 110, number of school community engagements to combat racism, sexism, hate speech, GBV, and other forms of intolerance to address intergenerational violence and trauma across society. They planned for 1, but they reached 0 target. The meeting was scheduled for June 8, 2025 at the Intabazwe Multipurpose Center in Harrismith. It was postponed due to logistical issues. On program 2, public ordinary school, the department output indicator 201 was number of schools provided with multimedia resources. The plan was at 30, but the output was 5 because of procurement began early due to the expedited approval process for procuring multimedia resources. Output indicator 204, number of foundation phase teachers trained in reading methodology. The annual target was 500, achieved was 52 for the period under review. The deviation reason was training will be conducted during the June holiday and July holiday 2025. The question also was probed on that one because we are already at second quarter. Now they can come and give a reason why, because they said the training will be conducted during June and July holidays, so there's a deviation. On output indicator 205, number of foundation phase teachers trained in numeracy, content, and methodology, 500 was a target. They reached 236. Training continues in the second quarter. Output indicator 206, number of teachers trained in mathematics, content, and methodology, grade 4 and 5 teachers. 500 was a plan and 136 was the output. More teachers attended because workshops were conducted on a visual platform. Also for grade 7s, they planned for 100 and the output was 38. Due to the same reason, the workshops were conducted on a visual platform. The output 206, the number of teachers trained in mathematics also in grade 8 and 9, grade 10 and 12, they couldn't reach their target due to the trainings will continue in second quarter. Number of teachers also in output indicator 207, they trained them in language, content, and methodology. They targeted for grade 4 and 6, grade 7, grade 8 and 9, grade 10 to 12 teachers. They couldn't reach their target because of the training continues in the second quarter. Running quickly to output, 202 number of grade 1 to 3 teachers trained on literacy and methodology. The target was 500, they only trained 135 because more will be trained during June and July. Output indicator 209, they are stating that number of schools implementing the EGRIA tools, the verifications will also continue in second quarter. Most of the departments' deviations, they have shifted them to the second quarter, honorable members, all of them. The delivery of reading material as well. They are saying the provision of grade 3 African language is reading material. The delivery of material will be completed in the second quarter. So that one also is a sensitive issue because now how will learners cope without materials? If they say they will be delivered, they will be completed during second quarter. The question is there also, which was probed, for them to come and respond. On the ICT curriculum integration for teachers training, they targeted 1,000 teachers, but they achieved 301 during this period under review because training of principal took place and it interrupted the process. That one caused the deviation. On number of teachers trained in coding and robotics, the target was 200, they achieved 121 because training also will continue in second quarter. Output indicator 214 normal members, number of teachers trained on inclusion, they targeted 1,584 was their output also during second quarter, and also the 215 output indicator, it will continue, the training will continue in second quarter. So on output indicator 216, number of focus schools offering the technical vocational stream. Annual target was 32, achieved was 31. The reason for deviation, the province has 31 schools that offer minimum 2 technical specialization subjects. Fezile Dabi, 7, those are the names of the schools that offer technical specialization subjects, usually Budzwa and also Qarib. On output indicator 207, number of agricultural focus schools, the department planned for 21, but they exceeded their target. The provision of focus schools was 22 in number. The province has 22 schools that offer minimum 2 agricultural subjects, of which one is agricultural management practices. Those are the districts where they are offering it. Fezile Dabi and the towns, usually Budzwa, they have 6, Fezile Dabi 6, and Thabo Mofutsanyane as well. And on, let me quickly rush to output indicator 225, percentage of learners with access to the required EFL textbooks, grades 9, 6, 9, and 12. They couldn't reach their target because of the uploading of textbooks on SAMS. Still continues. They are busy uploading the textbooks on SAMS. But now the question is, if they are busy uploading the textbook on SAMS, what is happening when the learners are, actually when the textbooks are getting lost while they are still continuing? But the question is there for them to come and respond, honorable members. And quickly running to the school participating in sport activities, there are 167 output that they have achieved out of 500. Sporting activities continues in the remaining quarters. Number of schools participating in Youth Citizen Action Plan. From 1 April 2025 to 30 June, workshops were conducted in 3 districts, Fezile Dabi, Qarib, and so they participated in that, in the program. So there's a number of schools participating in Kosi Albert Lutuli oral history project. All districts, they say, all districts participated in the project. Running to program 3, independent schools, percentages of registered independent schools visited for monitoring and support. The annual target was 84%. They reached 71.7. Fewer schools were visited than the planned target. Hence, they have deviated on this one. And on program 4, output 401, number of learners in public special schools, 6,800 was planned and 6,571 was their output due to the deadline. The deadline indicates the move to comply with the WP6. They will come and explain what is the WP6 mandate of full inclusion of learners experiencing moderate to high levels of needs in the public ordinary schools. On output 402, number of therapists, specialist staff in public special schools, the target couldn't be reached. It was at 106, no new appointments for the quota. A number of schools of skills implementing the technical occupational curriculum. One school, Refihlile, has established a specialized wing. Refihlile is in Botshabelo. It has established a specialized wing that is currently operational. And the process to convert a wing of 10th school, Rosenhof Special School, is underway as teachers have been trained and registration has been applied for through SAMS. I'll run quickly to 404 output number of special needs provided with additional sensitive assistive devices. Procurement process are in progress. They're still procuring for the special schools special devices. Learners with special needs. The devices are still on the process to be procured. Program 5, early childhood development. Number of children accessing registered ECD programs. The annual target was 82,500. The achieved output is 79,393. Data capturing of children accessing registered ECDs program has not been finalized yet. And also, I'm also suggesting or recommending that honorable members can probe on this one, because if honorable members can remember that the early childhood development was migrated from social development to the mainstream. So here they are talking about the accessing of registered. There are those that are registered centers outside the mainstream. So their registration has not yet been finalized yet. On the output indicator 505, number of learners in grade R. So they have the target of 43,585. So the achieved output was 41,613. The number of 41,613, the deviation was caused by learners in public schools. No data on the number of grade R learners in ECD sites on the EMIS data warehouse for 2025. So that also poses a question to say why there's no data on the number of grade R, those huge number of 41,613. And on output indicator 506, number of grade R practitioners, educators trained on CAPS. So 650 was the planned target, but now the output was 214. There's training that is continuing during the remaining quotas. Also on the output 507, the pre-grade R practitioners, their training also is continuing during the remaining quotas. On infrastructure, honorable members, program 6, infrastructure development, indicator 601, number of public school provided with water infrastructure. The target was 24, they reached the target, the output of 1, meaning their deviation was caused by the remaining projects are currently in progress at various construction stages. And the output number 602, number of public schools provided with electricity infrastructure. Several projects are currently in progress at various stages of construction, so they reached a zero target. So which also poses a question to say, if you have planned for 13, now why now did it give an output of 0? And then the reason is several projects are currently in progress, but the output is 0. Indicator 603, number of public schools supplied with sanitation facilities. The output is 2 out of the planned target of 10. Remaining projects also are currently in progress. The department will come and respond on that one. The number of schools provided with new or additional boarding facilities, 1 school, and the target achieved is 0. So meaning the project, they say, is in progress. Mostly on the infrastructure, honorable members, the projects are in progress, and the remaining projects also are currently in progress, all of them. Hence, they couldn't reach their target. I will quickly run through the program 7 examination. The department is awaiting the NCS results, which we know will come in January, to be released in January 2026. On this one, there's no planning. They are waiting for the results in January 2021. And the findings are, the committee should note that program 6 on infrastructure, that all projects are still not completed, and there is no clear indication of when the end date of such projects will be. So it is recommended that the committee conduct an oversight visit to Rosenhof Special School, whereby the department will inform the committee about its place. In conclusion, some of the targets set could not be achieved, therefore the department set unattainable standards. Thank you, honorable members. Thank you, Chairperson. I will move to the Department of Social Development quickly. And the Department of Social Development, Chairperson and honorable members, the introduction is the Department of Social Development has a core mandate from the Constitution also of the Republic of South Africa, 1996, as embodied in Chapter 2, the Bill of Rights, that emphasizes equality, human dignity, freedom and security of the person, health care, food, water, and social security, and rights of the child. So the purpose of this analysis of the first quarterly performance report is the Department of Social Development is to help enhance the oversight function of the legislature over the department and to assist members of the committee to optimally discharge their duty of holding the department accountable. The Department of Social Development has 5 programs, honorable members, as stated on the slide. The underperforming indicators, the department has planned underperforming indicators program 2 with 2 indicators that were not achieved. Program 3, 2 indicators were not achieved. Program 4, honorable members, 1 indicator was not achieved. Program 5, 2 indicators were not achieved. So the program performance report, program 1, which is administration, under sub-program cooperative services, the number of workshops on prevention of irregular, fruitless, and wasteful expenditure conducted. There was no planning on this one. So the department will come and answer why it was not planned. On number of social services professionals appointed, also the department did not plan for it. On program 2, social welfare services, services to persons with disability. The number of persons with disability accessing services in protective workshops. The department for this period under review, they have the target of 880, the output was 877. They achieved 99%. The deviation was 3 beneficiaries from epilepsy South Africa are no longer accessing or attending the service. So there's a question also on this one that they will come and respond on. On sub-program HIV and AIDS, number of implementers trained on social and behavior change programs. The department has a target of 112. The output was 72. The percentage achieved is 64% on this performance indicator. The deviation was the underperformance resulted from 2 districts that could not conduct training. In Fezile Dabi, the organization received funding in mid-June and therefore could not travel. In Karib, district has postponed the training which was scheduled for June. Program 3, Children and Families, under sub-program Child Care and Protection Services. The performance indicator is number of family members participating in family preservation services. The target was 2,725. The output is 2,507 at 92%. The deviation was caused by service is needs-driven. It depends on the members that are accessing the service. In sub-program community-based care services to children, performance indicator was number of children reached through community-based care prevention and early intervention programs. The department also reached 74% on this one due to fewer children attended the program than anticipated. Program 4, restorative services, under sub-program victim empowerment. The performance indicator is number of victims of GBVF, gender-based violence, femicide, and crime who access sheltering services. The department reached 80%, the output was 36, and the target was 45. The comments of deviation is the indicator is demand-driven also. It depends on the willingness of the victims to access the service, hence the deviation. In Program 5, Development and Research subject, the sub-program is Community-Based Research and Planning on our members. The performance indicator is number of household profiled under the Community-Based Research and Planning. The target was 1,484. The output is 702. They achieved 47% on this one. Underperformance was due to capacity constraints and appointment of implementers. And also on the performance indicator, number of community-based plans development, the department achieved 80% on this one. They couldn't reach 100% due to adverse weather conditions in Kwakwa affected the implementation of the community-based planning processes, forcing it to be rescheduled. Honorable members, this was all for the department. The recommendation is, it is recommended that the committee may continue to probe the department, but the questions have been crafted for the department to come and respond. In conclusion, department achieved a total of 84% of the targeted 45 performance indicators for the quarter under review. 7 indicators representing 16% were not achieved. Program 1 achieved 100%. And I thank you, honorable members. That is all for social development. Thank you very much, Chairperson.
No, thank you very much, Mbebe. I think we'll receive the presentation here. I'm not so sure. I want to check with the researcher as well. If it will be long, Leon. It seems like the one that we just had took about an hour or so. And we restricted it to 30 minutes so that we take all presentations. Provincial Treasurer, if we receive a presentation from you, and thereafter a brief presentation from infrastructural development as well. So perhaps if we can cut it down to 20 minutes each. Financials and infrastructure, there are a whole lot of things that cut across here, and if we do that, maybe We'll thereafter take a break just to nibble on something, and then we'll allow the departments to come in. Yeah, Treasury? By the way, honorable members who arrived late, welcome. We find us started. You're most welcome, Chair.
Chairperson, just if I may, I want to congratulate everyone who's been helping us, assisting us with these evaluations. It helps us a lot, and it's of high quality, so thank you to everyone. If we can continue in this trend, and this is exactly what we needed in our committee, so congratulations to everyone. Thank you.
Thanks very much. If it's welcomed by members of the committee, maybe they are quite empowered now to go execute their duties. And I must hastily indicate that we had received an apology from the MEC of the Department of Health. It would seem like the HOD is also not here. And I'm getting a bit worried. Last time when we had attended the oversight visit in Hop House, the MEC is here, but we had received the apology. Education. MEC of Education is not here. The HOD, not here as well. But let's work. Let's work. We'll elaborate on those once we get there. What then do we do? How to proceed forward, because I feel slightly hamstrung when we need to execute duties and we're held back by the absentees of members from the departments. Honorable Leach?
Thank you, Chairperson. Not to prolong the issue, but this is now becoming a trend of MECs simply not attending committee meetings. We had the same issue at our Propac meeting as well. It's not an optional, and I mean, I would think that you'd at least then the HOD should be present, but education is the department that receives the most finances. They receive the largest portion of the budget. I would think that they should be the ones that come and report, especially given the numerous problems. So, thank you.
That concern is noted. I'll allow the discussions at the right time. I don't know if it's about an apology as well, because I want us to be decisive and come out of this meeting with a resolution what's going to happen, because from the Rules Committee yesterday, there was a serious reservation about answering of questions, also attendance, even to sittings, full-blown legislature sittings. So as such, we can't hold anybody accountable anyway, but I'd like us to deliberate on this matter slightly later when it concerns the department. Let's not hammer everyone, at least some departments perhaps are here. So maybe let's apply ourselves when that time is here. I don't know if I'm pushing you back, Honorable Folk.
Thank you, Chair. No, you are not pushing me back, Chair. But you said what we said yesterday. It is important that we must bring it to the attention of the committee that we raised that issue, and we said we don't want to be undermined. I repeat what I've said yesterday. I bring it here purposely so that honorable members, they must understand. Now we are starting working. We have a chance to train ourselves. Now we are trained, now we are working now. We are on point. Thank you very much, Chair.
At least when you've been training yourself with full salary, maybe we should reclaim, start with you to account. Provincial Treasury.
Greetings to the Honorable Chair of the session, as well as the members. My name is Pakiso Lebone. I'm with Date Modisani. who's the acting chief director in the provincial treasury. I'm looking at Puseletso, Chair, whether there are rituals that we ought to undertake, but she says I can proceed without any rituals.
Not today.
Okay.
Today.
All right. Now, thank you very much, Chair. Without really wasting time, our presentation will cover the first quarter expenditure for the province as well as the revenue performance for the province. Chair, we have a presentation layout in terms of slide number 2, wherein we will be covering those issues. Under expenditure, we will look at how each department is performing. We will also look at different economic classifications, and then we'll look at goods and services, compensation, transfers, CAPEX, as well as conditional grants and infrastructure. There are also recommendations that we are advancing to this honorable committee in this regard, Chair. Chair, I will skip the purpose. In terms of the performance, when we look at provincial owned revenue, it's slide number 5. The province, Chair, has set a budget of roughly over 1 billion on own revenue. We have a budget of 1.2 billion. Of the budget of 1.2 billion, we have collected 320 million thus far. The percentage-wise, Chair, we are slightly above the norm of 25. We are sitting at 26.3%. Chair, when we look at different departments, you will notice that there are departments that are indicating that they may over-collect with regard to own revenue. One of them is the Department of Public Works and Infrastructure. The rationale behind projected over-collection relates to the sale of the asset, which was actually meant to be sold last year between the department and the CUT. The transaction only happened in the current financial year. The other department that is also indicating the projected over collection is the Department of Education, although it's just a minor 2.5 million. So lastly, we also have Department of Social Development with 133,000. This one, Chair, relate mainly to the refund on the NPOs. Usually when the funds are transferred and then there are some conditions that are not by the NPOs, the department does not transfer or they will stop the transfer to the NPO up until a point wherein they are meeting the requirements. Now, Chair, if I go now into slide number 6, I'll try to move with speed in terms of the time that has been allocated. Chair, as I've indicated, we have a budget of 1.2 billion. We have collected 320, and then we have thus far collected 26.3%, which is slightly above. I have indicated, Chair, that there are departments that are showing that have basically collected over the norm. One of them is the Department of Education that I've alluded to. We also noticed that the provincial treasury has collected above the norm. It's sitting at 65% thus far. The budget that we have set ourselves, Chair, is 31.5 million, and then we have collected 20.7 million. The reason why there's huge over collection, Chair, it's because of sometimes we link the money that we received, and then if there's a slow expenditure, we invest the money. So that really yield positive result on us, because there will be interest earned from the investment that you are making. So that is why you can clearly see that we are sitting at 20.7 billion, which translates to 65 at this point in time. But as the expenditure increases, there will be less money that we would be investing. So hence, you'll see that the picture would really change as the year goes by. The other department that has collected more, it's Public Works, as I've indicated. We also looking at the main revenue collector, Community Safety. It's sitting at 25.1. We don't really worry, because they are right at where more or less they should be. Agriculture Chairperson has collected over. The budget is 5.7 million. They have collected 2 million, which translates to 36.4%. The reason for over collection is around the abattoirs, as well as veterinary services that have been requested. Chair, we also have human settlement, though it's 595,000, they have collected 34.6%, primarily on the refund from the FLIPS grant. Chair, I think this is where we are, where we should maybe be worried, although we are managing that. It's primarily in one department, Department of Health. The budget for Department of Health is 150 million. The collection for first quarter, it's 16.9 million, which translates to 11.3. What is really happening, Chairperson, you'll recall that we have the budget for Lesotho, which relate to referrals. We also have a budget for a road accident fund that we must also get, as well as justice. So if I'm looking at numbers for Lesotho, we are supposed to recoup 101 million. And then for RAF, we are also supposed to recoup roughly 76 million. But we know that they are not paying us the exact amount that they owe. So with road accident fund, there has been some engagement with the road accident fund, with the Department of Health, as well as Lesotho. So the reason why we are sitting at 11.3, it is primarily because of those reasons: Lesotho, road accident fund, as well as the justice. But there are engagement that are happening between road accident fund as well as the Department of Health. Chair, one other thing maybe that I can also mention to the honorable committee with regard to own revenue is the Department of Sport, that it's currently sitting at 17%. Chair, I need to indicate that from the budget of 3 million, we are also anticipating that there would be ticket sales from the arts and culture that will be happening from tomorrow. So we are anticipating, if all tickets are to be sold at maximum capacity, more or less 2.5 million from Makufe. So that is why it is also low at 17%. Chair, the next slide, it's about the economic classification. As I've indicated, most of items are on par, with the exception for health patient fees, when you look at slide number 7. Slide number 8, Chair, is just the graphic percentage. Hence, we have indicated that the biggest concern for now is on health, as well. Department of Sport, we may not necessarily be worried, because they would be getting some money in the form of ticket sales. Chair, the next slide, which is slide number 9, we are always comparing how we have performed each year for a specific quarter. If we look at 2023-24, Chair, we were sitting at 15.5. Last year, we were sitting at 24.5. Currently, we are at 26.3%. What we are planning to do, Chair, in future is to also compare Free State with other provinces in a specific quarter, just to also check how other provinces are doing. But with regard to own revenue, Chair, we are one of the provinces that is doing well relative to other provinces. But we will be able to perhaps in future bring that just to compare ourselves with other provinces. The next session, Chair, relates to the expenditure. If we can now turn to slide number 11. With regard to the provincial expenditure, Chair, we have summarized it. Our budget is 45.8 billion. To date, we have spent 11.2 billion, which translates to 24.6%. If we are to compare that against the norm of 25, we are slightly below the norm by 0.4. We will articulate why we are behind the norm of 25%. But Chair, we need to also be upfront and also indicate some of the risk in our provincial budget. We have Department of Education, Chair, which pose a risk in terms of possible over expenditure, primarily on compensation of employees. We also have the Department of Public Works that is also posing risk in the budget, primarily on the municipal services, rates and taxes, as well as the leases. The legislature, Chair, it is also posing a risk in the budget. Yes, primarily around the issues relating to direct charges, which we have received the letters from the legislature, wherein they also articulate that there's a budget pressure of close to 65 million. Then the other department is community safety. They are also, they have identified a risk with regard to compensation of employees, primarily on security services as well as law enforcement, the traffic officers. So I just thought that it is important that we also highlight. But what is it that we are doing, specifically as Treasurer, as the department that is doing oversight? Chair, we have engaged the Department of Education regarding their over expenditure. Firstly, we made an undertaking that we understand that the budget may not be sufficient, specifically on compensation of employees. We also understand that there were penalties which were imposed last year around SARS as well as government employee pension fund, which also exacerbate pressure on their side. But what we were also looking was that let's not only look at the injunction, the budget allocation, but rather let's look at some of inefficiencies as well as efficiencies that are there. Now, we have received a letter from their side in terms of what they are trying to do in order to deal with the over expenditure. Part of the issues that they are doing, Chair, without really wasting your time, the department indicated that they have centralized procurement to the CF.
I'm sure you can see that there was also indicating that you should not make a speech. Yeah.
Okay, Chair, they have indicated some of the measures that they have taken. Some of them, it's around closing some of the schools that are not viable, especially those with less than 50 learners. They have also indicated that they are delaying filling of some of the posts that are not critical. But Chair, let me pause here, but they have given us the whole list of the things that they are doing. Though they have given us that, from our side, we are of the view that that must also be quantified. If you are saying you are going to delay the post, filling of the post, what are the anticipated savings? Will you close non-viable schools? What are the savings out of that? So we are engaging them. Public Works also, we are also engaging them, Chair. But the other thing that we are also doing to deal with these challenges, it's around the budget baseline review, where we are identifying those inefficiencies in various departments and try to channel money where it is mostly needed. Chair, let me now move to slide number 13. In terms of slide number 13, Chairperson, we have indicated, as I've alluded, where the pressure points are. But generally, if we look at some of the department, I will go straight to Department of Health. They have spent 22.1%. The challenge currently is around spending on conditional grants, primarily the infrastructure, Honorable Mekwe. They are sitting around 7% there. The Office of the Premier sitting at 19.5. The current under expenditure is on the earmarked allocations. And then we also have Provincial Treasury, which is also sitting 18%. The slow expenditure is on compensation of employees.
Perhaps now focus on these three departments, that health, education, and social services. Anything perhaps beyond that, other members, I think they still have privilege to sit in your committee, so you'll take them into confidence there.
Thank
Just in the best interest of time.
Thank you very much, Honorable Chair. Honorable Chair, I think I will then go straight to maybe the conditional grants, which is slide number 20, but the focus will only be on those departments. Chair, generally, in terms of our conditional grants, we have spent 21.9%, but looking at Department of Education, on grants, there are overall 22.6%. There are no worries thus far, but there are just two grants that are always posing a challenge. The Maths, Science and Technology, year in and year out, they are underspending. The other one is a learner with profound. They are sitting at 14.9, 14.5, but there are always challenges. Health, Chairperson, all grants are fine, but our biggest concern is on the infrastructure, health facility, where they are sitting at 7.9. We have tried to assist in terms of ensuring that they are weekly run, just to expedite expenditure on this. There were also issues around the old invoices that they were trying to purify and ensure that they are paying right suppliers and they've followed the processes. Social development, Chair, I think it's primarily on the EPWP. So currently they are low in terms of their expenditure, Chairperson, on the EPWP. Chair, I'll go to slide 23. Just on infrastructure at high level, we are sitting at 23.7%. The Department of Education, there are no worries. They are sitting at 24.4, but health 7.5, as I've indicated. And then Department of Social Development is at 15, but they have shown some progress. Chair, I think I will have to pause here because most of the recommendations are primarily for this Honorable House to note, of which most of the things have been presented. I thank you, Chair.
Members, you would note that I'm advised that you already have questions sent to you pertaining to the financials. So should you want to at least extract some information from the department, you already have the questions from the research section here, the Propac committee. Honorable Clute.
Thank you, Chair. Just two questions to Treasury. So it looks like the projected over expenditure for the Free State will be 2.2 billion at the end of the financial year. Do I understand correctly that the main contributors to that will be education and community safety on their COE? That's the one. And then the education conditional grants, the math, science and technology, the 7.1%, which is very low. What are the plans? Well, maybe you should ask the department, but do we know exactly what this grant is for? And what are the discussions with the department to improve that? That's my questions. Thank you, Chair.
Maybe note that as well when we interact. I think after this session, I'll allow the provincial treasury to answer questions, and I wanted to allow questions and answer sessions immediately after a recess at 10 minutes, because I'm slightly worried that some members were complaining that we were very much unfair to them. So I wanted them to grab something quickly and then come back to. Okay. Due to delay in that catering department, then we'll take questions on the right way. Honorable Khwabane is co-chairing, so I'll take Honorable Leach and then.
Thank you, Chairperson. In terms of education, the penalties that were charged to SARS and the pension fund, what is that amount? Then also the interest paid on the overdraft, what is that amount for the last financial year? And then what is the current overdraft amount of the education? And also what is the deficit in which they started due to the non-payment of SARS and the pension fund? So in other words, with what deficit did they start this financial year? Thank you.
Chairperson, I didn't hear that Elbora talking about Northern Cape and Eastern Cape in relation to revenues expected for the health department. Because unless if those two provinces are no longer referring their patients to Free State. Also, the increase that was indicated that there's been improvement in terms of the revenue collection in relation to the past two financial years. I don't know whether, because it's not indicated, that increase, is it a nominal increase or increase in real terms? Whether it's increase in nominal terms or in real terms. And I think that is all.
Perhaps you can also take us into confidence of this thing, the conditional grants, especially pertaining to health infrastructure. I'm trying to understand, is there any way you are assisting health as a department to deal with the issue, spending of these conditional grants? Free State is slightly becoming notorious of returning the conditional grants, and our health system is below par. I don't want to because numbers were laid bare right before us. But when it comes to infrastructure, a whole lot of stuff, rating from, we just got a presentation from the researcher that there's serious challenges there. So are we helping them anyhow to expedite the process of spending that conditional grants before it gets returned to national treasury?
The pressures that we talk about from the legislature, are you expecting, is it that you're expecting over expenditure by 65 million from the legislature or what?
Yep. Is there any other question, members? Let's allow the gentleman to answer. The last one.
Thanks. The overall performance, that's where my question arises. Should we be worried about agriculture again in terms of the spending patterns? Because the percentage is where it is. I think it's still giving an indication of low performance, as well as public works. Is Treasury worried about them as of now moving forward? Thanks.
Thank you very much, Honorable Chair and honorable members. Chair, maybe let me start this last in, first out. Let me start with the last questions from Honorable Mekwe. The performance of agriculture, for now, Chair, we should not worry. What happened was that there was a delay from the department side, because we probed them to say, always there's a delay in terms of approval of the business plan. Who actually caused the delay? Because this is something that is in the grant framework. So there were delays internally from the department. So we engaged with them. They indicated that they have finally reached an agreement with the national department. The business plans have been signed. So we should not really worry, because the type of procurement or the method that they have taken, it is no longer the internal, though it's a mixture internal, but there's also element of the transfer, which really takes longer. But with regard to transfer, we also indicated the issues around the controls, that they should be able to account for the money that has been transferred. So we should not really be worried, Chairperson. Same as a Public Works Chairperson, we should not be worried. The spending on health infrastructure, Chairperson, that is sitting at 7.9. We have engaged with the department about the plan. Firstly, what they were trying to do, they were dealing with accruals from the previous financial year, but they were careful in terms of who are they paying, because there were issues around their accruals. So they have gone through a process of purifying those accruals. Now, what we then requested them was to say, since you are now sitting at 7.5 and your accruals, they are around 400, and in the budget for current financial year, it's roughly 600 million. We then said, how are you going to reconcile and ensure that you are moving swiftly? From our side as Provincial Treasury, we then said, we have received your money from National. We will be able to assist you with weekly disbursement run, primarily on health facility grant, as a way of ensuring that they don't come back and say, no, we could not spend because there was no disbursement run. So that has been agreed with them. So prepared that submission as a way of expediting their expenditure. The legislature, I need to confirm, Honorable Khwabane, that indeed there is a projected over expenditure on their side of 29.4 million. They have written to Provincial Treasury and they are basically requesting that we reconsider our decision regarding the direct charges. So the view is that the remunerations from the members must be paid directly from revenue fund. It's a matter that we are trying to look at relative to other provinces, but there's that challenge of 29.4 billion. Million. Chair, you ask about the improvement in revenue, whether it's in real term or nominal. It is in a real term, Chairperson, but we were comparing it was year-on-year comparison to say, in a particular year, we were sitting at this percentage, and then the other year. So it's in real terms because this is the money that is really in the bank account or revenue fund, if I can put it in that manner. Also, the other provinces are indeed, Chair, they are still.
Real terms.
Yes.
Yes.
Yes, it's in real terms.
Real terms. Real terms does not mean necessarily money, the money that you see. Real terms it's an increase in relation to the revenue based on the debt that it accumulated. That's what I mean. Real terms, not nominal. To say last year it was 100 rand, this year is 200 rand. But that 200 rand must take into consideration material conditions on what is it based on. That's what I mean.
No. Through Chairperson, because remember, even in our assessment, we made an example about Lesotho, that currently they are sitting at 101 million that they are owing us. But if you look at what they were owing us in the previous years, it was a huge amount. Same as RAF, it's now sitting at 76 million. I can't remember exactly the one for justice, how much is it? 33 million. So if you look at the previous debt relative to the current debt, you'll then realize that it's in real terms, Chair.
Okay.
I don't know if it's clear, Chairperson.
We'll discuss it outside.
I'll allow Batshwa Treasury to go deal with the businesses, study nominal and real a bit later. For now, I'm particularly interested in certain matters pertaining to, although financials, but pertaining to this committee. It will assist us a great deal, more so when we're going to. I've noted you, Honorable. It's just we'll allow him to finish. I'll take one last round, maybe up until past. I want to allow the Department of Health to come in. So perhaps if we could be slightly sensitive to time.
Okay, Chair, with regard to the questions from Honorable Leach, the deficit overdraft, if I can call it, I usually call it technical overdraft because it's overdraft for just few days before, just at the beginning of the financial year, and then once we receive money, we assist the department. It does not even take 15 days. But having said that, it's around I don't have the exact figure, but it's around 1.5 million, 1.5 billion, but I'll just verify. And then with regard to the interest, Chair, I don't have the exact figures.
You are protected, Ishwari.
Okay.
These members are now starting to be out of. I don't know what are they disrupting you for. He's been complaining about food ever since arrival, but we'll sort him out. Continue, please.
Thank you very much, Honorable Chair. So, Honorable Chair, as I've indicated, the overdraft is in a region of 1.5 billion. And then with regard to specifics around SARS and GEP, the interest, I don't have the exact figures. I would consult just to get the exact figures, Chairperson. And then I think from Honorable Klute, it was just confirmation. Yes, it is the Department of Education, Public Works and Community Safety. But Department of Public Works, it is really around accruals, so they don't necessarily overspend at the end of the year, but they always have accruals. But it is important to indicate that it is a pressure that is there, but they don't go beyond what is allocated. But as you know, during the adjustment budget, we always try to assist them by giving them additional money for services. Chair, I think those were the questions. I'm not sure, Mr. Mudisan, if you have the specifics around the two. Okay. We will provide them during the course of the day. We'll just consult the office. Thank you, Chair.
HOD, when you speak about the accruals, especially from health, you talk about them as if it's a small issue. And I'm glad that, the legislature is doing this joint oversight. I wish the Department of Economy was also part of this meeting. The crisis those accruals are causing out there. Almost a year that contractors have not been paid. It's a big issue. Okay, let me not lament the chair. Let me ask the HOD a direct question. What is your understanding about that situation? Why has health got into that? To what an extent are you guys helping them? Do you believe that ultimately that problem will be resolved? Not as a financial, what do you call it, equation or concept, but in relation to the impact it has caused. I'm sure many businesses, Chair of Economic Development, have been taken out of business as a result that, it takes a year people have not been paid. And some of them have done work for government. Thanks, Chair.
Thank you, Chair. I think we should take note of the recommendations and conclusions, especially 4 and 5. No, 5 and 6. It says that we should note the departments must fully comply with the DORA requirements to avoid non-submission or late submission of the required monthly reports, as well as that all monthly performance reports must be signed and approved by heads of departments as per the DORA framework. Now, I'm just wondering, Treasury wouldn't put this in there if they wanted some usual suspects in this regard. So can we maybe get an indication who are these usual suspect departments who are not complying on these matters? Thank you.
Thank you very much, Chair. Chair, my question is directly at Provincial Treasury, noting their own provincial expenditure in terms of the first quarter. It's only at 18%. I can recall from last year there was an issue with slow expenditure on the COE of the appointment of skilled individuals to go and assist. I think it was in program 4 or 5, municipal financial management. That 7% is not a lot that they're below par, but could they give us an indication what is the reason for the slow expenditure? Is it again COE issues with appointment of these specialists or CAs to go and assist municipalities? And then in terms of the economic classification, there is an over expenditure on interest and rent on land of 1,710%. If we could just get some background, what is that over expenditure there on interest and rent on land? Where does it come from? Where does it emanate from? Page 14. Thank you, Chair.
No, thank you, Chair. I'm covered by that question of 18%, Chair. But I'm worried, Chair, where I'm seated now. Your department, Chair, is posing a risk. It's posing a risk. But the education, Chair, the education. But now I hear the acting HOD talked about, we must not be worried. We are worried, Chair, for the fact that the departments, 3 departments are posing a risk. We're supposed to be worried. So thank you very much, Chair.
Okay, lastly, actually, the education over expenditure, can't be when you ask questions, but now we keep silent, and then now when we ask questions. Yeah, no, we'll send them home early. The issue, COE, Department of Education. I think I'm with Honorable Foko. It's worrying. With how much have we gone, and are we anywhere near in cabin this thing? It looks like, and this is the center. It's right at the core, yeah, because you can't even the Department of Education can function without that human resource. How are we planning to deal with it, and when are we looking at? Because it looks like if we it's just a mess. Perhaps if we can be taken into confidence.
Thank you very much, Honorable Chair. Honorable Chair, starting with the health accruals, I need to put on record to this Honorable House that we are equally worried as Provincial Treasury, to extend that we requested a clear plan in terms of how the department is going to deal with accruals. As I've indicated, Honorable Meko, we've got accruals of about 400 from the last year. Now, the new budget is 600. Now, our question to the department was that you've got accruals of 400 from previous financial year, you've got a budget of 600 in the current financial year, and yet there are projects that you must still undertake. Firstly, what is the root cause? Secondary to that, have you really implemented consequence management? Now, Chair, they have given us a plan which we can share to the Honorable Committee. If I remember well, almost per year they are planning to spend 156 million just to address the pressures from previous financial year. Obviously, that has implications on the current projects that they must do. We also indicated that in order for you to deal with that, it then means you must also consult the national so that you don't commit or overcommit the current budget. So it's the issue of accruals. They may not take 1 or 2 years for the Department of Health, but we are equally worried, Honorable Chair. Hence, we have requested that how do we reconcile? How are they going to manage cash, as well as ensuring that they are addressing accruals? And at the very same time, as I've indicated, we were worried about their current expenditure, which was at 7%. Hence, we make provision that we will be able to assist you to process payments on weekly basis up until a point wherein you are really on par with regard to the expenditure. So the real cost was around where they have committed the money. They committed money primarily on the designs rather than the construction. So that is where the challenges were. But they have presented a plan in terms of how they are going to address the accruals. We are worried, Chair, as I think as a province at large. Coming to the provincial treasury, which is sitting at 18%, indeed, Chair, the challenges of last year were on compensation of employees, delay in filling of the post. We have prioritized some of the key posts, specifically the director's post, which we are also filling, but we have also already prepared a submission for the financial aspects, of which the submission is at advanced stage. The idea was that they were supposed to start now in September when we engage with the AFS of the municipalities. So, Chair, That is one issue. The other issue was on the infrastructure. Also, we will be advertising the post for the director for infrastructure, which looks after both infrastructure for municipality as well as the departments. So, yeah, I think it's financial aspects which I've dealt with. The other one, it was on the interventions. We have also prepared the submission. So primarily it's around the personnel in terms of the provincial treasury. So we believe before probably November, we should be having those people. The other one would be assisting Machabeng. The only thing was that the clearance, we were just waiting for the clearance for that specific person. So we are trying to move swiftly. With regard to education, Honorable Chair, the amount that the department is behind, specifically on compensation of employees, it's 996 million, which is very close to $1 billion. We are worried, Chairperson, the issue of education, just like accruals in health, it is not something that we may address in 1 year, Chairperson, but our take was that if at least per year we can try to address it and reduce it. So this is where we have a biggest challenge. So what I was trying to also demonstrate was that firstly, we acknowledge that the budget may not be sufficient, but what is it that they are doing to address that? I think it's the one that Honorable Khwabane said I must not make a speech, but we do have a plan that they have presented to us. The only concern from our side was that that plan did not have numbers. It was not quantified, so that we can see that if they're saying we are delaying filling of the post, what are the savings? If they're saying we are closing down non-viable farm schools, what is happening with those teachers, as well as costs relating to that? How much and how many and where are they? So it does not really have specifics, so we are still engaging on it. But the biggest challenge is that the issue of compensation of employees will be with us for maybe 4 years or so of education. But what we are also doing from our side as provincial treasury, we engage National Treasury, Free State, Northwest, as well as Gauteng, primarily on the equitable share card. We ask to be cushioned like they have done in other provinces. So obviously when we deal with the budget, we may favor education just to address partially some of their pressures. But at the very same time, we are saying to them, deal with your own inefficiencies, because one of them is around people that are in long incapacity leave. Remember, in education, when one teacher is not there, immediately they must appoint, even when the other ones are on the maternity leave. So those are some of the additional money, cost relating to compensation. There was another question on interest on land. I think Mr. Mudisani can take it, Chairperson.
Good morning, honorable members. In fact, the interest, it's mainly on the main part of the interest. It's the penalties and to SARS and interest on overdraft. Okay.
Can be slightly quick? I want us to allow the departments in more 45 minutes late, as always.
The 2.7 billion, the 2.7 million, it's mainly on the penalties to SARS and interest on overdraft, and penalties to GPF. Yes, that is the major portion, but in terms of giving the detailed information about that, then we will come back to the committee. Thank you.
Members, can we agree that let's allow the departments in? First start with health. I don't know how ready are they. Perhaps we can allow them in. You would remember that they owe us a lot. So perhaps they'll sit here the longest and do their presentation. So if we can just be mindful and I know last time we cut them some slack. So let's get, I think it's fourth quarter, first quarter, there's a whole lot. Oh yeah. Okay. Good morning, MEC and the battalion. So Rebesa ka Matlakala. We apologize that we held you a bit longer. We had to deal with a whole lot of stuff that needed our attention pertaining to your department per se. So, Madam. So if you are settled MEC, you will quickly hit us with your opening remarks so that those that need to take an oath and do presentation, we allow Mera Mutiwa to deal with them and speedily deal with a long list of your presentations that you need to take us through today.
Morning, Honorable Chair, Honorable members. All the staff that is here. Thank you very much for the invite. Yes, we are here to come and make a presentation. Amongst us, we have the team that will be doing the presentation, and I'm sure our request came through for our HOD and the CFO to connect virtually, because there's also other engagements that were scheduled quite prior, and we've been struggling to get an appointment with the University of the Free State for the past 2 months, so we couldn't afford to miss that one today. Not that we don't take the legislature seriously, we do, and that is why we have a full team here that will be in a position to can respond. Chair, the team can do the routine, and then we can start. Thank you very much.
Thank you, Chairperson.
I don't know if those that are connected visually, I'm told there are members that are including the HOD, of course, if we'll be able to deal with them in terms of the oath.
Yes, Chair, we should. Is the HOD connected? I'll then start with him. HOD, good morning. Mr. Secretary, may I start with you then, while the HOD is still connecting? Thank you. Good morning.
Good morning.
Will you be taking an oath or an affirmation?
I'll take an oath.
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Christodoulos Sava Eleftherio.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you. May I use that mic? Good morning, sir.
Good morning.
Will you be taking an oath or an affirmation?
An oath.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Mpuse Mofokeng.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, sir. Good morning, ma'am.
Good morning, Madam.
Will you be taking an oath or an affirmation?
I'll be taking an oath.
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Tumelo Molongwana.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, ma'am.
Thank you.
MEC, I'm sorry, HOD. Can you hear me? Good morning. Yes. Okay.
Honorable Chair, I think we can go ahead solo. In the event, the HOD need to respond to something, then maybe at that point, we can then go through the process. But at this point, I think we can start. We'll be
Please do.
guided by you.
Please do. Who's leading your discussions, your presentations?
Based on the program, Chair, that was shared with us, we would like to get some clarity in that in the previous meeting, in the previous sitting when we were invited, the financials for 24-25 were presented. It's the fourth quarter, 24-25, they were presented. So if the committee could guide us, if we have to re-present them here, and then we can take it from there.
Okay, I'm advised, well, there are questions that you are still, accept the reports. Remember, we had to defer certain presentations for the purpose of this meeting. So we'll deal with those. But on top of those, there were questions that were sent to your good selves. So we must just confirm if you received them and maybe deal with them directly. So,
Honorable Chair, there are questions that were sent to us which we received on Tuesday, and we almost done with them. There are those that we do have responses on, and we'll be guided as to whether we submit them in writing or we can go through them in the meeting. But the responses are ready.
perhaps if they are ready responses, then they can be presented here. I'm also worried about your presentation of that strategic plan. It might take a while. So let's approach it speedily, that we cover everything, but equally afford enough time to present your strat plan.
Okay. Yes, Honorable Chair, we're looking at 19 pages of answers.
That's what I'm worried about. But
Yes,
your
but-
your department MEC owes us a lot as the committee. Maybe.
We don't mind, we can stay here for the whole day.
Okay, but you have, I want us to give you up until, let's give you an hour. Let me be generous and say an hour. So we're in your hands.
Can we submit this written
So-
and not go through them here? Is that allowed?
My worry is
the
that
answers.
there's a reason why we submit them, so that we make follow-ups in the committee.
Okay. So the 1 hour will cover everything.
I'd like to believe so, MEC. That's why I'm warning you around times, because we've been running slightly late in.
All right. Okay, Honorable Chair, thank you very much. Let me start with the responses. Firstly, we received questions about percentage of own revenue collected. And the question related to most of the revenue units at the facilities are not adequately capacitated. This hampers activities such as timely discharge and billing of patients' fees, as well as adequate follow-up, and this is our response. Where there is insufficient human resource capacity, the officials are not able to perform all the admin functions required to ensure that all processes are performed. Often the capacity issues lead to incomplete or incorrect accounts being processed. There will be no capacity to ensure that patients are discharged and that the patient file is processed for billing purposes. Number two, in some facilities there is no revenue system. The department is currently rolling out the HMS2, Hospital Management System version 2, and to all facilities with 2 of the regional hospitals, being Ditlhabeng and Mufumadi Manapo Mupedi hospitals, which are currently running on manual records and have been earmarked to be on the system within the third quarter of 25-26. The system will alleviate some of the pressures that are currently compounded by the manual admission and the billing system. The next question, how does the lack of adequate capacity within revenue unit at the facility affect key activities such as timely patient discharge, billing of patients, and effective follow-up processes? The answer to the first question also covered the second question. The following question, despite the department's scheduled revenue forum to consider the challenges at the facility level and how this can be addressed to ensure that revenue collection improves. And there is the sub-question to that, to what extent has the department's scheduled revenue forum been effective in addressing facility level challenges and ensuring improvements in revenue collection? This is our response. From the revenue forum resolutions, where from the revenue forum resolutions were taken and action log developed. The discussion centered mainly around Auditor General's findings and the challenges they create. As these actions are implemented and the findings are resolved, and there will be tangible results in terms of revenue collection. These are centered around day-to-day activities such as discharge, billing, following up on outstanding revenue. However, due to the financial limitations, the capacity, human capacity and systems, EDI, that will allow department to detect incomplete, incorrect information from patients will remain a challenge, and the revenue collection will need to be focused on better recovery trends. There's also increased risk that patient information provided is incorrect, and this leads to unsuccessful follow-ups on billings. This is also linked to the growing number of foreign nationals that are visiting our facilities. The following question, insufficient number of women-owned businesses with 51% shares for goods and services and the work procured. How is the procurement of specific goods, services, and works from women-owned companies being monitored to ensure effective implementation of the set specific goals? Honorable Chair, am I allowed to ask the team members responsible for specific portfolios to come in and respond?
Yes, you allowed MEC as long as they've taken oath and they'll preserve your time. We don't have a problem.
Okay, no, that is fine. I think our SCM, Chief Director, can come in and deal with this one. Oh, okay. Can she be assisted with taking an oath? No, she's here.
Good morning, ma'am. Please speak into the mic. Will you be taking an oath or an affirmation?
An affirmation.
And do you consider this affirmation binding on your conscience?
Yes, I do.
Please state your full names for the record.
Sina Mujapela January.
Do you declare what you're about to tell the committee is the truth and nothing but the truth? If so, please affirm.
Yes.
I affirm.
Yes, I affirm.
Please say that into the...
Yes, I affirm.
Thank you. Thank you, Chair.
Okay, you can assist MEC with the relevant question.
Yes, okay. Thank you. In terms of the monitoring of the procurement that the department is conducting with the women-owned companies, there is a monthly expenditure review of goods, service, and works that have been procured from the women-owned businesses, which is performed through using the triple PFA analysis report. Now, this analysis report is a new report that has been introduced by the National Treasury. So we are able to, this report is able to give us the percentage as well as the spend of the department in relation to our specific goals that include the women, youth, people with disability, as well as the Free State-based. So as a department, we are currently using this report to monitor our own performance. We further developed a strategic sourcing strategy as a department. Now, in this strategy, we have specified specific goods and services that we are now compelling the facilities to procure from the women-owned businesses. Now, the intention of the strategy is to make sure that we are able to reach the expected percentage when it comes to our procurement from the women-owned. Now, the third question talks to communication with service providers to update the CSD system with the correct information for it to be utilized in the selection criteria. And then the sub-question says, how effective is the communication with service provider in ensuring that the CSD system is regularly updated with correct information for use in the selection criteria? The department response is that CSD is a real-time system. It does provide real-time information updates. Now, because of the nature of the CSD, it is difficult to hold sessions with the companies to advise them to update their information. The only time that we will be able to conduct the suppliers and ask them to provide is during the selection and rotation process. This is happening because you might find out that you might check the company at 9 o'clock in the morning, the same day. That company is compliant. But when we go back to the system, 2 hours later or an hour later, the status have changed altogether. So because of this, the nature of the CSD, it becomes difficult to make sure that you maintain the compliance of the companies. But it does happen as and when we select them. And because it's a live system, the companies are able to update immediately, and the status will appear from a department side as updated.
Good morning, Honourable Chairperson, Honourable Committee members. In terms of question 4 regarding the prioritisation of the payment of accruals and payables, How does the department ensure that the invoices are captured on the system, Logos and BAS, where applicable? So currently, not all the invoices are captured on the system. The main reason for that is the system creates a budget block. So to alleviate that, we've narrowed it down to certain limited service providers. In the main, we target the medical depot, which is our medicine, so that we then basically procure that with a manual action log. Laboratory services, which is through NHLS, and we've got some infrastructure, historical payments that are also outside the system. The budget block gets created due to the budget shortfall within the sufficient spending of the department. So if the committee recalls previously, we've explained how we have a cash imbalance. So where we have a budget of 14.1 billion, we have 800 million short in cash because of historical and authorized expenditure. So to alleviate that and to spend the 800, we do procure then outside the system, but we put a manual process in place just to reconcile that. So therefore, to ensure completeness from our side, we do reconciliations of our invoices. Our finance team monthly is also requesting information from the facilities and the cost centers, as well as from service providers, to ensure that we do a reconciliation so that we have a complete total picture of the financial debt that we have. And then for the reconciliation items that we do identify, we then instruct facilities and cost centers to periodically then load them onto the system as we get our budget adjustments and extra allocations through the appropriated budget process. As the department is on this journey to improve its financial status, the amount that we have outside the system is reducing. So, for example, we are now in the month of September. We've managed to clear a lot of backlog of the historical financial year. So currently everything is then coming onto the system, but we do know we're going to get a point in the financial year where the budget does run out for the services that we need to deliver, and then we'll have to manage that slightly outside again. In total, the progress is there. We've managed to decrease our accruals and payables by 120 million year on year. So we are moving in the right direction to make sure that we are within our budget spending going forward. Obviously, it's a bit of a balance between not overcommitting the department, but ensuring that the service delivery is on the ground. Then just some of the other measures in place. We obviously do date stamp and our invoices. There's an invoice register that we keep in place around that. We also have a verification against the purchase orders, the delivery notes, and the contracts. We do have segregation of duties between the capturing, the verification, and the approval processes. We do capture onto Logos and BAS once that budget block is released, and we're able to do that. And then on a weekly basis, we are reconciling, as I said, the three-way matching. So it's the invoice register, which is outside the system, together with BAS and Logos. So we do keep track of the financial records. And then we do draw monthly exception reports to target certain facilities that are behind on their spending. And then lastly, we obviously then have oversight that is played through internal audit and provincial treasury that also play their oversight roles on that. Chairperson, committee members, in terms of question 5, just under financial management, what measures are in place within financial management to ensure that the availability of cash, to ensure that all payments at awaiting disbursement stage are released and dispersed monthly. So within financial management, we have several control measures that are implemented to ensure that there's sufficient cash available to meet obligations and that payments that are awaiting disbursements are released and dispersed on a monthly basis. However, it must be noted that the department does have the cash versus budget imbalance. So we do get to a point where the budget is available on the system. However, we do not have the cash in the bank. And once again, that would then be approved. It would then go live as awaiting disbursement, as the terminology is. However, we would not release that yet because we do not have the cash in the bank. Chairperson, committee members, this is solely centered around our historical and authorized expenditure. So the department has historically overspent money that it didn't have. So in order for us to claw that back, we need to then have the unauthorized expenditure enacted through the Finance Portfolio Committee and come up with a way to pay that back, and then we'll be back in a balanced state. Once we've achieved that, everything on awaiting disbursement would automatically be cash backed and it would then be pushed through. The monitoring controls that we have, just to reduce that going forward, is we do have cash flow forecasting and planning. So as we sit here now in the month of September, we do have sufficient budget on paper still for the financial year. We do have sufficient cash in the bank. So anything that is authorized is released immediately. There's no withholding anything. But we do know when we get to the fourth quarter that status does change. In terms of the commitments and liability management, obviously all commitments are then recorded within the financial systems against the budget allocation to ensure that we're not overcommitting the budget going forward in the future, and also to prevent any future unauthorized expenditure. So the department has managed in the last 2 financial years not to have any unauthorized expenditure. So the process is working in terms of we're not overspending money we don't have, but at the same time we also need to reduce the historical accruals and payables. So that's the journey we're on. In terms of verification of cash availability, before payments are released, the systems are obviously validated against available cash, both from a bank account recon point of view, as well as the awaiting disbursement account. So we do reconcile that to ensure that we can release everything. And through that, we do daily reconciliations of our cash balances, just to provide assurance that the payments can be released. In terms of the Treasury and the bank controls that we have, both provincial and national Treasury do issue us with monthly cash allocations. So as we get transfers and grants transferred to us, we get the letters, we know that the cash is available for this amount. So as much as we sit with a grant of hypothetically 1 billion rand, it comes in tranches. So we need to manage our waiting disbursements against the cash that's available. We don't necessarily get all of that up front. So then we manage that through our reconciliation process to ensure that we don't overspend what we don't have. Through the monitoring and reporting, we have regular reports that are generated on payments at a waiting disbursement stage, and then that is reviewed by us as management. And then we do report monthly as well to Treasury, highlighting the outstanding items and the exception reports through our KCM processes. And then just from an internal control and oversight point of view, we obviously do have our segregation of duties in place around that to maintain the safeguarding of the payment process and to ensure that there's no irregularities on payments. You'd note with our first quarter spending, there has been some sluggish spending on 1 or 2 grants, and the main reason for that was the validation of the invoicing that had to take place. So that was the internal control process that was kicking in around that. So in conclusion, we combine cash flow forecasting, we look at the system-based verification, recons, we consider the allocation letters that we receive, and then the internal control processes we have to ensure that the waiting disbursement payments, as they are finalized and authorized, we are then able to release them to the service providers. All right, and then program 2.
Thank you, Chair. I'll deal with program 2. Question number 6 was in terms of the shortage of primary health care facilities and how, as a department, we are dealing with the growing underserved areas. What we do is we reschedule the visits because some of these challenges that we meet is outside our planning stage. So what we do is we'll reschedule services so that all communities have the opportunity to receive our services. And then questions on lack of targeted campaigns in an informal settlement. The question was what contingency measures could be implemented to ensure targeted health campaigns effectively reach the residents in informal settlement. There's a campaigns that are held by district, and also I don't know how many of you are aware of the MEC program that is called Taking Primary Health Care to the People. That is targeted mostly for those people who do not have access to our facilities. Question number 8, long travel distance to clinics. This question, although it was specific for Setsoto and Fixback, it's also been addressed in terms of question number 7 to say that we reschedule and change the visit to make sure that most people are reached. And then 8.1, how would be the most effective changes plan to improve the access to health services for residents living more than 5 kilometers from the nearest clinic? Is that what I've already said? Provision of mobile services and an extension. Also, the multi-month dispensing of medicine for those patients who are stable, so that they don't have to go to the clinics every month or every time they need an additional supply of medicine. And then question number 9 was to reduce demand at public clinics due to private providers. What possible measures could help balance the provision between public clinics and multiple private service providers in Bloemfontein to ensure optimal use of resources? As a practice, the department has a section called partnership. So this section is the responsibility is to make sure that department enter into memorandum of understanding and service level agreements to address the health challenges that we have out there. But specifically, I think some of these questions are referring also to immunization of children. If you are, as you are aware that mostly in Bloemfontein and most in metropolitan areas like Bloemfontein, Velkom, and to a certain extent in Kwakwa, nurses now are starting to open their own practices, and in these practices they do immunization. That's why you'll see when we present is a department failing to reach the target, because they visit these clinics for immunizations, and most of those clinics there's a memorandum of understanding between the department, and then the department issue supply them with immunizations, and there's a standing MOUs in this regard. Question number 10: what would loss of clinical hours due to break-ins, electricity and water disruption, and labor closures? Firstly, I think the strategy that department has been used is most of our facilities have standby generators. So these generators has been assisting, especially when you go to your CHCs. There's been generators to make sure that there's electricity. Most of our facilities have tanks that supply water. In other areas where there's a problem with municipal water, we have boreholes. Although it's not all, but the department is working towards to make sure that we don't have this the disruption. In terms of labor closures, this is actually not our real problem. Our real problem is in terms of when we have a community unrest where our patient cannot reach our facilities. So in terms of break-ins, we have a big challenge in the province where our clinics. There's a clinic in Virginia called Khotalang. Khotalang chair is broken in every second month. But what we have done, we have started now the strategy of working with SAPS, working with the CPS, with the Community Policing Forum, to make sure that we work together to combat the break-ins. Also from the departmental side, what the department is doing is reinforcing these facilities, replacing the fences, putting necessary barriers to the building to make sure that it's not easy for break-ins. And also, where you find that our facilities are not working, we're using two strategies. One strategy is we refer them to the nearest clinic. One strategy is we'll bring a mobile next to the clinic that has been vandalized for communities to get the service. Question number 11, Chair, I think I've already in general addressed it, but this one is specific to Mohoka, to Matlaken Clinic. That the question seeks to get information in terms of how the department is addressing water interruption. The provision of water, of the water tanks by municipalities during water shortage. We have that agreement with most municipalities that if there's a problem with water, they'll bring the tanks to fill the JoJo tanks at the clinics. Chair, I'll move to the next one. But this one, I think we'll share it with Memo Long One, because in terms of Memo Long One is responsible for medical depot. Where her input is needed, Chair, I will give over to her.
Ntate Mofokeng, we're under oath. We're under oath.
Yes, Chair.
Have you been to Zastron and checked that clinic out? And vis-a-vis the supplier, your water supplier, Mohokare municipality. Because that municipality is dry. No water tank is running around to supply the clinic. But I'm just merely raising the issue that creating your awareness, you are under oath. But I'll allow other members to deal with your presentation later.
Thank you, Chair. Can I move to the next one, Chair? The next one is concerning the above comments. How is the process managed from the submission of commitment address challenges such as delayed processing or delivery of first orders in financial year, as well as insufficient budget allocation? The response, Chair, is the department has been experiencing a general budget shortfall over the past 7 years, and it's also affecting the medicine budget. Despite the budget shortfalls, the department is still prioritizing medicine as the largest budget item under goods and services. Regular reprioritization of medicine budget throughout the year is being affected from identified savings under less essential items. Surplus medicine items are being redistributed between facilities according to their needs in an effort to keep medicine stock at the acceptable level. The department is constantly negotiating with the National Department of Health for possible donation of medicine to relieve the budget pressures, especially for ARV drugs. Primary healthcare utilization of under 5 rate. The response to address that, you have listed 6 key service delivery challenges under this performance indicator. There was a shortage of mobile facilities in underserved area. What steps have been taken to address the shortage of mobile service in underserved area to ensure equitable access to healthcare? The response is the plan is to budget for new mobile clinics and staff over the MTF period. Lack of targeted campaigns in an informal settlement. I think, Chair, some of this I've also addressed, but I'll go through them quickly. How does the department plan to strengthen or implement targeted health campaigns in informal settlement to improve service reach and awareness? Targeted campaigns are conducted towards communities in an informal settlement to address access to health service delivery challenge. As I said, Chair, there are those that are done by the district, and from the provincial office, there's a program that is led by MEC called Taking Primary Healthcare to the People that identify these areas. So gradually, we are reaching these areas. In some areas, examples is Toto near the border and the new extension in Fixbeck, there are residents living over 5 kilometers away from the nearest clinic. As I said, Chair, because of our challenges in terms of procuring additional mobile and also appointing staff, the plan has been done to make sure that these resources are shared among communities as much as possible by by moving even the appointments around to make sure that people at least get the access to health services. I think this others, Chair, even the interruption of we've talked about. We'll move to HIV/AIDS, STI, and TB control. Given the high rate of loss of follow-up among clients, what measures is the department implementing to strengthen tracking and tracing system, and how will it accelerate the decanting of stable clients into differentiated model of care, while also fast-tracking the rollout of 3 and 6 months multi-month dispensing to improve retention, adherence, and reduce clinic congestion? The response, Chair, is refer newly diagnosed patient for enhanced adherence counseling by the social worker, link newly diagnosed patient to the community health care worker. The department is in the process of appointing the enrolled nurses who will be responsible for welcome back strategy, appointment reminders, and telephone tracing. Facilities are encouraged to dispense 3 months instead of 2 multi-month dispensing. 6 month dispensing currently piloted in 10 facilities for the month of August and September 2025. To address the fast tracking of 3 month multi-dispensing for postnatal and breastfeeding women, the department, there's a circular that has been written to address this issue. The next question is, what strategy is the department implementing to improve 12-month ART child retention in care rate, particularly in addressing challenges such as missed appointments due to children's dependence on parents or guardians, and the impact of non-disclosure of HIV status, which contributes to non-adherence, specifically concerning continuing adherence counseling for children, strengthening the linkage of HIV-positive children with social workers for disclosure and counseling, and ensuring that newly diagnosed children are connected with both social worker and community health worker. The response, Chair, is social workers were appointed to render a child and adolescent disclosure counseling, which strengthen parents or caregivers' involvement in child treatment journey. Referral of newly diagnosed children for enhanced adherence counseling to the social worker. Linking of newly diagnosed children to the community healthcare worker for continuum of care. Healthcare providers were updated on child and adolescent disclosure in order to strengthen skills and confidence on how to work with children. The next question was on rifampicin resistance. What measures is the department taking to ensure that all TB, rifampicin resistance, and multi-drug resistant clients are promptly initiated on treatment, particularly by continuing weekly alert meetings to monitor and follow up on all identified cases? The response: identified TB, rifampicin resistance, and multi-drug resistant clients not on treatment are put on treatment. I think in addition, Chair, it should be traced and put on treatment. In an earlier questionnaire, we've talked about the welcome that there'll be a nurse who's appointed, the nurses who are appointed will be responsible for a comeback, for a welcome back project. So these patients, when they're identified and they are referred back and they are welcome to the facilities. Clients are contacted using SMS notification to go to facilities for treatment. Community health workers are given list of names to trace patients who could not be contacted through cell phone. As you remember that community health workers go out from the facilities to the community. What strategies? The next question is on DSTB client treatment success rate. what strategies are being implemented to improve DSTB treatment success rate by strengthening health education on early health-seeking behavior and treatment adherence, as well as enhancing tracking and tracing system to address the high loss to follow-up rate of 10.9% and a death rate of 8%. The response, the department is having radio slots, health talks at facilities and community campaigns in the district. TB rifampicin resistant and multi-drug resistant clients are continuously cancelled and treatment and are continuously cancelled to ensure that they stay on treatment. The next question is TB.
Maybe I must disturb you, Hanyane, Tete Mufike. I was worried members who are going to lose out on the list of presentations that the department is. Perhaps the responses that they are presenting now, they are already in your accounts, your Gmail account. So, and WhatsApp as well. So perhaps the advice could be, let's interrupt Ndate Mufuki in dealing with the responses of the questions that were sent to him and the department by the researcher, and divert our attention to this long list of the presentations. But this does not limit members from having follow-ups on those questions, because some of them I suspect they are going to be repeated questions or follow-up based on the presentation that already received from both the researcher of the portfolio committee and from the Department of Treasury. So I want members to spend more time with your good selves, so that they satisfy themselves, not to spend more times receiving presentations and things that we can work around, especially responses. So that being said, I don't know, MEC and the team, perhaps we can now direct our attention to the fourth quarter, 2024, 2025. We get non-financials, fourth quarter. And then we get annual performance plan, and followed by the both financials and non-financials first quarter of this current financial year we're in. I think then members will be speedily brought abreast to the developments, and then they can make follow-up based on presentations and questions. I don't know if I'm covering committee members well. All right. That being said, MEC and the team, Nzegele Matsonga lona.
Honorable Chair, thank you very much. And
apologies for disturbing you.
it's okay. It's okay, Honorable Chair. Can we start with the financials whilst we sort out some few other things? Okay. Ludicrous, can you start with what is available, and then we can take it from there? Through the chair, of course. Honorable Chair, apologies. Can the HOD hear me? HOD, can you hear me through the chair?
Yes, Chair. I can hear you, MEC. Thank you.
Okay, no, that's fine. Honorable Chair, through you, I think the HOD will lead us in terms of the sequence and other things. Thank you very much. HOD,
Is the HOD, apologies, is the HOD in here?
Yes.
Has he taken oath? Perhaps we can deal with that so that we don't disturb the
Yes.
Proceedings and processes. Oh, o hloka camera? Mookamedi wa lefapha, re bulele camera ntate. Is he with us? Okay. Perhaps if we could see him and deal with that.
Thank you, Chair. I'm ready.
Good morning, HOD.
Good morning, Chair.
Will you be taking an oath or an affirmation?
I'll take an oath.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Ernest Mohlahlo.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, Ntate Mohlahlo. Chair, thank you.
Thank you, MEC and the team. Khamatsonga lona, we'll listen to you.
Honorable Chair, thank you very much. HOD, I'm sure you were following the discussions, and we are to present the financials as well as the non-financials. Please lead us in that regard. Ndate Chris and Ndate Mfukeng are ready this side as well.
No, thank you. Thank you, MEC. And Ndate Mfukeng will present the non-financial. Thank you, Chair.
Is that the fourth court? 24, 25? Non-financial?
Yes. Yes. But we're just sorting out the technical stuff here. Maybe we can start with the financials as requested earlier.
Members,
Okay,
when it
nothing.
comes- while they're busy fixing it, when it comes to the APP, I don't know if you're comfortable noting it, or should we allow a full presentation on it? Does it include?
No, Chair, there's nothing we can really do on the APP now. It's not like we're going to influence it really. So
Sure.
I would suggest we just take note of the APP
Let's take
and work
note.
from there.
Honorable Skwebela is going to second you. Thank you. So I'm cutting your work short as and when we go. So please, you can start with your financials. Yeah, the financial report, as it pleases you. I suppose that will be the first one, yeah, this financial year, the first financial.
Thank you, Chair. Ndate Chris will take the members through. Over to you, Ndate Chris.
Thank you very much, Honourable Chairperson, Honourable Members, MCHOD. The first quarter financial presentation. Just wanted to flight. There we go. Right. So for the first quarter presentation, we've just got the annual allocation. So just to recap of what we presented in the appropriation bill. We then also have the expenditure per budget, per program, economic classification fund level, and then just the total revenue collected as at the end of the first quarter. So just in terms of the allocation for the year, the department is sitting in 25-26 financial year with a budget of 14.1 billion. Sorry, there you can see it there. So it's 14.1 billion. This is a year-on-year increase of roughly around 3.1% from the previous year's budget allocation. The main increase is actually from provincial funds. So thank you to Provincial Treasury and the portfolio committees. Our provincial funding has increased from 9.8 billion to 10.2 billion year on year. And then at a conditional grant level, the funding has actually sort of stagnated there. So where we had a 3.975 billion in the previous financial year, we have 3.977 billion in this financial year. So it's a very small increase year on year there. The main reason for that is the health facility revite grant has actually decreased by close to 100 million year on year, and that's the allocation we get from the National Department of Health. What that represents for us, just year on year on classification level, you'd see that our COE budget has increased by roughly around 5%. The main reason for that is the department has a backlog on its PMDS process, the pay progression process. So we had a 2-year backlog. In the previous financial year, we caught up the 1 year. So in this financial year, we're going to catch up the second year. So that means we actually have a double impact in one financial year. But the idea is when we get to the end of this financial year, we are up to date so that we don't have any backlogs anymore. Within goods and services, there's an increase of 8.7%. The main reason for that is more just economic classifications. So a lot of our projects, our infrastructure projects, are actually more maintenance related than actual capital improvement. So if you recall, historically, we've actually been qualified by the Auditor General on that. So we've gone back and fixed the budgeting and fixed the classification and that. So a lot of our projects are now actually more maintenance related, as they should be, and that has then increased the budget on goods and services by reclassifying that. But then the knock-on effect is you'd see that the capital budget has actually decreased. So the main reason for that is then the 100 million reduction in the grant, as well as the reclassification to correct the historical error we've had. And then under transfer payments, the year-on-year increase there is 15%. This has got to do with a backlog payment that we owe to HWCTA in the space. If we then just take that as a percentage allocation from that total budget, about 70% of that then goes to compensation of employees. So that is quite a substantial chunk. Goods and services gets roughly around 25.7% of that. Capital payments 3.2%, and transfer payments just on about 1% of that. Then first quarter expenditure trends, the department is sitting at 22% expenditure overall. If we look at it at a program level, this represents slight over expenditure under program 3, our emergency medical services. This has been a challenging program for us in the past. The main reason for that is the funding around our fleet account. And obviously closing the previous year with quite a high accrual that we owed fleet management, we've managed to settle that in the first quarter. So by settling that, we've actually spent then 30% of that program's budget in the first quarter against the baseline norm of 25%. We are looking at initiatives to see if there's any efficiency strategies around the costs around our efficiency fleet. That's also together with the TARS method that the Treasury has released to us to see if we can't get any gains around that. And then programs that are slightly behind schedule, this would be your health sciences and training program. In the main, this is the funding that we've put aside for international bursaries. We do have some accruals where we owe these international universities. The challenge we have is, one, the validation of the supporting documentation. So we are waiting for additional support through the National Department of Health before we can release any payments on that. And secondly, the payment method. So where we used to pay this through DIRCO or National Department of Health, it seems that they don't have that service provider in between anymore. So we're looking at other methods of how would we do that should we validate those payments. So there's a sluggish spending on that in the first quarter. But overall, that has decreased drastically. So if you recall in the adjustment budget last year, we had actually already moved roughly around 30 million from the bursary fund to actual COE, to actually employ these doctors that have received their qualifications. In terms of healthcare support grant, you'd see that that is then at 19% at the end of the first quarter. Main reason for that is we predominantly have the 40 million that we used to give the medical depot as a transfer payment within that program. We've changed the nature of that money, where it's not just a money that is transferred directly to medical depot. We actually take that 40 million now and we actually pay actual claims of medical depot to the department. So in other words, it's used to offset the debt that we have for medical depot. The reason for that was historically medical depot needed a top-up funding. It wasn't breaking even, but as the services grew and the budget around medicine grew, the levy charged by medical depots actually made itself sustaining from that point of view. So over the last few years, it's actually developed an accumulated profit, if we can put it that way. So instead of giving this 40 million just to top it up, we now actually use the same 40 million to transfer and pay for actual medical claims, medicine claims from the depot. So it still goes to the depot, it's just through goods and services. So what we've done with that is then as we get invoicing, we're paying then for that. So it's not just an upfront transfer anymore. What that would do on the depot side is that it would obviously then reduce its accumulated profit going forward So when we get to the depots presentation, you'd see the knock-on impact of that. And then just in terms of Program 8, facility management, the department has had its challenge around the infrastructure space. With the HOD's arrival, we've put new controls and mechanisms in place to validate the invoicing and the accruals within that space. We've also engaged with some implementing agents to assist us. We've noted in the past that we've built up this accrual, but we're not paying anything. The main reason for that was the validation of the invoicing itself. So that's taken a bit of time. However, when we come back in the second quarter, chairperson, committee members, you'd see a vast improvement in that. So we do acknowledge the first quarter did not go well for us in that space, but there has been a vast improvement on that in the second quarter already. In terms of economic classifications, so compensation of employees is sitting at 24%, roughly about 1% behind the norm. That's just got to do with the double impact of the pay progressions that we spoke about. So this, as soon as that is finalized, would actually eat away into that. Goods and services sitting at 18%. This is mainly, again, related to the accruals that are sitting under the infrastructure space. That we knew that was a problem within the first quarter, and that also impacts our buildings and other fixed structures that was very sluggish. And then just under households, you'd see that that is the impact that we had for the bursaries that I spoke about. And then obviously machinery equipment, it's committed money, so we're just in the process of those deliveries. So we have seen a vast improvement in the second quarter in that space. And then just at a fund level, so from a conditional grant point of view, overall we're sitting at 18%. The main challenge there would be the revite. So as indicated, there's quite a big knock-on impact because of that. However, in the second quarter, we have caught a substantial portion of that up, just through the validation of the accruals. And then also maybe just to mention that on the earmarked funding, the three that you'd see sluggish movement of is the infrastructure enhancement, once again infrastructure and the accrual validation process, the medical depot. We've already released roughly around 20 million in the second quarter for that. Once again, this is now on an invoice claim basis, not a once-off transfer basis anymore. And then lastly, the revenue enhancement allocation, the 3.2 million given to us by Treasury. This is to implement the HMS2 system at two facilities specifically. That's Dikla and Triple M, Manapo. We've already committed the money for the laptops and the IT equipment needed. So expecting some of that funds to flow in the second quarter around that space. And then on voted funds, as general, we're sitting at 24%. The next slide is just then the narrative, so I won't talk to the same issues again. And then just in the revenue space for the first quarter, against the target, we've collected roughly around 11%. Patient fees is sitting at 6%, so that is the main instigator for the under collection. We are in engagements with both RAF, Road Accident Fund, as well as Department of Justice. We've had some meetings with them to try and solve some of the outstanding claims with them, as well as an engagement with the Lesotho government. The debt from the Lesotho government currently is sitting at just over 100 million. They owe us from April 2024, so they owe us the whole previous financial year and what is incurred in the current financial year. Please note that that is debt based on referral basis. So we do sit with a general growing trend and concern within the province where we have more and more foreign nationals that are accessing our facilities. The information provided is not necessarily accurate. Hence we have a strategic revenue forum. So when we try and follow up to collect that money, we're hitting dead ends. So it is a trend that we need to look into. We have been engaging with HUD and MEC to see what other alternative policies we can put into place, maybe some upfront administrative fee payment or something. But we do see a growing trend. You know, the Free State population is in the region of just over 2 million citizens. Our HPRS, our unique identified number on the health system registered for the Free State, is sitting in the region of 3.2 million. So you can see the vast number of foreigners, other provinces accessing our system, which is obviously not something that we have within our budget baseline, because our equitable share formula is very much based on citizens. So that is an access and something that we're looking into to try and resolve both at a national sector, but as well as a provincial point of view. Thank you very much, Chairperson and committee members.
Can we go ahead to the next presentation, sir? All right.
Just before you do, members, please note that we are told now that there's a memorial service going on, so there might be that background noise, which we were not informed about earlier when we were dealing with the bookings of the venue. So feel free, MEC, to proceed. I don't know if you're taking first.
Thank you very much, Chair. I'm going to do the fourth quarter, and then from the fourth quarter, can I automatically go to the first quarter?
From fourth quarter, you're doing?
I'm going to fourth quarter of non-financials, and I also have the first quarter of the new financial year.
Okay.
So can I automatically move to the other one? Yeah. Thank you, Chair. I'm presenting non-financials for the fourth quarter 2024-25. The slides is just an outline of what will be covered in the presentation. This is just the summary of our indicators that I'm aware that most members are familiar with the summary. But what we are saying is in the last quarter of the last financial year, our achievements was 57.2, and we have not achieved 42.5. The next slide is just the list of abbreviation, Chair. If I may start with Program 1, Administration, Chair, the target that we set ourselves, the number of public health facilities, security audits. Unfortunately, Chair, the last quarter we did not achieve because of the challenges of we have the movement of the officials. The officials who are doing the audits actually left the department during that quarter. Then, Chair, I'll only cover those that we did not achieve. Chair, in terms of, I think the other ones that Chris has already covered, percentage of invoices paid within 30 days.
Yes, maybe apologies for disrupting you again. Just like members, we received financial report here for fourth quarter. And the Demofuge is dealing with non-financial. So I just ask you for your patience, maybe to follow through the slides. And when it will filter through your WhatsApp group or your emails.
Chair.
Did we do the first quarter of non-financial already?
The first quarter we did was for financial.
No, I hear that. Did we do the non-financial?
Maybe you can take us through why you're asking so that it.
And they are doing fourth quarter?
Fourth quarter, 2024.
Non-financial?
This is non-financial, yes. And that's the only one we're asking for.
Oh. You're answering my question. If he's going to do non-financial first quarter, why present on the non-financial fourth quarter? You can consider non-financial first quarter and note the non-financial fourth quarter.
That's where the problem lies, members. And if you remember, we had deferred the same thing in the same portfolio committee and asked them, and it was from their prayer that they come here and present it. And in the same meeting, we had actually noted previous reports. So because of the time that has already lapsed. So I'm worried that we end up not getting reports and questioning them and holding the department accountable. And more than other departments that is falling under your portfolio committee, I think health requires a serious attention. The part you don't want to admit as and Treasury, I'm glad that it's starting to recognize and dealing with certain matters. But portfolio committee, and one part that makes me slightly afraid is certain things get to be noticed by national departments right under our noses. Because I don't want to say we're sleeping on duty, but honorable members can't sleep on duty, of course. They are too honorable to sleep on duty. So I want those that were outstanding to be addressed. Against better judgment, of course, Chair of Chairs. Thank you. The accrual salna dingata banta.
I think, Chairperson, it becomes important that the presentation focuses on deviations or non-performance. It becomes important.
No, you are
Poka,
we are one.
Poka,
What discuss a form.
Poka, capture our inputs, deviations and areas of non-performance. Deviations and areas of non-performance.
Chair, it's logic. It's logic.
Okay, thank you, Chair. I'll be.
Which quarter are we dealing with, Chair?
You're dealing with the fourth quarter.
The fourth quarter, okay. Because I heard like your honorable member was saying we should note the fourth quarter deal with the first one.
I'll leave him. I'll chair this one session.
Okay.
He'll chair of chairs, and that's where he'll whip me for this one. Maybe I'll agree with Honorable Kwabadi to say, just to fast track issues, maybe focus on those deviations.
I wanted you to remind MEC that you are chairing.
Ajay.
Okay. Can I continue?
Please go on, Poka. Poga, can you go on?
Okay, thank you. Honorable Member, I was at the percentage of payments paid within 30 days, and this was reported in the financial report, so I'm not going to look at the finance issues. The others were we achieved the targets. Number of functional district health councils, the target was 5, only 3 in that last quarter. Last quarter met. I think it was the issues relating to actually meeting. But in that last year, when the MEC started with us, he made sure that all the health councils were launched and relaunched. We were only left with 2 in the last quarter. Then I'll move to percentage of internal audit recommendations implemented. 17, it was shortage of resources, insufficient monitoring of audit plans, and the action is to reprioritization of availability of resources and management to conduct regular audit follow-ups. And then the rest has been achieved. The next slide, primary health on sub-program primary health care clinics and community health centers. Indicator severity assessment, code 1 incident reporting within 24 hours. We have planned to do our target was 39.6. At the fourth quarter, which was the final quarter of the year, we're at 33%. What we are going to do, improvement observed after support visit together with the QIP is quality improvement programs with the Department of Health to make sure that we fix our shortfalls. There was a roadshow on PSI and training on early warning system by OHSC. Percentage availability of medicine, I think that Chrissy has talked more about that because our problem was more about the budget, and as he was presenting on quarter 1, is that those challenges have been addressed. The next is primary healthcare utilization under 5. We are planned to be at 3.2. We're at 2.9, and I think the challenge is those ones that mostly in metropolitan areas we have more of these private facilities, but also from our side the issue of strengthening the mobile services that we are currently doing, and also the role that must be strengthened, that must be played by community health workers. The next one, not achieve ideal clinic status, obtain rate. We plan to be at 95%, but at the end of the fourth quarter, we are at 93%. The 4 facilities were under renovation. 1 facility was not functional. There are 4 CHCs that did not have automated external defibrillators in Fezile Dabi, and the action what we are going to do is assess the facilities once the renovations are complete and ensure that the AID are purchased. The next one is percentage on primary health care facilities implementing quality improvement programs. We are planned to be at 100%, but at the end of the quarter, we are at 44.1. Reasons being the ideal system is unable to save some online populated information. As a result of this, it does not reflect on the system. I think the challenge is because our system is online. Sometimes when we have the challenges of the network and also the challenges of electricity, the system is unable to save. But the action that we are going to do is, it has been escalated to the Department of Health for assistance for the system developers to be engaged, because some of the things that we were looking at is if the network is down, then there should be, the system should be able to save on the equipment, so that when the system comes up, it can the information can be uploaded. The next one is number of GPs contracted to render PHC services. The target was 40, we are at 35. Contracts for the following facilities were not concluded for MSCPP, Heidedale, PAX, Winnie Mandela, and Bolata Clinic. The plan is to increase tariffs from 150 gathered by Department of Health and DPSA. Honorable members, the problem that we're having is the rate that we have been using as a department was too low to attract the GPs to be able to be contracted. Our rate was 150 per patient, and some of the doctors were not happy about that, but that has soon been addressed. The new tariff has been implemented. The next target is number of functional ward-based outreach teams. You plan to have 177, but at the end of the fourth quarter, we had 150. The reason is that there's an inadequate coverage by the outreach teams, but the action that will be taken is to increase ward coverage and add more facilities under outreach teams to increase household coverage. Continue with weekly reporting and monitoring, and give support to those facilities that are facing challenges. The next one, number of facilities operated over 24 hours. This is CHCs. We have targeted 7, we're at 6. CHC in Kronstadt had planned, and they have already appointed the staff to, they were planned to launch in the end of January 2025. But I think the process, as members are aware, that the department has been battling with the budget to ensure that we appoint. But we'll report, I think the other report, let me not confuse the Q1 and Q4, but this was for Q4. Percentage of facilities with functional clinic committees. We're planning to have all clinics having committees. We only, at the end of fourth quarter, there was 77.8. I think the challenge buy-in from the local councillors in the northern parts of Tabanchu is still a challenge. Poor attendance in the Bupulo CHCs, which is in Pietersburg. Ward councillors not always available for the meeting, and transport challenge for members of clinic committees. How we are planning to address this: advocate for strengthening of clinic committees through reactivation of clinic health council, quality improvement programs that will make sure to address the problems that I've alluded to, improve turnaround time for the re-establishment and training of committees by the provincial governance unit. The next one, patient experience of care satisfaction rate. We have planned to reach 80%, but we are at 69%. Reasons in poor performance in this area, in these specific areas: cleanliness, patient safety, values and attitude, and waiting time. Facilities long waiting time and facility disruption due to break-ins, lack of water, which restricts access. Action that will be taken: submission to be drafted for filling of cleaners' posts, support of clinic committees, which I've already alluded to, filling of essential professional nurse posts, and continuous CCM DD implementation, so that patients can receive their treatment at an external pickup points. Appointment of security at Thabo Mfutsanyana facilities, because that's where we have a challenge in terms of break-ins and vandalism. The next three, Chair, they've been achieved. Cervical cancer screening, we have planned to screen about 860 cervical cancer screening. That was our annual target, but for the quarter it was 120. We have only reached 70. The main reason is that district hospital conduct few cervical cancers, and the plan is to train and make sure that the district hospital achieve it.
2 minutes, Dr.
2 minutes. Child under 5 year pneumonia case fatalities, we're supposed to be under 1.1, but unfortunately we went to 2.6, and the reason is the late presentation of the patients and also this is the places where we have identified them, and action plans will encourage an early referral. Children under 5 years, severe acute malnutrition, supposed to be under 3%, unfortunately we're 7.8, and most of this is late referral and late presentation of the patient. Also the next one, death under 5 year, against live birth rate. Chair, the next one, ideal hospital has been achieved. Percentage of hospital implementing quality improvement programs, we're at 60%. Because some of the components in hospital and QRP have not been completed. Patient experience achieved. Patient of hospital with functional hospital boards were at 88%, and I think challenges is members resigning, so the department will make sure that we appoint members. Maternal death in facilities, unfortunately we had 10. A shortage of obstetric ambulances, and action is appointment of more skilled EMS personnel and more ambulance. The next one is on ART. ART adult remain in care. We're at 65.4, and the reasons are the decanting of patient did not improve, withdrawal of PEPFAR support in Thabo Mfutsanyana and Lejwe Leputswa. As members will know that Thabo Mfutsanyana was one of our best district in terms of HIV programs. So after the withdrawal of PEPFAR, we faced the challenges. ART child remaining in care. I think some of these questions, Chair, are also in the oral questions that we have responded to. So I'll just go through. We're supposed to 95% of those patients that have been diagnosed were at 73.5%. The reasons being non-adherence, but what the department will do that we have already responded in the oral questions is that social workers have been appointed to deal with these issues. The next one, ART, adult viral load, suppress rate. We plan to be at 95, we're at 99. Reasons be poor treatment, adherence, and then the action that the department will do is to promote and strengthen treatment literacy. In short, clients with suspected viral loads are linked to social workers. The next one is child viral load suppressed. We're at 95. We were supposed to be at 95. We're at 66.7. I think the reasons are the same as the previous one, Chair. DSTB clients, lost to follow up. I think this one, Chairperson, we already responded to the oral questions. If you can just allow me to pass these ones. TB rifampicin, we have already responded to the oral questions, Chair. ART death rate, we are fine. DSTB client death rate, supposed to be under 10%, we're at 11.2. late presentation, and then what we'll do is an awareness. On this page, only antenatal clients start on ART rate. We did not achieve. Supposed to be at 98, we are at 84.2%. Immunization. This one, Chair, immunization, they've been covered, if I may, under some of them have been covered under the oral questions. Maternal mortality in facility rate, this is the death per 100,000. I've already covered, some of this I've already covered when I was covering maternal death. The next slide, primary healthcare mental disorder treatment rate. We're supposed to be at 0.01. Not that we did not do anything, but I think our numbers are so small that we are unable to get to a percentage, a recognized number of percentage. But this is what we're going to do to improve the current situation. Number of mental health clients seen by a contracted mental health assessment. We're supposed to see 1,680, but we have seen 1.234. Reasonable performance was affected by delayed appointment of additional professionals, and the appointment are going to be done or have been done as of now. A number of mental health care practitioners contracted. There was none by that because of delay of appointment. Percentage of hospital compliant is 72-hour mental health assessment. It's supposed to be 13.8, only 10%. I think that this one, Chair, is the reason is more the problems of infrastructure. The next one is percentage of autopsies performed within 5 working days. Chair, we're supposed to be at 99%. As members are aware, we had a problem with Bloemfontein Forensic Mortuary, which was closed for a very long time, Chair. So that the problem has been addressed now. If we move to EMS, response time for urban, that's where we still have a challenges, but the department is in the process of appointing more skilled personnel. Chair, I just want to see what I can have. Number of rostered planned patient transport. This is the planned patient that's moved our patient. We're supposed to be at 70. At the fourth quarter, we're at 25. In actual fact, Chair, this is not it's not that we have not achieved, because what the department is doing now is encouraging outreach. Rather than having more people being moved to Bloemfontein every day with patient transport, the encouragement is to encouraging our professionals to do an outreach to go to Manapo, Dihlaben, to those regional hospitals, so that we can cut patient being moved to Bloemfontein. The next slide, the one that we not achieve is diarrhea death under 5. It's linked with other slides what I've done when I've dealt with the under 5s. We're supposed to be under 4%. We're unfortunately at 5%, but the reason is severity of condition. Because of some of these things is because of the late presentation. I've talked about cervical cancer, Chair. Patient experience. Yeah, Chair. I think some of them we have. I think some of them. I don't know what I'm saying. I think some of them have been a repetition. I apologize for that, Chair. Yeah. Thank you, Chair.
All right away, you've got 5 minutes for this one. Your quarter one. It will be the last presentation, so I allow members to ask questions. Yeah, I tried to avoid it and said, let's focus on non-achievements, but it looks like the whole presentation is about non-achievements.
You suspect it as what?
Ah, yeah.
Let's go by reference to quarter 4.
Let's proceed. This member is out of order.
Chair, one thing that you realize in terms of the indicators, in this new financial year, our indicators have reduced. We only have 52 indicators. If you look there, they are less now. But for the first quarter, we have achieved 42.3. We have not achieved 57.7. This is the usual the one on abbreviation, Chair. Revenue, I'll skip. Ntate Chris has talked about revenue. The business, women business, they've addressed that, Chair. I'll move. If you check, Chair, the first quarter and the fourth quarter, you remember we're not in good standing in terms of medicine availability. We're improving. We are now at 85.3, and I think the reasons have been alluded. What was the reasons of us not being able to achieve the 90%? We have primary care utilization of under 5. This issue is coming along, Chair. If you recall that what we have addressed in terms of the availability of the mobiles, and also that some of our clients are using the private facilities. Yeah. But in terms of this, and in terms of the oral questions, Chair, feedback sort of has been responded to. ART, adult remaining in care, Chair, we are still, I think we still are facing the same problems of high loss to follow up. We are trying as a department to strengthen, because in the past we were relying on the partners, and the partners after the PEPFAR funding was stopped, we are now starting to do it internally. These are the issues of ART that are not different from the ones that we have covered in quarter 4, Chair. The next one that we do not achieve is TV rifampicin, which I alluded to, that we also responded in terms of the oral responses. DSTB treatment success rate, the reasons are still the same, but if you look in terms of the percentage, Chair, there's been a slight improvement in terms of those patients that we are tracing and bringing back to care. Malaria case, we don't have malaria cases in the province unless when we have a patient who come from other provinces and end up being admitted in our facilities. Couple year protection rate, we were supposed to be at 80, we are at 72.5. We have the challenges of stock out of contraceptives due to budget constraints, and these issues, Chair, as Dr. Chris has presented, have been addressed. Antenatal first visit before 20 weeks, we are at 63.9. The reasons being that shortage of staff, the ratio of pregnant women to available midwives. We are in the process now that it's a new financial year, we have a new budget, the process is on of appointing staff across the department. Immunization under 1 year, we are at 62. Apart from these issues that have been here, the delays, but also I've mentioned the issue of other parents choosing to take their children to the private primary health care clinics. But also we had also our own challenges in terms of making sure that we get the doses. Child under 5 diarrhea case fatality rate. Chair, if you look, there's not much different from the fourth quarter, and the reasons are basically the same, and the department is in the process of addressing those issues. And then we move to vitamin A dose, 12 to 59 months. We are at 53.8, and some of those issues is not about that our clients don't get vitamin A, but there's been a problem of underreporting that has been identified and it's been addressed. Cervical cancer, I've talked about that. If you recall, Chair, in the fourth quarter, we're not doing as it has improved. It's now 41.7, because some of our district hospitals were not doing the screening. They have now started to implement the screening. That's why there's an improvement. Percentage of autopsies performed, I've addressed that. Chairperson, we are catching up. Bloemfontein Mortuary has been opened, but Botshabelo was renovated, and also the renovations have been completed. So we are also improving. But I think the closure of Bloemfontein, that's the one that affected us, Chair. EMS, both rural, if you look at the rural and the urban we have achieved. Rural, we have those challenges of the skills that we can take to those rural areas, and enough staff to cover to be rostered appropriately. Okay, next. This has been achieved. Number of clinics trained in ESMO. We're targeting 100, we're at 54. 3 of the 4 plan sessions were done, with 1 session having far less participants. Sessions in usual Pusa did not happen, as participants did not pitch up on the day of the training. Action plan is to target, during the second quarter, is to revise our targets and make sure that we address the issues that affected the targeted employees to attend the training. Health facilities, with 80% linen availability, we're supposed to be at 78.6%, we're at 2.38%. Chairperson, it's not that we are not achieving, it's some of the facilities, most facilities do their own, wash their own linen, but we still have to consolidate the numbers and make sure that we respond appropriately. Medical authentic devices issued rate, we have planned to issue 79% of our patients. We have issued 56.7%. This is the problem of availability, and is the issues of procurement. Also, this affects medical prosthetic devices issued rate. Service level for normal orders, this has to do with medical depot. We have planned 65%, we are at 17%. The reasons being lead time to facilities was long due to delay in budget approval. And the last one is achieved, Chairperson. Thank you very much, honorable members.
Members' questions? I'll start here. Honorable Khobane and Honorable Klute will follow, Honorable Pistorius, and Honorable Ntabisi Nkhaure.
Oh, Chairperson, I don't know where to start because because the presentation is full of non-performance, and my worry is that I would say that The department seems to not to be having a plan or responses to areas of non-performance. What has been highlighted as possible action plans, to me it's rhetoric. I believe in the next 2 quarters, they'll still be saying the same thing. What we get as we do oversight and what we get here are 2 different things. If you remember, when the last time Medical Depot was in front of the committee, I think it was almost like 100% performance. It was performing so well. But when we went on oversight, there was a serious gap in terms of medical supply, and now it's being reflected here as one of the problems. And I'm also worried that responses that are given, the department targets and the department reflects underperformance, and then explain to say it's not underperformance. In fact, it's private business closing the gap. And then say they assist those private nursing clinics with medication. But at the same time, the department has a shortage of medicine. Now, that's why I say to you, if one has to ask question, I don't know where do you start here, except to say what you raise, that the departments need serious attention. What I can request is that HOD must try to summon management, have a serious planning with, especially with CEOs of hospitals and managers of clinics. They must have a comprehensive plan on dealing with the obtaining situation on the ground, so that they don't give these responses that they give to the MEC, because really, Poka, the report that you have been given there leaves much, so much concerns that you don't know where to start. I mean, Chairperson, there are so many things that one would raise. Also, the issue of the private doctors contracted by the department. As we do oversight, those doctors are not going to work. If you remember the hospital in, what is this, Dromsbeek, Albert and Zola, they said they have 13 doctors. When we asked them, are they coming to work? Then they confessed no. So you then find interns being the ones that have to carry the hospital. But those people are being paid. And now the department has to increase the rate of those doctors. In essence, they are getting money whilst they are running their own surgeries, or they are running their own private business. So the department must then do, I wouldn't say it's oversight, but something like the ambush, unplanned, to check whether those doctors are going there, and also ensure that they are not using public facilities to run their own private businesses. But I would really want to say, Chairperson, the presentation is it's really showing a problematic picture of the department, and really to pose direct questions on the presentation, you'd end up sitting the whole day, because really the gaps that are there are so huge. And let the department assist the MEC. Thank you, Chair.
Good.
Thank you, Chairperson. Let's go straight. I think we all know that the Free State is notoriously slow on infrastructure spending. And it's concerning that the Free State stands at 7.5%, and I think the grant, I think it's the health facility revitalization grant, is 7.9%, so that's not on par as far as the Free State goes. Maybe just a request on Lesotho, on the Lesotho debt. Can we maybe in future, Chairperson, to you, as part of the revenue streams, also get the amounts owed and paid by Lesotho as part of our reports? So we can track that as well, because we hear about Lesotho payments made, but we can't see it as part of the report. So if we can maybe get that also included in future. Then, Chairperson, on Program 2, the District Health Services and the availability of medicine, we hear the budget shortfall, and considering that only 18.7% was achieved, can we maybe get an indication what is that budget shortfall for a year? So we can also understand that, because we also get phoned by the public and patients to say, listen, I've been to a clinic, but the clinics say most of the times the message they get is, we don't have any money. The department says we don't have money to buy medicine. So what is the budget shortfall, so that when we go to budget, provincial budget, we can also keep that in mind. With that being said, I did pick up the medical depot spends 50% on COE. So the people who are supposed to provide the province with medical and medicine, 50% of the budget goes to COE. And then, there's mention of a profit at the medical depot, 13.5 million. We'd just like to know what happens to that profit, and what does the PFMA say about entities? Are they allowed to keep that profit, or are they supposed to push it back into the national revenue streams? And then lastly, where does the depot get their donations? That would be my questions. Thank you, Chair.
Honorable Chair, I missed the last one. With due respect, I missed the last question.
The donations that's given by the medical depot, to the medical depot, who gives the donations? Where do they get their donations from?
Thank you very much, Chair. Yes, Chair, I think firstly, let me just start in terms of the primary healthcare facilities. I do note from the presentation, it stated places like Muakare and Kopanong, where we have very serious local government issues in terms of water delivery, that the department does engage with those local entities, that they do provide tanked water, etc., and JoJo tanks. But it's one thing to have that arrangement, and it's a different thing actually, seeing that happening on the ground. If those clinics are provided then with water on a daily basis, specifically noting Philippolis for one, as well as the Matlakeng clinic. Chair, then I'm still a bit concerned about the mortuaries. If we can just get a clear indication, the presentation says that the Bloemfontein mortuary is open, but somewhere I read that it's partially open. Is it open? Is it now open in toto? Is it back to 100% operation, or is it at 50% or 60%? And what issues are there still? But then, in terms of the entire province, what is the status of all of our mortuaries? What are the issues that we are finding there? And we have actually raised this before as Propac, is we have this challenge of Department of Labour coming to close down our mortuaries quite often. And it's very problematic, and it's traumatic to the families of the deceased to have to wait then for long periods of time before they can take, say their final goodbyes. Then in terms of the report, it mentions that the non-achievement of the EMS responses is due to a lack of skilled EMS personnel. But no mention is made of the lack of ambulances themselves, the vehicles. Is that still an issue? Is the issue actually only now skilled EMS personnel, or is there still the issue with the vehicles? And then in terms of the expenditure on Program 8, and my colleague has mentioned that on the health facilities management, the indication from the department is that the issue is not actually the expenditure on infrastructure, it's the payment of infrastructure. That's why it's only at 7%. Can we just get a clarity on that? Is it if I understood right, is they saying they're only at 7% because it's not that they are struggling to spend the money, it's that they're struggling to pay the money due to confirmation. But there as well, then it needs to be clarified. Where are we actually then in terms of percentage of work being done on the ground versus being paid? Because 7%, it looks very dire. We need to have a clear indication of what is being done on the ground versus what is being paid. And then perhaps to the MEC directly, in terms of this issue we are having with Lesotho, what are the engagement at a national level? I believe that would be, those engagements will also be having at a national level with the National Minister of Health. Is a political answer? What engagements are there in terms of how in the future are we going to treat not only Lesotho but as well Eswatini, etc. Other various provinces, but now specifically in the Free State. What is the engagement? Is the engagement at a national level about how are we going to bill our neighboring countries? Yes, thank you very much. That's it.
Honorable Kharek.
Thank you so much. Thank you so much, Chairperson. Chair, mine is on financial report for first quarter. The report said the compensation of employees is 70.0% on 2025-2026 financial year, and goods and services is 25.7%. But under the budget versus expenditure per economic classification, there's under expenditure on compensation of employees and goods and services. So I don't understand, Chair. There's under expenditure then on the budget versus expenditure, but on financial report is compensation 70%, and the department is still understaffed on that situation. Chair, we were in Tromsburg last month as the multi-party women caucus. We visited the two hospitals in Karib, which is Albert Nzola and Diamant in Chakasfontein. We specifically went to the maternity leave in those two hospitals, and we find many challenges, even if are not the same, but in both hospitals there's challenges, Chairperson. Some of the challenges are the major challenge is the shortage of staff.
There is no enough staff for delivery in the maternity ward. They even call midwife, standby, or those who are on leave to come and assist them when they get pressure. The other challenge, Chairperson, is the lack of personnel drivers for EMS ambulances. The shortage of linen. The patient have to bring their own in the hospital because there's this shortage of linen in the hospital. But in Albert, in Diamant, they have enough linen. Hence, I said before, the challenges are not the same for the both hospitals. There's no occupational therapist in Albert Nzola, Chair. There's no aircon. The aircon are there but are not working in the hospital. You can imagine when you are a woman and you are pregnant, the aircon is not working. You get yourself in other situation. So I just want to check, Chairperson, how can the department assist on these challenges of these two hospitals? The last one, Chair, I just want to applaud the department or both hospitals on their work collaboration with the SAPS and other stakeholders regarding fighting the issue of gender-based violence. They are doing good in that side. Thank you so much, Chair.
Omeko, noted.
Chair, I'm covered on the issue of the post-mortems. Let me see, are we winning that war? What has become progress since this matter became a crisis? And of course, the department attempting to deal with it. It is causing a serious distress. You know how serious this thing is becoming. But let me not waste time by overemphasizing the words of Honorable Pretorius. I think he covered me. Chair, I thought that this problem of the debt with Lesotho comes as a result of something that we can avoid. I've been a member of Parliament 2014. It's for the first time I hear that these people come as referral. I thought they just walk in. Now, if they come being referred and the obligations were not met, why do we proceed? I mean, to the extent of 100 million. Some years ago, MEC, it used to be 20, and I think it was reasonable. Because Lesotho could, given its challenges, if you're interested in that country, their politics and socio-economic status. But you can easily argue that it's reasonable. 20 million was affordable. But they are now at 100 million. And there will be other referrals and we'll accept them. And this thing will accumulate to the extent that, which I suspect is the case, that the department is not coping. I mean, if allocations are done on the basis of census of the Free State, and there's almost triple or double, surely our health system is not going to cope. In as far as our fiscal capacity is concerned. I don't understand, Chair, why are we not acting with haste on this matter? Because it's blue joining. It's going to is going to explode at some point. Province to national understanding on the matter, country to country relations, diplomatic relations, whatever that be. How is this issue being handled? Chair, I think it's an important issue that, look, what we can't avoid is that we are a province representing our country that is next to Lesotho. All these, what is supposed to be national to national or country to country problems will boil, what do they say, cascade into our province. I mean, just to be silly, I'm told that Lesotho people are saying Free State is their land and they want this land back. They can't say Gauteng because Free State is here. And you'll be warned that what is happening in DRC might happen here. The expression of those politics might happen in the Free State in relation to South Africa and Lesotho. And we don't want that we have these issues and are unable to deal with it, MEC. I don't know at the level of ESCO, at the level of national, what is the approach, what is the indication on the issue. Lastly, on the finance issues, MEC, your accruals has been a cause for concern for the longest time. And we made a point to Treasury. What is the status now? Are we winning that battle? Let me see, our interest is, more than anything, is the implications of these accruals to our people. These business people who could not be paid for a year, and likely some of them now probably, they're out of business. They couldn't meet their financial obligations. And these things are caused by us as government. It can't be. It cannot be. It can't be us. And impliedly, Chair, we are killing the Free State economy. Because through infrastructure, we said we will ignite the economy. And the Department of Health has got that space, that role to play. But it looks like for the longest MEC, our role has been negative. And we're making a point that it's not a financial, it's not an issue of the financials. The socio-economic implications is what we're dealing with. And the next thing, these people take government to court, and us as politicians, we take offense and say you are not loyal to your country, to your government. Yet we failed the law in terms of the 30 days payment. So it can't be ongoing forever. The department has been Treasury said to us, no, that you are busy with papers there, just checking the authenticity of the process itself in terms of the entirety of the transactions, the requirements. Those are important. We can grant that. But I think it has gone to the extent that it's creating serious problems. And MEC, we meet these complaints out. And the expectation is that we've got to provide answers. And if we're unable to, people become despondent. Thank you, Chair.
Thank you, Chair. Chair, let me start here. What presented before us here is not the true reflection of what is happening on the ground. Now, Chair, why I'm saying that, Chair, I didn't hear the department talk about the mortuary in Kwakwa that is closed by the same Department of Labor. The mortuary is still closed, as we are speaking, as we are sitting here today. But no one who's accounting to us about that mortuary. The second one, Chair, it's the professional nurses that are moving around, deliver the medication, while the department is still understaffed. What are departments saying about those things? And they are traveling more than 3 kilometers every day to deliver the medications. But we don't have nurses at the clinics, at the hospitals. What the department are saying about those things. And the last one, Chair, is about the referral. There is a difference between the referral and the people who are here illegally. They are using our own facilities here in South Africa. And the department is quiet about that. And some of those people, Chair, let me be honest with you. They are working here in South Africa, working as the domestic workers. They are using our own clinics, they are using our own hospitals, and the department is quiet. It's saying Lesotho is owing them a lot of money, but people who are using that, they are illegal here, and we are not saying anything. And the other issue, Chair, it's about this referral. This thing is bothering me, because these people, when they refer them from Lesotho, they are saying Pelinomi. And we've got the facilities here in Kwakwa, and Kwakwa is next to Lesotho. But why are they going to Pelinomi? Every referral is Pelinomi. I thank you very much, Chair.
Honorable Lich.
Thank you, Chairperson. On a lighter note, Honorable Miku has now left, but I wonder if Lesotho knew what our government debt is, whether they'd still want the Free State. That's just on a lighter note. Then, I just wanted to add, when we did the oversight at the hospital, in terms of the linen, it's quite a simple thing. So when somebody leaves the hospital and they are transferred to Pelinomi, the hospital needs to give linen. So they leave with a blanket and etc. But it never comes back. So it stays with Pelinomi. So if we can maybe just look into that, I think it's just an organizational issue that can be solved. And then also, in terms of those hospitals, and we were really impressed by them. So it's not often that the Department of Health gets a compliment. So we were really impressed, especially with the hospital in Tromsburg. Very clean, up to date, but they do really struggle with enough hands. So because it is a district hospital, the students don't go there for their practical year. If we can maybe look into that and maybe make it possible for students to go do their practicals there, I think it will be a good experience, and I think it will also solve the problem of too little hands. Thank you.
Yeah, thank you very much, members. I'm convinced MEC and committee members that we do not have a department called the Department of Health. There's not a single program presented here that is at 100%. And I can argue this thing until cows come home. Financials, I think we all have to agree we're having a serious challenge. And there's not even a single facility, one facility. I hear Honorable Leach says that at some point you got a compliment, but I can tell you for free there's not a single facility that is up to scratch. I mean, go check that body standard compliance, and it will tell you this, the hard truth that we don't have a facility in the Free State where human rights can be maintained at the same time and health provision is provided or a health service is provided. And I'm putting this to you as a challenge that none. Start with any academic, tertiary, go anywhere, including clinic. You'll realize what I'm saying. And across the board, there's a serious water challenge in all these facilities. Electricity, I don't want to do. Simple maintenance issues. Doorknob here, there, something broken. Machinery is a problem. And these honorable members can bear testimony. We were at Lady Brand just a few weeks ago. A simple X-ray machine. And it's a mess. So I'm convinced, let me see what I say. We don't have a department. When you look at your presentation, not a single health program, not a single clinical program is up to scratch. I mean, we're not offering our people what they need to be offered. I mean, if a school can't teach our children, if it can't provide educational services, why do we keep that school? I mean, it looks like everywhere in the Free State we're unable to provide health services. Be it because of shortage of staff, and that shortage of staff, we keep on pumping more money now. Money has increased, COE money by 4% or so, and this is what Honorable Khareko is indicating. For what when there is still increased shortage? So we don't have a department. And I can tell you that we're in serious danger. And Honorable Khobane makes an observation that perhaps at some point we must call, and this is what he has been complaining about even in previous portfolio committee meetings, that at some point perhaps we should just flood this house with CEOs and try to get to. I'm convinced there's not anyone who can tell you anything that you've not seen in this department. There's no money for it. There's no personnel for it. There's virtually no infrastructure for it. By the way, we got a presentation from Treasury that you're not even spending on that infrastructure or conditional grant. It's a serious problem. So they'll have to now, Treasury has to babysit the Department of Health. On top of it, they're busy babysitting municipalities. So these honorable members, perhaps it's their call to, and I'm quite afraid. I've been sitting awake at night when I was going through the reports, just trying to comprehend how best can we help this department. Do we refer it for administration? Because it looks like it can't take care of its own business. I mean, we're sitting here. We want some national department to come to us like it did when it unraveled what it unraveled at the municipalities of the state. As if we don't have committees, we don't have legislature. Somebody has to come and leave their duty somewhere and do this oversight for us. So at some point we need to be honest to the Free State people who are dying every day in the hands of this department to say, but it's not on, it should be enough. It should be enough. We should call for outside direct intervention. And how, I don't know. I was asking for a legal opinion. At some point when the then Premier Isma Khashil was still a Premier, I know at some point there were about 5 departments, Honorable Khwaban, were under national administration. Why are we afraid to call for such an intervention, to assist not only them, maybe our people, maybe our health professionals, so that every day you don't get one health professional who is dealing with a work of 4 coming days. Like it's one day, when you're supposed to do 8 hours of work, but you are doing actually something like 32 hours of work because of pressure and the number that you need to get to assist these people. Some are even facing litigations with the department, by the way. Some have lost practice certificates because they are so exhausted, they can't do much. They're not even provided with tools of trade, no material, nothing. And the department is dealing with bare minimum. What more do we want to see to call for help? I don't know. I don't know. I think department shame, I believe, especially the poor officials in the presence of you, MEC, as their political principal, they'll try and answer these members too, but we're not getting there. And this is the reality that all of us must face. And perhaps if we clap together and hold hands, we can assist this department and as well as improve health services for the sake of our people. So, honorable members, the ball is in your court. And now my recommendation is, if we can, let's call for help. Let's call for help. Honorable Zama gets me, what is he going to say that we have not yet? When the chairperson is closing and handing over to the department, he wants to say something. Maybe I must give him a minute so that I can allow the team to answer so that we're not unfair to them as well and the MEC.
Yes, Chair, I just want to apologize. Perhaps, Chair, in what you are echoing, the sentiments that you are echoing, is just to remind ourselves that the MEC did make a request to ourselves as the committee to say that at times they have been restrained, that they must come to report on these compliance matters, Q1, financial expenditure. Perhaps as the committee, before we can explore the avenue that you are making as a recommendation, chairs, to say that let's afford the department a day whereby they come and brief us, not on the standardized compliance issues, but on an overall issues that they are faced with, where they are making progress. And then we can then make an informed, detailed decision based on what they have said to us. Because I don't want us, because if we are going just to deal with it on these compliance issues, when there are other indicators that they are not reporting on them, would make a determination based on this, but not entirely on all the indicators that they are within the APP and those are then the ones that they are within the department, so that we get a broader perspective of what is it that is actual. Then we can arrive to that particular situation. That's my submission, Chair.
I don't know if the pressured program legislature will allow that, but and if we ever get to that slot, how many lives shall we have lost at that time? But I think we're spoiled for wisdom with these honorable members here. But let me see, and the team, let's not be unfair to you and try to make some form of a resolution and determination without necessarily hearing your side. But advice how best to help you.
Honorable Chair, thank you very much. One big help that we asking for is that you give us a chance to explain ourselves. And we give our side of the story. Our request is that just make time to listen to us, and then other things can follow. And thanks, Honorable Skwebela, for raising that matter. Honorable Chair, I think there was a purpose that the presentation be sent, you go through it, we still come and explain. Because if it was just the presentation being sent and the scores allocated and there's no human interaction in the process, it would have, left out quite a lot of things. And Honorable Chair, if I may explain, there's quite a lot of things that have happened that are seeking to put the department in a proper trajectory, which do not have space in the template that we have to report on. And that's a very huge, backlog. Honorable Meko raised the issue of the forensic mortuaries. and the work that went into ensuring that those are functional. And as we speak now, Honorable Chair, we do not have a backlog, and our turnaround time in the mortuary is less than 7 days, which is work that was done to ensure that, we provide service to our people. And I think there's quite a number of things that have been raised, and I wish to, through you, request that the HOD on the team responds to the technical issues that have been raised, but I'll then deal with this other overarching kind of things. The issue of Lesotho debt, I think it's something that is quite bigger, that needs to be dealt with at another level, because as a province, we can't interact with another country. We can only interact with another country through our national department. And as it stands, our biggest challenge is not patients that are referred, Honorable Foko. That's a very minor kind of thing, because they are referred from a specific facility in Lesotho for a specific kind of treatment, and that treatment is only offered in Pelonomi and Universitas, because mostly it's oncology kind of treatment. But the biggest challenge is those who are not properly referred, who are not part of, calculated as part of our citizenry, and are not considered when the DORA processes are unfolding. That's the biggest chunk of what we really are facing, because we can't invoice Lesotho government for that. But those that are referred properly, that is something that we really may need to be dealing with. But the biggest challenge that we're facing is those that we are not unable to do so. And remember, there's also an issue about the universal patient fees that also have to be put in space, and which have not been, implemented, with the agency and the seriousness that it needs previously, which we have to bring into space. And these are the areas that we trying and beginning to look into. So, Honorable Chair, if you allow, can we just quickly deal with the technical issues and then close, because I wouldn't want to take much of your time, although there's really a lot that we need to be saying. I mean, Honorable Khwabane raised the issue of the doctors who are not reporting for duty. We have quite a number of challenges in that space, which we are dealing with. For an example, we have very high-ranking doctors who are being paid overtime, which they are not working. And we're not talking, few thousands of rands. We're talking serious money here. And the processes are in place to manage that kind of overtime, to make sure that if we pay a doctor, there is performance. I'm not sure, maybe our society always had this thing that because it's doctors, they will practice highest level of ethical standards, and they will never, venture into the space. But what's surprising is that we're beginning to see those indications, especially in those categories that we never expected. But processes are being put in place to manage those processes, so we do not have that particular challenges. The issues of electricity and water. At some point, we had a problem in Mohokare where there would be electricity, but the power would be so low that you had to run a generator 24 hours in order to run just an X-ray machine. And we managed to engage with the municipality and resolve that process. And we had an option. My instruction was that let's talk to ESCOM and connect directly to ESCOM. But fortunately, the municipality resolved the problem. So that has been addressed. There will be sporadic issues where there are water challenges. We are trying to address that, and I hope that whenever similar thing is picked up, it will then be raised with us so that it is attended whilst we still deal with it at a broader, status. Honorable Chair, the report that we have from compliance bodies, will be going in an opposite direction with what you have alluded to in this meeting. The reports that we received there are showing that we're making progress, though not at a pace that we would have wanted to. And I have issued a directive in the department that we must ensure that all our regional hospitals are accredited by the HPSA and the South African Nursing Council, so that when you have a registrar in Universitas Hospital, you can then deploy that registrar in Mufumadi Manapo Hospital so that that registrar does not lose the notional hours as and when they are in the site. So that process is being given attention so that we do not have staff losing out. And it doesn't help to have all registrars concentrated in Bloemfontein when the actual service and the actual training is needed out there, because we train these doctors to be able to deal with the current diseases that we're dealing with, because we can't be training them to deal with diseases that do not exist in our country, because that will be counterproductive. So to a certain extent, Chair, that's where we're trying to move. Maybe I can allow the HOD to assist in terms of dealing with the rest of the issues. I think I've dealt with those that I thought needed to be attended to first. Thanks, Chair.
Jody?
No. Thank you, Honorable Chair and Honorable members and MEC. MEC, the fact that I've not been with the department for long, it's a limitation on my side. However, I want to indicate that the time that we have spent with the team to date, we were able to identify 4 critical things. The first one is that we must strengthen our clinical governance as well as patient safety. And that would require us to establish clear accountability, lines, how do we drive quality improvement, and how do we deal with the issues of medical legal. To some extent, we have dealt with 2 elements of this. And obviously, given the challenges that the department has been facing over the years that have accumulated over time, it would be important that we present on our short-term as well as our long-term plans to deal with these issues. So that's the first part of it. The second part of it is, how do we achieve sustainable health and ensuring that our finances will improve, or the utilization of our finances will improve operational efficiency. It's a concept on its own. It deals with our long-term and our short-term health, financial health, because the issue of the budget is being raised. How do we then optimize the use of our resources, and how do we deal with restructuring our debts? For example, we already have done a study on our accruals, and we have presented that study to the provincial treasury. And that study was done within the shortest period of time to say, given the plans based on the available information at the time, it will take 2 years to clear our accruals. And the plan was presented, National Department of Health was there, and they were also, together with National Treasury, happy with the plan in terms of what we could put together given the information at hand. The third pillar is, how do we then ensure that we improve our workforce and we also enhance we have an enabling environment for people to perform. The issues of infrastructure then becomes key to say in order for the clinical personnel to perform, they need adequate infrastructure, which is a problem at this point. And there is now a plan that deals with infrastructure. And this plan is as follows. One, we are saying, let us start with infrastructure at a tertiary level. That is your Pilinomi universitas, but we also include national. There are projects that have been going on for years. I'm able to present to the committee the plan about Pilinomi and the timelines based on the work that we have done, being physically there with consultants, with contractors, with officials of the department. We are able to give the same plan for national, which was not operating for years. I mean, for 2 years approximately after the fire. Today, we were opening another facility there. We have opened another one 3 weeks ago. So there's a plan on national. There's a plan on universitas. There's a plan on Boitumelo Hospital in terms of the timelines of opening facilities in those hospitals. Now with Boitumelo, there are facilities that are going to be handed over by the end of, they are ready now to be handed over within a couple of weeks. There are those that will be handed over within a month from now. And there are those that are going to start. And we are very clear in terms of how we will ensure that once they start, they are completed. Because one of the critical things is that we start projects and then we don't have finances to ensure that they are being completed because we are not paying service providers on time and they leave site. So the issue of infrastructure is very key. Honorable members, contractors left site in most of our facilities. We are in a program now to reinstate all of them back to site so that they can perform, including the consultants. Some were terminated, some left site because they were not paid. So the issue of infrastructure will assist us in terms of ensuring the environment that is conducive for work. So that is pillar number 3. And then the last pillar is just how do we transform our health sector to be more digital in terms of how, for example, the issues of EMS, the issues of referral systems, etc. So for me, at a strategic level, I think there is a need for us to present to the committee to say, after having identified these 4 critical things, what are the plans in terms of ensuring that they are being attended? The issues of the mortuaries, the MEC has dealt with them. One, in terms of autopsies, there was a big backlog. And it was about inefficiencies that were in the system. Currently, the backlog is reduced to 7 days. The second issue is the mortuaries that were closed by labor. The one in Bloemfontein, it is fully operational. The one in Kwakwa, on Tuesday, there was a site meeting to look at the work that has been done, that has been completed. And in terms of infrastructure, everything is in order. The only element that is left is the environmental health and safety assessment that is scheduled for next week. The Department of Labor was also there. So once they give us a green light in relation to that part, the mortuary will be operational. Beyond that, we looked at all the other mortuaries that are there. Botshabelo 1, we are hoping that the handover will be by the end of next month. The maintenance work has been done. The only element that is left is the HVAC system where the contractor is currently on site. The other mortuaries, if you look at your Bethlej, you look at Kronstadt, you look at Sasolburg, they are not closed, but there are issues that were raised by labor that we are currently attending to in terms of appointment of contractors. So we try to sit down with the MEC and say, within the shortest period of time, what are the things that are reportable that we can say we have done, and at least we were able to ensure that they are done. Now, the issue of staffing is a big issue, and the approach that we took, and unfortunately, we are not able to appoint for all the areas at the same time. We have started with Pilinomi. we are able to share the statistics in terms of the appointments done over the last 2 months. And the numbers are quite huge that can be reported. So there is movement in terms of some of these elements that I spoke to, but I agree with the committee that our performance for the fourth quarter, which was the end of March, and the first quarter, which was the end of June, are undesirable. However, we are now going to meet as management even before the end of the third quarter, the second quarter, to look at where we are at the moment and say, how do we then ensure that come the end of the quarter, we have improved? Expenditure of 7% that was reported, we have worked on that part of work, consistently, and we are able to indicate that come the end of the second quarter, we should be able to report improvement. So I will then allow the team to give direct responses in relation to other issues. Maybe lastly, Chair, we had a revenue workshop where we are saying this is how much we are collecting. This is how much we are collecting from Lesotho, from correctional services, and from road accident fund. Are we collecting what we should be collecting? Is it complete? The answer is no. We are not collecting everything that we should be collecting. There are deficiencies in the system that we have identified that we can present to the committee to say, this is what we find out, and this is how we think that we will improve, because the plan is already there. The same with the plan on medical legal, that is already there. The other plans in relation to the theaters that are not working in regional hospitals, that are putting pressure on tertiary hospitals. For example, you go to Boitumelo, you know that there are 5 theaters, only 2 are functional. We know now what are the reasons, and we are focusing on that. So we are pleading that we maybe present some of these issues before the committee, and then the committee can then decide afterwards as to whether we are turning the corner or not. MEC, I will then allow colleagues to respond to specific issues that I might have not touched on. I was trying to be general in terms of the approach. Thank you, MEC. Colleagues, Ntate Chris, Dr. London, Ntate Mfuke.
Yes, sir.
Thank you, Honourable Chair. Thank you, committee members. Just in terms of some of the finance questions, so in particular around medical depot, does it keep its profit? So medical depot is established in terms of section, Treasury Regulation, section 19. So what happens is annually we then write to Provincial Treasury for the depot to keep its profits, and through that process it is allowed to keep its profits. So unlike the department where it needs to surrender its revenue, the depot we do write to Treasury and we're allowed to keep it from that point of view. In terms of the budget shortfall on medicine, so I think CEO depot will come in, but just the analysis that National had done across the country a few years back, we were looking at roughly a shortfall of about 400 million. So considering that we as a department put close to 1.2 billion to medicine, that shortfall is in the region of about 30%. Just on medicine itself. And obviously we know that health inflation, especially on medicine, is far higher than the normal inflation that our budget is growing at. So every year we're just falling more and more behind. So the only alternative is to maybe consider reducing services to allocate money to medicine or through donation processes. In terms of the question around the 70% on the COE, so the 70% represents out of our total budget, we put 70% towards COE. So we put 9.9 billion out of the 14.1 billion to COE. So that's where the 70% comes from. Then in terms of the first quarter, out of that 9.9 billion, we've only spent 24%, which is 1% behind the baseline norm of 25%. So that's what we're referring to, is out of our total cake, if you want to call it that, 70% of it goes to COE. And then we've got 25% that goes to goods and services, which is your operational consumables. And out of that 25%, which represents 3.6 billion. At the end of the first quarter, we've spent 18% of that. So that one we are slightly behind. As we've alluded to, there are some accruals, validations, and processes that were needed in that space. In terms of the listed debt, so it's twofold. We have the referral system, and when we say the Lesotho government owes us 100 million, it's talking to the referrals. So that's specifically oncology patients and all of that. What we will do going forward is we will try and bring in that slide element showing how much is referrals and what is the history. If the committee recalls, the previous financial year, the Lesotho government paid us just over 200 million. So the debt has come down substantially, but it's still at 100 million. So it's still, we still need to keep chasing and clearing that. But on the other side, it's then the walk-ins. So it's not a referral, it's a foreign national, and we need to start computing what that is and what is the impact on the provincial fiscus. And because, like we said, the equitable share formula doesn't account for that. And what is the alternatives that MEC spoke about that we'll look into around that. We agree the accrual project is a program that we're working on. We've managed to claw back some of that. So 4 years ago, the department's accruals was only at 600 million. 2 years ago, it was 1.5 billion. We've reduced it now. Currently, at the end of the second quarter, we're estimating in the region of 900 million. And we're clawing that back slowly. But we must understand that it's not because the budget has grown or ballooned. This is now efficiencies and sacrifice in service delivery to some extent. So it's finding that perfect balance to ensure that the needs on the grounds are still met, but without overcommitting the department, because that's when the challenge of the SMMEs and that kicks in. Let me just check. All right, I think the rest are all just inputs that we've received, so we appreciate that from the finance point of view. Thank you.
Honorable Chair, I'm just going to respond to the issue, Honorable Chair, about the water in Zastron. Unfortunately, the time that you went there was a crisis at municipality, but the clinic is able to get the water from the hospital because they have a borehole at the hospital. Yes, when you were there was a crisis. The issue of that was raised of EMS changing of linen. There is an SOP that is available for EMS and the other hospital to follow. Maybe I think there's a problem of adhering to that. We will look at that. The aircons at Albert Nzula that were not working were fixed. They were fixed that were not working in maternity at Albert Nzula and Diamant Hospital. The shortage of linen. What is happening currently is now we are in the process of taking stock of our linen, and also ensuring that every piece of a linen that is in the province is counted for. And also there's a process that is there's a process of buying a new linen. I hope that when we come in the next quarter, we'll report the progress, how it has improved. I just want to explain one thing: is in terms of the delivery of medicine, medicine, especially for chronic patients, delivered by community health workers. So those are community health workers. They are not professional nurses. They are low. Their qualification is less than the professional nurse. So I just wanted to make that correction. Maybe to explain in terms of maybe I think I might have created a confusion. There is those facilities that administer immunizations. That the department has an agreement with them that they are issued immunizations, not your normal medications, but it's only with immunizations. And they enter into a MOU and service level agreement with the department. And then they give us the statistics, that's what they do. So that statistic is included in the department achievement. Yeah, I think that's, no, thank you. I think Memolongwa now, left to the others, Chair.
All right, thank you, Chair. Reporting on the accruals, year on year, there's the accrual system that has become cumulative. As Ndate Chris explained, we are not always allocated adequate budget for medicines. Therefore, upon submitting claims to the department, there's that remainder. Let's say, for example, budget allocated was 900 million, but the actual expenditure is 1.4 billion. So that difference then accrues year on year, because it means moving on to the next year, there's that shortfall in terms of the budget. So it's been cumulative over the years. 2021, there was 520 million, 2023, 458, 23, 24, 718. But as Ndate Chris has said, we're trying to claw back on the accruals. They reduced 24, 25 to 548. And there's that balance that we need to strike between continuing providing medicines to facilities, but at the end of the day, we also owe suppliers, that we are not receiving the money from the department. As a result, we need to reduce the orders we place with the suppliers so that we reduce what we owe them in terms of our creditors. And that also reduces the level of replenishment in terms of buying medicines with the suppliers. I mean, if you owe Adcock 20 million and you want to submit an order for 23 million, it does not make sense for us to be able to replenish the warehouse to a level that we are able to meet the demands of the facilities. So as a result, it had a negative impact on our ability to meet our targets. As indicated, we are only performing at 85% in Q1 because of those accruals to the department, or from the department owed to the medical depot. The donations, we received donations from National Department of Health through donations that come from the Global Fund, and focus is on ARVs and TB medicines. In terms of filling of posts, I would assume that the entity was proactive because we had submitted a request for additional posts on the staff establishment of the department when we're reviewing the organizational structure. But unfortunately, the structure is not approved yet, but we still have that budget that we had put aside for filling of posts because the operational needs have increased to a point that we need additional staff. But because they are not created on the staff establishment, we keep having to go back and request 3 additional SCM. So there are inefficiencies in our ability to spend the budget that we had put aside, hoping that we get that finalization in terms of the organizational structure with the department so that we are able to fill all those vacant posts. I think I've addressed all the questions, Chair. Thank you.
Honorable Chair, thank you very much. We believe we have done our best to respond. We starting with the process whereby we want to fill the attritional post within the department, and we believe that will go a long way in trying to reduce the pressure that you spoke so passionately about, and I always admire the passion that you bring to the discussions in this committee when it comes to issues of health. Honorable Chair, as the department, we really appreciate the council and the eye-opening discussions that we always receive from this committee. And we just want to mention that we trying our best, and we commit that next time when we come, the report will look completely different because we couldn't start the journey before we repair the vehicle. So as you repair the vehicle, the work that you put into that does not count towards reducing the distance that you're traveling. So next time we will come and account for the journey because we believe the vehicle is getting fixed. Thank you very much, Honorable Chair.
Thanks, MEC. I think that brings us to the end of the session with the Department of Health. The we'll try to interact with the HOD and the MEC. I think that what the the HOD has said, it gives hope to say that in terms of the challenges and the gaps that are there, that there will be a management meeting to look at those things so that there can be improvement. Also that as we move around MEC and HOD, we would still be able to deposit whatever issues we come across as we do oversight, so that at least at higher level can be able to be aware of such issues. MEC, HOD, and the team, thank you very much. I've taken over now. Don't be surprised. The other chairperson has still gone to the loo. Thank you.
Yes, I thought it was off record. Yes, Honorable Chair, I'm informed that there's a community members that are mobilized for the visit to Tebe Hospital tomorrow. I'm just requesting that can the organizers assist us that services are not disrupted during the visit and the launch, the visit of the community in Tebe Hospital tomorrow as the committee visits the place. Thank you very much.
Thanks, MEC. I think we'll just have to elevate that to security. Otherwise, I don't want to see Ndatemeko without teeth. Remember one MP in Cape Town got a if that is the case. Thank you, MEC.
Thanks.
Please leave us. Please, Poka, just leave.
Of the department. I don't know if we can note that as well, considering the problems and challenges that are facing the department, and the time that we need to give to nitty-gritties. And equally, I don't want to degenerate the importance of that strategic. Maybe Honorable Zama had requested that perhaps we must give the department a hearing. Mohlomong we can exploit that time for them to also, as and when they present. But we also don't want to steal their time. but maybe it's for the best that we note the strat plan. I don't know. I'm just proposing to the community. It was part of today's presentation. And for all of them, by the way. Churches?
I agree. Let's note.
Okay.
But just to sponsor one issue, Chair, I don't know if it's only me who loses the trace. Chair, we ask, I think, one question about 3 times to departments. And I think the reason is because we don't trace our resolutions and the implementation. Can we just improve and attempt to do that through our researchers so that when the department appears here, we know that last time, what did we ask them? Is it been implemented or not? So that we don't await that process, which in itself, it remains a challenge of presenting in the House, and the resolutions must still come and they take 12 years. You end up going out of office without even knowing those things have been implemented. Thanks.
No, Council taken, Chair of Chairs. I think there's also a question, Honorable Klute, that was not properly and sufficiently responded to. So we'll also squeeze that in, as and when we push departments to answer such that all for effectiveness and efficiency of the committee. Are they in? What's coming? Social development? Lunch? Or members, I'm advised that we should quickly take some few minutes for lunch. We'll gather back here. These processes are very strenuous. Nationally, le temo le dula ho fihlela ka bo matribiso. Se okay.
there are institutions that are owned by the department where we're hosting different beneficiaries in the form of elderly people, vulnerable children and people with disabilities, but including those that needs to be rehabilitated from the abuse of substance and alcohol. Now and then we'll be getting Labor Department coming to close those institutions, and it is always difficult to also register them for compliance because challenges would be infrastructure challenges. We are speaking on our behalf at the executive level, but maybe if portfolio committee can put a little bit of a weight there, because we can't keep people at our institutions when they are not compliant, when we have a responsibility of monitoring other institutions that are hosting elderly people, people with disabilities and children. Now, I'm sure by now CFO would attest to that. I think our infrastructure budget is already depleted. It is 10 million. When we have 8 institutions that are hosting people that need those services from government. However, we'll continue to provide services to the people of the province of the Free State. As I mentioned last time, some of the targets would not be met because they are not within our control. If I may make an example, NPOs that would be applying for funding, if they apply for having 26 beneficiaries, and our target is 26. And in a case where it happens that some of their beneficiaries has passed on, they have less, by the time we report, maybe they've got 23. If you look at the target would still be 26, so there would be an impression that we did not reach the target. Such target is not within our control, it's within the control of the NPO that we are hosting for them to continuously have the number that we have approved as the department. But unfortunately, people has a right to move in and out of these institutions. No one can force them to stay there. So I am not going to say much, but I think the officials will try to be straight to the point so that we don't waste a lot of time, but it will depend on questions that we receive. But our intention is not to really go into much details unless we are required to do so. So, Chair, with those few remarks, I would want to thank you.
Thank you, Chairperson. Ma'am, may I start then with you to administer the oath or affirmation?
I'll take an oath.
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Nelisiwe Pel Ndombela.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, ma'am. Would you please indicate the other officials that will be assisting you take questions for the committee?
Okay, the CFO, Mr. Rampai, the Director Strategic Planning, Mr. Nzane, the Acting Chief Director Social Welfare Services, Memangate, the Chief Director Community and Partnership Development, Meldirego, the Acting Chief Director Especially Social Welfare Services, Menondabula, and lastly, Mr. Finger, who is the Acting Chief Director Corporate Services. Thank you.
Ntatanzane, good afternoon.
Afternoon.
Will you be taking an oath or an affirmation?
I'll take an oath.
And do you consider this oath binding on your conscience?
Yes.
Please state your full names for the record.
My names are Tumelo Meshak Nzane.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, so help me God.
So help me God.
Thank you, Ntate Nzane. Ntate Rampai, good afternoon.
Good afternoon, ma'am.
Will you be taking an oath or an affirmation?
An oath will do.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Musiwa Emmanuel Theophilus Rampai.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, so help me God.
So help me God.
Thank you, sir. Good afternoon, ma'am. Please switch on the mic. Will you be taking an oath or an affirmation?
An oath.
Please speak into the mic.
An oath?
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Betty Mangate.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, so help me God.
So help me God.
Thank you, ma'am. Good afternoon, ma'am.
Good afternoon, ma'am.
Will you be taking an oath or an affirmation?
I'll be taking an oath.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
Maele Isabel Winky Direko.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, so help me God.
So help me God.
Thank you, Medireko.
Thank you.
Good afternoon, ma'am.
Afternoon, ma'am.
Will you be taking an oath or an affirmation?
I'll be taking an oath.
And do you consider this oath binding on your conscience?
Yes, I do.
Please state your full names for the record.
I'm Fezeka Fideliano Dabula.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, so help me God.
So help me God.
Thank you, ma'am. Good afternoon, sir.
Good afternoon, ma'am.
Will you be taking an oath or an affirmation?
An oath?
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Mukoteri Frederick Finger.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, so help me God.
So help me God.
Thank you, sir. Chairperson, thank you.
Thank you. Over to you, Judy.
Thank you.
Please start with the strat plan.
Thank you, Chairperson.
Remember your time.
Thank you, Chairperson. Mr. Nzane, the Director Strategic Planning, will take the committee through the strategic plan of the department.
Thank you, Chairperson and members. I will try to be quick. I will skip the slide for the presentation outline. In terms of the introduction, our APP was developed in line with the regulations. Treasury Regulation number 5 and 30 was issued in terms of PFMA so that we can all provide for the strategic plans of the department. And it is required that the plans are aligned to the NDP and the APP and also the MTDP. In terms of the background, we are informed by the revised strategic planning framework to develop our APP. Our priority context, our APP is in terms of the guidelines aligned to the National Development Plan, the MTDP for 2024-29, the Strategic Plan and Annual Performance Framework, our departmental sector strategic plan, the sector priorities and the departmental priorities. We are legislated, and in terms of our legislative mandate, social development derives its mandate from the Constitution with reference to Section 27, subsection 1C, and Section 28, subsection 128A And then we are also guided by the Social Assistance Act.
No, you know, definitions are going to take your time. If you go straight to the real issues, you have only 20 minutes.
Thank you, Chairperson. I will then move to, I will even skip the one for the strategic focus, which looks into the vision, the mission, and the impact of the sector, and look into the processes that we have undertaken. We followed a bottom-up approach, so that we consulted with the communities, the districts, in the development of our strategic plan. In terms of our outcomes that we are measuring, as discussed earlier, we aligned with the NDP, the MTDP, the 3 priorities of the MDTBP, and the DSD priorities. Our outcomes as a sector are as follows, Chairperson. I am on slide number 12. We are planning to reduce the levels of poverty, inequality, vulnerability, and social ills. And in terms of that, we have the 3 outcomes, which is a percentage of people accessing developmental services. Our baseline is 228,084, and we intend to improve by 81% in 5 years. The second outcome indicator is a percentage of individuals benefiting from poverty reduction initiatives, and our baseline is 110. We intend to increase that by 76%, and then we are also targeting an outcome of reducing the prevalence rate of GBV. The baseline is 23,806, of which we need to reduce by 86% in 5 years. And the next outcome is the empowered, resilient individuals, families, and sustainable communities. In this one, we have 2 outcomes that we are targeting. Is the percentage of individuals receiving protection, prevention, and early intervention services. Our baseline is 326,000, and we intend to improve by 119%, since we have so far achieved 100% in the current 5-year MTSF. Therefore, we'll have overachieved on that outcome. The next outcome is an integrated planning, implementation, design, and monitoring of strategies applied. The baseline is 7,841. We intend to improve to 38,039. And then the last outcome is the functional, efficient, and integrated sector, where we desire to achieve a clean audit by current financial year. Our baseline in the last financial, the audit, we were on unqualified audit with matters, and we want to achieve a clean audit, which is 100%. Chairperson, I will move to the conclusion. We developed this APP in recognition and acknowledgement of the new developments and the processes of planning from the 7th administration. And this strategic plan is focusing on the departmental interventions on impact outcomes. And as a department, we are confident that through this plan, we will improve the quality of life of all the citizens, especially the most vulnerable, marginalized members of the society. Thank you, Chairperson. We recommend that the committee note the strategic plan of the Department of Social Development for the financial year 2025-2030. Thank you very much.
Thank you. Without wasting time, the first quarter.
Thank you very much. Thank you very much, Chairperson. I will be taking the committee through the first quarter performance report for the department. On the overall performance, the department achieved 38 of the 45 indicators, and this represents 84% achievement. This slide depicts the performance per program. As we can see, it is program 1, that achieved 100%. From program 2 to program 5 is where the 7 underperforming indicators reside. Chairperson, I request permission to respond directly to the questions posed by the committee. Under program 1, on the workshops on prevention of irregular, fruitless and wasteful expenditure, the non-inclusion of the target in the first and second quarters is because the internal control unit is mostly engaged in facilitating the regulatory audit in the first quarter, therefore no target was planned. The first workshop that was planned was for the third quarter, and this is immediately after we've concluded the regulatory audit, and this enables us to address the instances of non-compliance that would have been identified during the audit. The second workshop will be then held in the last quarter of the financial year. On the appointment of the social service professionals, Chairperson, this is an annual indicator, and this is in line with the DPME reporting framework. So we've set our target for the fourth quarter for all annual indicators. However, we will still report as and when progress is made. Under program 2, on the beneficiaries of Epilepsy SA, and this is a matter that the MEC referred to in her opening remarks. We funded Epilepsy SA for 26 beneficiaries, and unfortunately 2 of the 26 beneficiaries lost their lives in May this year, and 1 beneficiary relocated to another area. So these 3 beneficiaries were no longer accessing services from the organization. On the implementers trained on social behavior change programs, Chairperson, the organizations that we fund rely on the funding that the department disperses to cover their travel costs from the premises that they operate in to the areas where these trainings would have been planned and conducted. Funding was subsequently dispersed to these organizations in June, and we were able to then commence with the training. Under program 3, children and families, on the strategies that the department is implementing to increase awareness on family services. The department partners with different NPOs such as FAMSA to continuously raise awareness and offer family preservation services. We also commemorate various days such as the International Day of Families, Marriage Week, which is being commemorated in this week, as well as International Men's Day. This also serves to increase awareness around the importance of family preservation and the importance of family as a cornerstone of communities. And to measure the effectiveness of these awareness campaigns, we use targets for the financial year, and new intakes coming from the awareness sessions inform these targets. And we also conduct our monthly monitoring and evaluation and verification and report on this. The second question posed under program 3 is on the reporting of the child and youth care workers. Chairperson, we assess the reports that are submitted from the implementers. In this case, it's RECIHA. And when we do the assessments, we focus on the specific sites or specific sites that we've identified that improvement is needed. And then we then capacitate these auxiliary child and youth care workers to address those identified challenges that were picked up in those particular reports. Under program 4, on the number of victims of GBVF who are accessing sheltering services. Chairperson, let me remind the committee that sheltering is voluntary. But as a department, we continuously implement 365 days awareness campaigns, which are conducted across communities. We also work with schools, we work with institutions of higher learning in all 5 districts in the province. And we also ensure that we communicate through media houses and social medias to ensure that this vulnerable group is reached. Under Program 5, on the implementers to strengthen household profiling, the recruitment of the implementers has enabled the department to intensify household profiling by increasing the number of households that we are able to reach across the districts. And the last question under Program 5 was relating to the community-based plans. Chairperson, we first present the community-based plans that we've compiled to the community forums so that we ensure that they are in line with the community priorities. We then also engage stakeholder forums at district level as well as provincial level in order to ensure that we leverage the intergovernmental relations platforms. And also the DDM model is critical in facilitating this collaboration across government to ensure that government is able to intervene on the plans that are highlighted in the community-based plans. And we also then still hold the community dialogues in order to give the community members the feedback that we would have gotten from the household profiling and to the related community-based plans that we compile. I will pause there. That is the end of the first quarter report on non-financial performance of the department. Thank you.
The last one.
Thank you very much, Chairperson, and good afternoon to yourself and the honorable members. The presentation that I'll be doing is the first quarter expenditure report for the department, of which it is outlined in the following: that the table of contents, the purpose to which I'm presenting, and as well as the breakdown of the presentation, which will be as per the program, as per economic classification, and the reasons for the variance, as well as the detailed expenditure per program, that as to how they performed, as well as the conditional grants and the reason for variance on those conditional grants. Adhering to what you were saying, Chairperson, let me move straight to slide number 5 and say, in the first quarter, the performance of the department was 21%, of which the expectation would be 25% when we apply the linear projection. So we were 4% below par in the first quarter. I will touch on the reasons as I move. So the programs, how they performed is that the program that performed the best was program 4, and the program that performed the least was program 2. Safe to say that all the programs, they did not reach 25%, and I will outline as I go. In terms of economic classification, Chairperson, you will note that compensation of employees, yes, is performing relatively better by 24% as opposed to 25%. And the goods and services were at 19% as opposed to 25%, I will touch. And the departmental agencies where we pay our CETA, we were at 19%. And the other one, public corporation, that's where we are paying the TV licenses. And also that economic classification that underperformed, it's the non-profit institutions where we are paying our NPOs at 15%. And the last one is the second last household where we are paying the leave gratuities as well as the machineries in the capital asset. So all those economic classification, we were underperforming. Insofar as compensation of employees, what led to that underspending, Chairperson, would be that, firstly, the annual adjustment of the SMS members, which must be applied from April, normally it now got paid in July instead of April. So it was not accounted for in there. Secondly, the issue of the vacancies in the department of the posts that were not filled within the department led to this underspending in the economic classification. Safe to say that the post has been advertised, Chairperson. We're in the process of filling most of the posts within the department. Insofar as the goods and services were concerned, Chairperson, yes, we are 6% below par. What led to this is that there was a conversion of bus and logis from version 5 to version 6. That has caused the month of April, we couldn't issue any order, nor process any payment. By the time the systems were now fully operational, which we are now using version 6, what happened is that we were able to capture as much commitments, but now we captured it towards the month of May and June. So the ones that were able to pay only amounted to 19%, and when we look into the commitments within that month, we are at about 40% of what we intended to procure. So that delay caused us not to be on the benchmark, but the procurement is on track. The account that I spoke to, that we are paying CETA for skills development levy on a quarterly basis, the bill that we got from CETA came less than what we anticipated or what we projected. Hence, you see that underspending at 19%. So we rely on CETA to bill us. Insofar as the public corporation and private enterprise, where we are paying our TV licenses, what happened there was a discrepancy in terms of the statements between the service provider, MultiChoice, as well as the department. So there was a delay in reconciling the accounts between the two departments, as we were getting some conflicting information from the service provider. And after the reconciliation has happened, we managed to pay, but in the second quarter. So that delay caused us not to pay in the first quarter for all the TVs, even in the institutions as well. The expenditure relating to NPOs or non-profit institutions, what happened there, Chairperson, what led to this 10% below the benchmark is that before we could even transfer those payments, the letters of awards, the MOUs, and any addendum necessary, they must be in place. So that particular process, there was a bit of a delay between the NPOs, some delaying to sign the MOU, some delaying to sign the addendum due to the nature and the structure of certain NPOs. So that particular delay will not enable the payment to be transferred, and such delay now caused that 10% below the mark. And also the calls for proposals were issued at around about June, when we now know and about the budget. So we called the proposals for community development, youth development, as well as women development. So such as closed and they are being appraised. Soon the transfers will happen, will happen in that regard. This one chairperson the household that relates to the leave gratuities of the officials who would otherwise resign, otherwise retire, we would then do the projection based on the information that we have from the system, meaning for the officials that would be retiring. But in the process of which there would be officials who would exit the system due to natural attrition that we did not anticipate. There would be official who resigns as and when, so that caused that particular overspending. And insofar as the capital asset is concerned, Chairperson, indeed, we have the commitments that we thought that we would be able to pay in the first quarter of the laptops that we had ordered. So laptops, indeed, they were received in June, all of them. But the process of barcoding them, putting them into asset register took a bit long before we could issue that particular payment. So the administrative issues delayed the payment of this laptop in the first quarter, Chairperson. Now, this would be the reasons per each program. On slide number 12, Chairperson, you would see a common trend of reason when you come to compensation of employees, in that the reasons are pretty much the same, in that the SMSs of that particular programs would not have received their annual adjustment, and also the vacancies that relates to that particular program would have pulled that expenditure down. So that is basically the main issue that pulling the COE down. Goods and service, Chairperson, that delay that I spoke about of conversion of the systems caused this particular delay in this particular program. Safe to say that the commitments that we managed to raise so far are promising. Chairperson, I spoke about the CAPEX as well. We can go to program 2. I would not touch on the COE as I've already touched, but on goods and service in this program, Chairperson, you would see that the payment for catering at the institutions, it also applied to program 2, 3, and 4. The catering to the institutions, the invoice for the month of June, because they bill us on the 31st of the month, what happens is that it will get paid in July because it would have been received in June. So the first run of July, that invoice would be catered for. So in this instance, it was not catered for in June. And also there are the provincial and national golden game, they were to take place in the second and third quarter, although the budget was there since the first quarter. So that's what caused that particular delay. In program 3, Chairperson, the reasons, like I said, you would see the similarities even here. Much of the expenditure that did not occur is because of that catering for the institutions in this particular program. And in program 4, Chairperson, you would note on slide 18, you would note that they are on par insofar as COE is concerned, but insofar as goods and service is concerned, they were also below par, mainly for that reason. The catering for the institution, Chairperson, has much of the budget in the programs. So if there is no much movement, it creates that impression of underspending. Like I explained, what would be the reason in terms of invoicing in the cash basis of accounting. The last program, Chairperson, which would be program 5. In program 5, Chairperson, much of the activities of that program, they were planned for quarter 2 and quarter 3. So that's why you would see a little bit of underspending in quarter 1 because of their activities were planned for the subsequent quarter of quarter 2 and 3. So the budget is available from quarter 1. Calls for proposals has been issued, as I indicated, in these particular programs, and it has closed. They are busy appraising those that we would be appointing. Chairperson, one of the sour point that I have to report on is the conditional grant. In the first quarter, we were at 1%, Chairperson, of spending. I will explain on slide number 24. In terms of the recruitment of the data capturers, what happened is that this is the APWP grant, whereby after the contract of the previous cohort has expired, we are duty-bound to start the new process of recruiting the new data capturers. Now, the process of recruitment, as you would know, it takes a little bit of more time. So in this instance, we were able to appoint in June some data capturers, and now others in July. So that's what was the delay in terms of COE. In terms of the transfers of to the CNDCs in this particular grant, the delay is common with others, whereby the signing of the MOU with the compliant CNDCs and also the addendums between the department and the qualifying CNDCs, which created that bit of a delay. Safe to say that the payment was only released in July, amounting to now 31% of that. So that 1% that you see in the first quarter has been cured as we speak, but that delay caused a little bit of that back and forth of the documents caused a little bit of delay in terms of transferring. So the department is able to create 135 work opportunities in relation to that grant, Chairperson, and that's how they are being distributed. Chairperson, that's the long and short of the expenditure report for the first quarter. Thank you ever so much.
Thank you, honorable members. Those are the 3 reports in front of you. Let us go, Bell.
Thank you, Chair. I just want to ask
on the issue of Program 5, Development and Research, as to the performance indicator of the number of households. I see that the reason that is cited is the issue of capacity and capacity constraint and appointment implementations. So my question is to ask that when the department, when you are going to a strategic planning, you revise the indicators. Didn't the department pick it up that there's going to be capacity constraints and then including the issues of the appointment of the implementers? I'm not sure if these implementers, they are service providers or not, because when you read on the issue, on the corrective measures, that the recruitment of implementers will be used to strengthen the capacity. So it also talks to the issue of the strategic plan when the indicators were revised. Was there no any proper understanding of how are we going to, the department is going to be able to achieve this target? Because when you check, it's the performance 47%, which means out of 1,484, the department only achieved 702. But fairly, the department is doing well in terms of performance, but it's just this small issues that it needs to address. The other issue that I want to attend to is the issue on the sub-program of HIV and AIDS. I understand the output is the target was 112, and then they achieved it 72, 64%. But when you look at the comment, the Kharib, the 2 district trainings were postponed. The other one was postponed due to funding. The latter one was due to postponement of the training that was scheduled for June. So, but there are no reasons as to why it was postponed and so forth. Perhaps in future, the department, when they do these comments, they must assist us so that we don't have to come and ask now, why was this meeting postponed and what are the reasons that it could not proceed? So when you are doing your comment, you assist us to ensure that you just give us the reasons so that we don't have to ask. And then lastly, Chair, I saw on the strategic plan, the first outcome, which is to reduce poverty, inequalities, and social ills. And then I just want to check with the MEC and the HO that do they think to achieve the 3 indicators that have been stated on that outcome, that they have enough budget to be able to achieve this outcome? Because when we speak about reducing poverty levels, inequalities, and social ills, it's a huge responsibility, because you'll understand that the National Development Plan cites poverty reduction and inequality as the 2 biggest challenges in the country. So I just want to understand, do they think that the budget that is currently allocated, will the department be able to achieve that outcome? And what are the poverty reduction initiatives? Just to get an understanding, what are these poverty reduction initiatives? Thank you, Chair.
Let me start with Director Lute.
Thank you, Chairperson. I think we should take note of the fact that the MEC said that the infrastructure budget has been depleted already. And that is concerning, and it's something we should take note of. If there is an amount that we can put on the needs of the Department for Infrastructure, what will that amount be? If I have a checkbook and I say, I'm going to give you money for infrastructure, what will that amount be I need to write on the check? Thank you, Chairperson.
Thank you very much, Chair, and thank you for the presentation. Chair, yes, just a question. Provincial Treasury has, when they gave their briefing, they said that there is a projected over-collection on own revenue by the Department of Social Development of 133,000 rand. It seems to be regarding the stopping of funding to NGOs where they didn't comply with certain criteria, which must be welcomed where it is then seen that the criteria isn't being met.
But just to get an indication, is this a reoccurring issue? Because I would hope and think that we want to get each and every single rand that can be validly used to NGOs. But again, if they are misusing or not complying, thank you, and we do understand that that is being stopped. Just an indication about their compliance in general, and are there some trends you are seeing where, why aren't they getting the full allocation? And then in terms of Program 1, Treasury also indicated that there was no planning, wasn't included, no planning on UIFW workshops in the department as an APP. So that's something we need to take note of. And then in terms of your APPs, is there any indication in terms of getting people off the streets, or basically reuniting destitute individuals living on the streets with their family? Is it included under the program? If not, I think it's something that the department must look to in future as to engage local government as well as various other departments to see how we can best assist people living on the streets and to get them reunited with their families and to get them the assistance they require. Thank you, Chair.
Thanks very much, Chair. Mine is just a very short one. A couple of weeks ago, we had an oversight visit in Botshabelo on Charlotte Maxeke Treatment and Rehabilitation Center. State of the art, that much I must say. But I think the Department of Public Works and Infrastructure has left the Department of Social Development with an egg in the face, and I don't know what must be done with that building. The challenges that amounts to millions of rands that are there, but equally having to spend fruitlessly for security and everything that goes with it. Has the department perhaps come to some form of an undertaking, at least from either Department of Health or stealing from some of your COFA's CFO to have a sense of what should be done? Because in the meantime, we're losing out. The clients cannot be provided services there, and I think every client counts, because now majority of them, they either have to be returned home or deferred to other treatment and rehabilitation centers. So is there any plan, at least in the immediate, what must be done with that department? Thanks, Chair.
Shuji.
Thank you very much, Chairperson. On the infrastructure issues at Charlotte Maxeke Treatment Center, yes, indeed, there is a plan. The main issue is with the electricity supply to the center. The department has advertised a tender, it's closing today, for the replacement of the electricity cable that provides power from the substation to the building. And as a interim measure, we have at the center, like the honorable member noted, security officials that are safeguarding the building. And we do have a generator that is providing basic power supply to ensure that those security officers are not in the dark. We have transferred the service users that we had there to the Dr. Bears Nodia halfway house so that they can continue treatment, and some of them have been transferred to Aurora in Bloemfontein, which is a privately owned substance abuse treatment center. And Chairperson, on the family reunification, I'm going to request Memangate to explain our family reunification services that we provide. I think while we do not have any residential care facilities for destitute people on the streets that are over 18, we do have our drop-in centers for children that are found on the streets. If we are not able to reunify them with their families, then we do have residential facilities to admit them. but Memangati will then elaborate on those family reunification services that we offer to adults. And on the workshops, where Treasury indicated that we had not planned the targets, Chairperson, we had also indicated as part of our presentation that mainly the internal control unit that conducts those workshops, remember those workshops are there to educate and create awareness around non-compliance in terms of unauthorized, irregular, fruitless and wasteful expenditure. Mainly we are busy with we are engaged with the regulatory audit. AGSA is normally conducting the audit in the first quarter as well as the second quarter. The audit then concludes in July. Then we plan our workshops for the third quarter and the fourth quarter, where we can address those specific identified instances of non-compliance, and we speak to our officials to ensure that they are aware and they know how to prevent that non-compliance. And on the non-compliance of NPOs, Medireko will provide clarity in terms of whether it's a trend that NPOs are non-compliant, but I think most importantly, to highlight what it is that the department does over and above stopping the funding, to provide support so that to ensure that those NPOs have the capacity to comply and be able to receive funding again. Because whether we like it or not, there are still beneficiaries out there that needs those services. And as the department, we need to partner with those NPOs that are based in communities so that we can extend our reach. Honorable Skwebela had raised the matter on the targets that were not revised in line with the capacity constraints. Medireko will also elaborate on what targets we had for profiling of households and really the impact of the implementers. They are not service providers. They are officials that we've appointed on temporary basis in order to increase our capacity and enable the department to be able to reach all the wards within the province. And on HIV and AIDS, the underachievement in terms of the training, Menondabula will also elaborate those specific reasons that were not made clear in our report for the variance. And then lastly, on the strategic plan, our objective to reduce poverty as well as inequality. I think the MEC, when she made her opening remarks, she did refer to the inadequate budget for us to be able to fulfill our mandate as much as we would like to. It was specific to infrastructure, but I think we know all the fiscal challenges that are besetting not just the provincial government, but nationally. And truly speaking, there can never be enough resources to really do what we need to do. But Medireko will then speak on the budget that has been allocated for poverty alleviation to the department and what initiatives we pursue with that budget under poverty alleviation. Chairperson, I will hand over to Memangate first, and the colleagues will then respond as guided. Thank you.
Thank you very much, Chairperson. I'll respond to the issue of people living on the streets. I just want the House to take note that we have two categories of people that we see on our streets. It's people living on the streets and people that are working on the streets that are not necessarily homeless. However, with people living on the streets, we have what we call family preservation program in the department, whereby we would individually go and collect those people that would have been identified and try to reunify them, obviously after investigations done. Also, we would work with 24 funded NPOs under this program, Family Preservation. We equally work with other government departments, which is SAPS, Department of Home Affairs, because most of them you find that they are not having identification, and the Department of Health.
For children living on the streets, we equally have drop-in centers like the HOD has already indicated, where we'll put them there in the meantime while we are trying to do proper investigation. If there's no family to reunite them to, we'll then put them in our child and youth care centers. Thank you very much, Chairperson.
Thank you, Chairperson. I think I have to respond to 3 questions. And if I'm allowed, I will start with the suspension of NPOs. The suspension of NPOs, I think, at a country level becomes a problem because as departments, we are expected to ensure that we are able to follow the money. As Auditor General would want us to do. So it is our responsibility to ensure that the organizations that are allocated a budget are able to report on the money that they spend and also justify the money that they spent. And we're just not going to approve any other organization that seems to have spent money correctly. But if we follow the money, we see that the services that we had partnered with the organization for has not been rendered. I wonder if it would give the member any comfort, Chairperson, if we were to say that for the 2024-25 financial year, as a department, we only suspended 4 organizations. And as Mendombela indicated, for us, it's equally our responsibility to ensure that we give them the capacity, because there are people that are going to suffer if the services does not continue. So what we then did was to rehabilitate those organizations. Ideally, when we rehabilitate, if there are the culprits that have been identified, we then give the organization an opportunity to replace the members of the organization to ensure that the ones that are brought on board are going to follow the processes, and the ones that were seen to be at fault in terms of irregular expenditure of funds or spending the money not for the intended purposes are then replaced. It's too early to call for this financial year to be able to say we're going to suspend this number of organizations, but we are doing the best that we can in the department to ensure that we do not do that. Hence, we are monitoring on a monthly basis at district level and on a quarterly basis at provincial office to be able to detect as early as possible if there's a snake in the grass that needs to be followed. That's the first response. The second one is about the household profiling target that we did not meet in the first quarter of the financial year. Chairperson, I think we can be blamed as a department for putting the cart before the horse. We started as early as possible with the recruitment of the additional capacity for household profiling. We were hoping that even if there is a delay, at least mid-April, we would have then finalized the process and we can then start with the household profiling. But matters did not go according to our plans. Unfortunately, the approval was only provided in May 2025. Hence, the new recruits could only start on the 1st of June. And before they could even start, we had to ensure that they have the correct training, they have the correct tools of trade to be able to do the work that they have been recruited for. But I can give you the assurance that in the second quarter of the financial year, with the additional capacity that we have, we are well underway in terms of achieving our targets and also covering some of the profiling underperformance that we did in the first financial year. Unfortunately, or fortunately, we're going to spread it across the financial year to ensure that come the end of the financial year, we have profiled the targeted households. And if it's possible, because with the capacity that we have, we are most likely to surpass the target. It's important because household profiling is what we use as a basis for informed planning, for better planning. We're trying to move away from the top-down approach where we have to get the voices of the people on the ground that we are meant to serve. So household profiling, it goes a long way in assisting us and to ensure that we're able to do that as a department. The last question, I think, was the allocation of our poverty alleviation and sustainable livelihood program. We have been given 14.5 million for the purpose, Honorable Chairperson. We have to date allocated about 12.5 of the amount to our community nutrition and development centers. Those are the centers that we use to ensure that people that are living in households that are below the poverty level that are living below the poverty level are at least given nutritious meals. Granted, it can't be for 7 days a week, it is for 5 days a week, but also to supplement that, what we try to do at these community nutrition and development centers is to provide developmental programs that are going to ensure that these people are able to also get the requisite skills to be able to earn their own income. Libona on their own. But we also supplement that with the allocation that we've been given for our expanded public works program, where we then identify some of the members, and not all, unfortunately, due to the limitations of the budget, because we've been allocated 5.2 for that purpose, where we give people stipends. And apart from the stipends allocation, we also have skill development programs under the APWP grant allocation to ensure that we are able to give people the skills that they need. For our youth development and women development programs, which is also part and parcel of our poverty reduction initiatives, honorable member, we have been allocated 3.5 for women development, 1.5 for youth development. And I think the MEC should be accredited for that. The strategy that we are using in this financial year is to ensure that we are partnering with organizations that are able to create additional work opportunities. Because with more people that we're able to create work opportunities for, we are able to then reduce the poverty levels of the community members in the province. Thank you.
Thank you. HOD, you see, when you bring the whole team, we get intensive responses. MEC, over to you. I hope now you are closing.
Thank you very much, Honorable Chair. Akere Rona, we are a department which takes a brand when the economy is not growing, when unemployment goes high. Everybody comes to social development through grants and social relief of distress.
So you are the mother of all orphans.
Yeah, so I'm a mother of all of you. Chair, maybe mine is just to make an emphasis on the questions that has been responded to. You know, the issue, NPOs are a backbone of the department because they assist us to perform our responsibilities. Because if we were to perform those responsibilities alone, our COE will be 500% above the required norm. So that's why we're taking NPOs very serious as the department. But as much as we take them seriously, we need to follow the funding because Auditor General does audit this funding that goes to those NPOs. And before we can do any transfer, we must make sure that there is compliance because we transfer money to them quarterly. Now, before we can do the next tranche, we must make sure that they have complied with the agreement that they have signed with the department. If they haven't, there's no way that we can transfer that money. But I think as Mayor Direko has mentioned, we do provide continuous training to NPOs, and we also give support to them if they have not complied. Make sure that they comply so that they get their money. Reuniting families is a very important matter where we need to really intensify moral regeneration for us to have strong families with strong values. Because I am intending to partner with legal aid for us to assist the poorest of the poor, for their parents to sign the will. Because most of the people that we get in the streets sometimes when you talk to them, you'll find that it's children, parents did not have a will, and parents passes on, children are remaining, and some of the relatives, they take the house or the belongings, or they don't treat those children well, and then they opt to go and stay in the streets. So we have noted that challenge. that there's a need for us to create an advocacy on families to sign wills. Ke a tshepa le na le tsona le lona ka mona. Because that creates a big problem when parents passes away, especially when kids are still underage. So we have realized that because it is not correct for anyone to stay in the streets. So those programs, but we also need to, as we are strengthening families, try to capacitate them on conflict resolution skills. So that when there's a conflict arising in the family has a way of resolving the conflict, because even if we can send social workers, if the family is not willing to resolve their conflicts, those conflicts would continue, would see many things happening, including the divorce. So we just need, we're not saying people must stay in marriages that doesn't have love, but conflict resolution measures are important in any situation. So we are also intending to, it's just that we've got too many plans, but our plans sometimes are weakened by the budget that we have. And poverty reduction initiatives, what Mewinki has mentioned, that's a temporary relief of hunger to those that can't provide food. Our CNDCs, where they are, we fund those NPOs to cook and give those people food. That's temporary. But for poverty alleviation, as the department, we have funding for cooperatives owned by women and youth. So that's the money that we spend for poverty alleviation and reduction of hunger. But we cannot be able to succeed working alone as the department. We need to work together. Like I was saying to this dear Honorable Chair, we have young people that we are rehabilitating from the abuse of substance and alcohol. Now, when they have been rehabilitated, when they go back home and they don't have anything to do, they relapse. Now, if we are able to integrate, work with them, we would be able to say, look, these people has been given skills, because we also give them skills at our institutions. These people has been given skills, assist them to start their own cooperative or business, fund them so that they don't go back to street and relapse. Therefore, DDM becomes very much important to the work that we do. Lastly, the infrastructure budget in the main, we're using it for upgrading the facilities that we have and also strengthening security. You know that we have what used to be called stout schools in the past, where children who are in conflict with the law, they don't go to prison, they come to us in Kronstadt, in Kwakwa. Therefore, security there must be strengthened like the security at the prison. That's the unfortunate part. So in the main, we're using that budget for those, and also maintenance, because each and everything, if it's not maintained, it collapses. But unfortunately, we have this budget that we have, and we can't stretch ourselves above this budget. If it was our choice, we would say, let's get double of our budget as the department. Thank you, Chair, for the opportunity, and we will endeavor to change the lives of our people within the budget that we have. Thank you.
Thank you, MEC. You remember before the World Cup in Brazil, there was a rumor that Brazilian security is killing those street kids as part of reducing the social security problem. So that when you visitors go to the World Cup, you don't meet those multitudes of street kids begging money from you. So I'm not saying anything, I'm just saying. Yes. Thank you. Please leave us in peace, not in pieces.
To have received already the apology. Healthy care now. The education. So, in the absence of the MEC, will Somar Hama, Kibone HOD, we're co-chairing here, the chair, Propac, Honorable Opo Khwabane. So what he mentored me with is to give you 10 minutes with every presentation, 10 minutes strategic planning, 10 minutes financials, 10 minutes non-financials, and then we allow honorable members to interact with the presentation, and then I think you've been here for a while. It's just your mother is not here, so we're able to abuse him nicely. So please forgive us and start with, I think, Honorable Tuankang also. Yes, let's start there first, and then Somar go straight to presentations.
Good afternoon, HOD. I'll start with you. Are you going to be taking an oath or an affirmation?
Oath.
And do you consider this oath binding on your conscience?
I do.
Please state your full names for the record.
Tshwarelo Malapane.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, Dr. Malapane.
Chair, I would request that with your kind indulgence that we swear in the CFO.
Good afternoon, sir.
Good afternoon, ma'am and the members.
Will you be taking an oath or an affirmation?
I'll take an oath.
And do you consider this oath binding on your conscience? Please state your full names for the record.
I'm Oleha Jacob Ledibane.
Do you swear what you're about to tell the committee is the truth and nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
Thank you, sir. Chairperson, thank you.
All right, we are in your hands, HOD and the team.
Thank you very much, Chair. Chair, I will start first with the 5-year strategic plan for the period 2025-2030 of the Department of Education. I'll spend probably less than 10 minutes on this presentation, Chair. It encapsulates our global view of ensuring that our learners are put in a strategic position to be global citizens. We also take a continental perspective as well as a country perspective, which is South Africa, but we are led by the sector from the DBE, which is the Department of Basic Education, as well as our provincial objectives moving forward. Chair, we are led by 3 broad priorities. That will be your MTDP, strategic priority 1, inclusive growth and job creation, strategic 2, priority 2, reduce poverty and tackle the high cost of living, and strategic priority 3, which is a capable and ethical developmental state. The sector developed core priorities. There are 5. They are still mirrored within our own provincial priorities, but we added 1. So we've got 6 priorities for the province. If you go to extreme right, the legend is green. You will see that we've got curriculum recovery and offer skills and competencies for the changing world. This is trying to ensure that we infuse artificial intelligence, 4IR, within our teaching across the sector, as it were. I wouldn't belabor this, Chair. What we have done, we have since recalibrated our mission and our vision so that it actually, and created an impact statement so that it mirrors the priorities of the 7th administration and the new strategic objectives that we have set for ourselves in the department. I wouldn't bore the committee with that. Chair, I would just want to say all the priorities that I spoke about are now driving our strategic plan. The first priority being improve access to early childhood development. The transition of the function from social development to education is mirrored in our planning moving forward. But here, what is important is the baseline. The baseline is the current children that we had in the system as at November 2024, but there is also a blueprint that was received from Stats SA. You will see that there is a deficit between the 2 figures, which translates to about 19% that we need to increase in our baseline in the next 5 years, which will give us 70% improvement, because it's very important that the 4-year-olds attending pre-grade are actually taken into account, because we can't leave learners out of the loop to ensure that there is redress and there is access. I think the same goes to percentage increase of 5-year-olds attending grade R. The legend is still the same, and the narrative is still the same. Here the projection is that we want within the next 5 years, 60% of the children that are in this specific age cohort are actually within our systems or our institutions. And then the second one is improve literacy and numeracy across numeracy skills across all phases of schooling. Chair, you will see that at the moment, all the targets that we have there, from target 1 to target 8, the baseline is very high at this current level, and they are calibrated at those that performed at level 4 and above. This is what we seek to achieve, because we believe that our learners, when pushed enough, they can give us this outcome. But for each, if you look at the extreme right, we are actually telling you what we want, what is our destination in the next 5 years. So, and I think that we are not overzealous. I don't think we're punching above our weight. These are things that we can achieve. The next target is improve access to inclusive education and social cohesion. We have 3 broad principles. Chair, I would just pick on sport. Currently, our baseline is 220, but you see that we've got a longer horizon of about 550 schools and more learners being involved in various codes in sport. So I think it is not an overzealous target. It can actually be achieved moving forward. The third one is improved access to training and professional development opportunities for our teachers. A child is only as good as his or her teacher. Our current baseline is 40%. We want that to, within the next 5 years, to be at 60% percentage of teachers that we train without fail. Because continuous training and ongoing training, they give us value. It ensures that education evolves, but teachers are able to deliver pedagogy. And then the fifth one is improved safety of schooling environment. This deals mainly with a meeting of our minimum infrastructure norms and standards. If you don't provide proper accommodation, the elements of safety, they crumble. It's not necessarily physical safety in terms of safety of learners, but also providing infrastructure that insulates learners from the elements, but also ensuring that they learn in a proper environment. It also deals with eradication of improper material. Yes, here and there we do have schools, not in fact the whole school. Here and there could be improper material or alternative build technology used, but that has actually seen many days. We actually want to ensure that all schools are converted to, brick and mortar moving forward, and also provision of sufficient sanitation. Sanitation also has got a reflection on human rights, especially issues like ablution facilities and access to water, and sufficient electricity and security and fencing. On the extreme right, this our forecasting within the next 5 years that we should be performing at this rather high outputs, but this is how we normally plan in education. The sixth one is curriculum recovery and offer skills for the changing world. This is what I spoke about, saying this is what our infusion of 4IR and artificial intelligence within teaching environment to ensure that we actually prepare learners for the changing world. Number of these targets are new. They came from the NMTDP chair, so we had to transfer them into our strategic planning moving forward. With that said, Chair, thank you.
Thank you very much. 10 minutes, point on. Next, CFO, I suppose, we're now on the line, financials. I'm going to cut yours to 5 minutes. Thank you. They are broke.
I didn't forget the mic. Thank you very much, members. We'll go straight to slide 4. Here we are addressing the issues of our spending. In terms of this slide, you would see that we had spent 27.8%, which is 2.8% above our straight line norm of 25%. And the reason being, which is an old story or historical issues of us underfunding program 2, that's why it's at 28.1%. That's the real reason why we are high. Then you look at examination, also program 7, because of the accruals and payables that we had to process in the new financial year. So basically, that is the real reason why we are at that high expenditure rate. And in terms of the 2.8%, the amount which is associated with the 2.8% is around 531 million, which means already we are 531 above the norm. In terms of economic classification, Chair, you would see our issues. I'll start right at the top. This question was asked. Interest, the 2.8, which is the column, second column from the right, third or fourth line. The 2.8 is those two penalty interest that we had to pay for SARS as well as GPF. The other issue there is the buildings and fixed structures, because we are ahead with our expenditure in that line, so that's why it's at 31.5. Then we need to also explain why this column of additional appropriation. We had to move money, the 62 to 69. It's initially the BEI, Basic Education Initiative, Employment Initiative, was funded under goods and services. But then we had to change so that we transfer funds to schools. That is why the changes. This I've already explained, Chair. Coming to expenditure in terms of goods and services, the percentages are fluctuating, but that is in line with the planned, our strat plan and APP. In terms of inventory, we are showing that out of the budget of 252.3 million, we had spent 66.8 with a commitment of 60 million. We are still having 125 million still to spend. In terms of irregular expenditure, which is slide 10, there we are just showing an unauthorized expenditure, irregular as well as fruitless and wasteful. I'll just touch on from the far right, no implementation of Propac resolution, that we don't have a problem. A number of meetings took place, 3 as it's shown there. But coming to an unauthorized expenditure, how we got to the 1.6 billion is the 870 million, which still needs to be approved. And the past financial year, we had an unauthorized expenditure of 796 million, which is purely a compensation of employees due to our underfunding of our COE in Program 2. On irregular, Chair, there we are showing 2.3 million still to be investigated. However, of that amount, 722 million was already investigated. The process of consequence management, where necessary, will take place, and this will be cleared from our books. However, what we need to stress also here, that the 2 billion that will just be below 2 billion, we need to appoint, we're in the process, in fact, we got approval to appoint a service provider who will deal with at least 1 billion and make sure that by the time the auditors come, our records look better, because these are mostly historical figures. In terms of other expenditure, there's none. On the issues of audit, everything is fine. The follow-ups, in terms of that, our action plan is in place. Ours is to implement. We are already implementing, though the audit has just ended, but we are making sure that while we are dealing with the audit, the other side also doesn't suffer. On the revenue collection, Chair, although it's not our main responsibility, but there we are also doing well. We will see that 5.8 was the planned target for the first quarter. However, we collected 7.8 billion, which is 33.54%. The other slide, which we'll stop at, is the one on the minor assets, Chair. Nothing was a problem in terms of minor assets, as the department's asset register is still also is up to date. During the audit, none of our assets were a problem. But the slide where I think we should just touch a bit, we asked a question about the issues of staff debt, but we just want to highlight that as a department, we are busy to automate our offices. So we started with the salary advisors. There was a stage where salary advisors of educators and were a problem to reach those that they need to. As a result, the sign-off was a problem. So we moved to where every one of us, we are receiving our salary advisors through email. Then we came with the major one of the e-submissions and e-leave. These are saving costs because the submissions is paperwork and it's traveling, GG, all those things there. Then we moved to the e-submissions. Then we also realized that e-leave, the leave is a challenge because leave is money. Then we moved to e-leave. As a result, these are saving us a lot of money. The other thing, MST meetings as well as hybrid sessions, these are the things that we're doing. Now the plan is not to reinvent the wheel. Within the systems that we are using, we need to ensure that how do we incorporate the issues of debt as and when the staff leaves. When I resign, when I know I'm going on pension, it must be captured. If it's at school, the principal should capture it, but it must immediately reflect at head office as well as district. And at head office, both at HR and finance, so that we don't have a situation where we pay salary for 2 or 3 months after the person have left. So that is the plan moving forward, but we won't reinvent the wheel. We'll use what we have, try to tweak those systems and make sure that we come into. Chair, in terms of consultant security, IT matters, Chair, we are okay. Everything, in terms of our IT, everything is it's okay. In terms of consultants, is basically our infrastructure that uses consultants. Other consultants, more like if we have to get somebody to come and investigate something for us, like the irregular expenditure. However, at this point, it's basically that area. Thank you very much, Chair.
Okay, last presentation. The non-financials, I think it's first quarter. I hope members are preparing their questions because thereafter I realized that the questions that have already been answered are already in your possession. So those you can either prepare to make follow-ups as and when we prepare after this last presentation, or just hammer away with your questions. I know Honorable Opa is on my case to conclude matters timelessly. Thanks very much, HOD.
Thank you very much, Chair. Chair, I'm going to preface this presentation by saying we have got a total of 79 output indicators, 5 of which are quarterly targets. Before, we used only to report on the 5, but then the committee said report on all of the others so that we've got an idea whether there is a probability of non-attainment of them or not. So it's up to the chair to say, I deal with the 5 and take the ones that are put the difference of 79 as common cause and ably read by the committee.
And Chair, because today, maybe let's deal with 5. In your best interest, I think 5. But I also feel for honorable members that have been here for the whole day. Yes. I suppose we have already taken much of your time, yes. But let's deal with 5. Even on top of that 5, yes. Let's deal with non-attainment and deviations. I think that will speedily touch on a whole lot of issues. I think we've had a thorough presentation from the researcher about your department, so we have a sense of how far you've gone. Thanks, HOD.
Thank you very much, Chair. With the provision of direction, Chair, these are the 5 sector targets that, for lack of a better way, I would say they are quarterly targets or so-called standardized targets within the sector. The first one is, the first 2 are attained. In fact, the first 3 are attained. Of the 5, we attained 3 and we underachieved 2. The output indicator 303, which is percentage of registered independent schools visited for monitoring and support, we've got, we underachieved with 71.7 against the annual target of 84. These are mainly visitations that circuit managers should execute towards independent schools. That will actually obtain in the second quarter because it's an ongoing exercise. And where we stand and you look at the 2 figures, they are materially negligible. And the number of therapists, specialist staff in public special schools, the only difference between 115 and 106 is because the posts are yet to be advertised. Once they are advertised, Chair, we'll be able to achieve the target. they seem inconsequential, but they are quite important to us because these therapies are very crucial to ensure that we protect learners, especially in special schools. The other programs, Chair, are those that I'm saying are annual targets. We've got a 4-quarter horizon to achieve them. I want to allay the fears of the committee that they will all be achieved. So, but to give the committee just a reflection of what may be probably appearing to be possible underachieved targets, I will just highlight them and probably give the reason for deviation, and then give the committee comfort that they'll be attained. You look at output indicator 104, we're just waiting for procurement. It is number of public schools with access to ICT integration for teaching and learning. We're procuring all this equipment, all it being the software and the hardware, and then we're going to give them to various schools. We're actually targeting 40 schools. The same we will see goes on ICT devices that we're supposed to give to teachers. Once the procurement is done, it's a horizon, it's a 4-week horizon. What we do with teachers, we don't just give them like workshops. Most of them are elderly people, they need change management. So we need to also workshop them on how to use the gadgets so that they drive the technology does not drive them. And then the same for 106, and I think for the others, for output indicator 108, here we have appointed a gender focal person who reports directly to the office of the HOD. Target indicator 108, they are in her business plan. So when you look at 110, for instance, there was a failed project at Intabazwe, multipurpose, but that has since been achieved last week. We actually then used it for Kwakwa, as it were. And then the others are pretty much overachieved, Chair. And when you look, I will just raise this issue of the output indicator to number of learners in no-fee public ordinary schools in line with the national norms and standards for school funding. We had over-projected the figure because we had envisioned that Langenhoven Park would actually have a lot of learners. But we overestimated the figure, but the actual learners that we could actually account for was 414 learners. So that is just the difference between them and Bergman. All these ones, Chair, output indicator 204, we're saying training will be deferred to the following months as per the plan. So they're not necessarily underachieved, and including 207 and 206. I could still say 208 number of grade 1 to 3 teachers trained. When you talk about training is an ongoing process. That's why it is an annual target. And then on 210, number of schools provided with grade 3 African languages reading material. I know Honorable Khwabani is quite passionate about us now teaching in African languages and also gravitating towards history. So the delivery of materials will be completed in the second quarter, and also the same goes for 211, number of primary schools monitored on the implementation of national reading plan, because we want children now to read for meaning, because if you can read for meaning, you can now handle even, gateway subjects. And then when you deal with number of teachers trained in ICT, we did train, it's 1,000. We have already trained 301. We are on the right track. And the number of teachers trained in coding and robotics, I know members like coding and robotics and digital technology, will continue the difference of 121 and 200 in the second quarter. And you will see that even 214 and even 215 were within the proper matrix as we move, because these are annual targets. I don't need to say anything about 216, is self-explanatory, and 217. It is just our technical vocational stream as well as agricultural focus schools. We've even given them names of where the schools are. I'll skip this slide because all targets are achieved. And output indicator here, I think I'll also skip this. At best, we have overachieved some of these targets. Here, Chair, I just wanted to to paste all of the sub targets under output indicator 222, it augurs well for us to have high numbers in specializations and in physical science and math, if you've got the inclusive basket of criteria in mind, because that's how we're now measuring attainment of results. And grade 6, this is about remember I came to the committee, I decried the fact that our schools were not uploading the textbooks on the system, and we even got an adverse outcome by the Auditor General. We've got a committee working on this, and when you look at the targets that we have, we've started, the intervention that is activated by the committee headed by Mr. Mukhobo is bearing fruit. And I think when we come to present next year, we'll be having a very close picture to put to the attention of the committee. And you'll see that 226, we are on the right track. But I must mention, Chair, we've been criticized for not doing sport. We're doing sport, Chair, a lot of sport. But the challenge is that the National Department of Sport, they have changed their sporting calendar. They are now using seasons. You'll only come and swim for a particular season. Maybe it could be just 3 months in a year, then the season is over. So we actually count the school, we don't count the court. So we'll also do the same thing. By the time we get to the tail end of the fourth quarter, we'll be able to aggregate various schools that participated in various schools. I just wanted to clarify that picture. I'm not really worried with this slide, Chair. We're on the right track. Even this slide, Chair, we seem to be very close to our planning horizon. And then, because Chair, I just don't want to waste time with things that are quite obvious. I must just go where there seem to be challenges. Number of special schools provided with additional assistive devices, we will provide them once procurement is concluded. That is 404. The other, Chair, we got an overachievement in other 2 targets, but there were no financial implications. When we get to this slide, Chair, I really don't have any sleepless nights here, knowing my colleagues will achieve all these targets. When you go to the last slide, output indicator 507, number of pre-grade R practitioners trained on national curriculum framework, we are on course because it is a 4-quarter planning horizon. And here, Chair, I can simply skip here and go to program 6. This is the last program, Chair. Yes, checking your time. And if you feel, Chair, I'm long-winded, you are free to stop me. Number of public schools provided with water infrastructure. Look, Chair, I must say infrastructure has got its own lifespan. So there are many other things that influence infrastructure, but in the previous quarter, in the previous financial year, for the first time in many years, we achieved all our quotas, and I even took the colleagues to a special lunch because they really outdid themselves. So I expect the same thing.
You're not using the departmental money when
no,
you're
my own money.
Oh yeah. So that was your last minute remaining. HOD, please wrap it up.
Chair, let me gracefully skip infrastructure. I can present on program 7 because it is examinations and related matter. I'll only report about it after the national senior certificate has been written. And then I can only report in the 4th quarter about this. Chair, that curtains calls our submissions today to the committee. Thank you.
Members? Honorable Lich? Honorable Meko? Honorable Khwabani? 1 minute each. Honorable Pretorius, Honorable Zama?
Oh, I thought Wambangere.
Thank you, Chairperson. I'm going to talk quick. In terms of the Langenhoven Park School, I think 414 learners, it's a very small amount. I don't think that the costs of that school, ek dink nie dit regverdig die uitgawe nie. Die hoeveelheid, ja, it doesn't justify it. Although we are very pleased with the fencing that's gone up there, it looks very neat currently, etc. I think one has to go back to the drawing table and determine whether it will now justify going ahead with the process. That being said, I think under no circumstances should we now embark on a phase where we put temporary classes. The learners are already accommodated in other schools in and around Bloemfontein. Let's not waste that money. Let's start from the beginning to build a proper brick school. Please communicate with the municipality and ask them to do a new infrastructure planning, because I foresee that the sewage system there, it was my ward in a previous term, so the sewage system there won't be able to handle it, not because of the school, but the school on top of the businesses and all the townhouses. Then, in terms of that, putting money in there are numerous schools that have not been completed yet. We were at a school in Bothaville last week. That school it's almost done, but it was never handed over. It was never finished. So 2 or 3 classrooms don't have roofs. Now, what happened in the meantime is people are now stealing the roofs off the classrooms, and it's been standing like that for a few years, 7 years about. Or they started 7 years ago. It's been standing like that for the past 4 years. Let's rather finish projects like that before we embark on new ones. I've also asked for a list of current schools that are under construction. I haven't received such a list. So please, HOD, if you could maybe just look into that matter. Then I wanted to know, we spoke about a lot of teachers sitting at home while there are disciplinary actions against them or under investigation. We spoke about perhaps appointing an HR company that can assist with the disciplinary hearing so that we can get a service provider and sort this out so that we don't have to pay double salaries. I know many of the HR companies, they actually charge you for a certain number of hours. So if you, for example, say you take them for 30 hours a month, I think it will add up to about 1 salary of 1 teacher per month. They are really not that expensive, and I think they can assist the department to handle this matter. With regards to that, I wanted to find out how many teachers are currently on incapacity leave, and do we know how many of those are on maternity leave, or in addition then rather, and how many of the teachers have current investigations against them. I've already mentioned with regards to the schools. And then also just a last question, Letty Fouché School in Bloemfontein. Does that school fall under Department of Education? Does it fall under Social Services, or is it only privately owned? If we can get a bit more information. I did ask a question with regards to that as well, but haven't received answers. Thank you.
Chair of Chairs. Let's move.
No, Chair, one question. No, I was checking. I didn't want to repeat the question. Actually, I drove, I think, from Bloem around 6. Immediately after I passed Lady Brent, that road up until kids were hiking to school. You saw them. What's happening there? Are there issues of schools transporting the farms? And what is the approach of the department? Lastly, you are doing quite well with regard to the infrastructure. I think that we must appreciate. And keep that momentum. You know, we're saying to the Department of Health that it is one area, especially during this period, which we don't want to take lightly, because it is through infrastructure that we can ignite the economy. That is the mantra of this country. And if they are underspending, especially on conditional grants with regard to that, it will rob our province of a smallanyana contribution outside its own revenue. So let's maintain that momentum till the end of the year. Thank you.
Yeah, it's surprisingly short. Chief Whip.
There's something I think it's last week or so, I heard about Bartimi and harassment or something like that. I just wanted to check, maybe from what is happening at Bartimi. The second question is what we got when we were at one school in Hope House, where there was a class of about 50-something kids, 54 years, who were said that, and it's a secondary school, they could not read or write. And we couldn't get a clear answer from the principal. When we asked how come, whether are they from Hope House, only, why so many kids? And the principal was saying, I don't know, they were brought here. So I really don't understand what is happening. Thank you.
Honorable Pistorius, and noted.
Thank you very much, Chair. Chair, I just want to get some clarity in terms of the newly built hostel at Urania Krag at Garib Dam. It was constructed to the amount of about, I think, 88 million. When is it set to open, that hostel in Urania Krag? I know at some stage it was to be opened by the MEC on the 3rd of July. Perhaps in the interim it has now been opened, but just to get an indication in terms of when will it be opening. And then as well, the construction of the special school in Tromsburg. I think that's under the auspice of the DPWI, who's the implementing agent. But if we could just get an indication in terms of how are things going there, the actual status, and is there a date of set for completion of that special needs school in Tromsburg? Thank you, Chair.
Honorable Zama, Honorable Foko, and Honorable Kharekwe, you'll be the last one.
Thank you, Chair, and thank you for the presentation. I just want to understand that for the ICT in offices that are supposed to be procured for the teachers, including the machinery and the equipment expenditure, that is at 13.3, does it affect the department's operations, and what are the delays? And the other issue is about the cost-saving measures. If these cost-saving measures, are they impacting any of your goods or services or operations in the department, as in when you are trying to make the department to be viable? And then the other one is about the Jimmy Ross School in Garib. Is it under Department of Education or under a certain particular department? Can we get clarity on that? Lastly, I have forwarded this article to the committee coordinator and the researcher that they must share with the department. There's an article that is released on the 2nd of May 2025 that is titled South African Schools Faces, South Africans faces a maths crisis as hundreds of schools drop the subject of maths. So Free State, there are 14 schools that are listed. KZN is at 135. There are 14 schools that are listed under Free State. I just want to understand that which schools are these ones, and why are we not, as a committee, informed that there was a decision? I understand that there's a national decision, because here what is referenced national decision, but these schools that are being affected at the level of the province, why are we not informed as a committee about this number of schools, and which schools are these, which are 14? Thank you.
Thank you, Chair. Chair,
You are protected.
I'm not, Chair.
I'll hoy them out. Well, don't worry.
Hoy them someone now. Thank you, Chair. Chair of Chairs, remind me about something that is happening Lakeview, Bloomspruit, next to Uo Street, Uo's school. There is a small children who are hiking from that particular school because the school is closed, and now they removed that school to a location, Bergman. Now, those children, they are hiking from broom sprayed to Bergman, and it's about 4 kilos from that particular school. Now, I just want to, HOD, to have a clarity on that, because the first children who were attending school there, they were having a transport from point A to point B. Now they're supposed to give them that transport from the farms to the school, but it's not happening. Children are hiking the HOD. Thank you very much.
Honorable Kharek.
Thank you, Chair. Mine is on first quarter 2025-26 on expenditure and staff debts recovered. Chair, I just want to check with the department on this management plan. It includes all debts, including the school ones, the schools ones. Why I'm asking this, Chair, because there's a school in some area of Harib that owe electricity. It's St. Lego or Eskom, I'm not sure. And they were out of electricity about 3 to 4 months. So I just want to check how the department assists the schools with that. And then the last one is on ECD teachers who are on strike, Chair. There's any explanation about that from the department? Thank you so much.
No, thank you very much, members. Just to top it up, HOD on the 15th of August, I think, were in Hop House. This committee was undermined, and it is my duty to ensure that its integrity is sustained and maintained. We extended an invitation to the department, and nobody showed. In fact, what were subjected to was what was called a consultant. And these members raised a whole lot of issues there, including covering up of a trench that is opened and exposing school kids there to some danger. The infrastructure there was extremely, we could not make sense of what is happening, because even the principal could not give us any facts. But the department, to say the list, was not there. And that I feel undermines the committee when it's out on oversight visit and none of you is showing up. And we're about to conduct the same tomorrow. We hope the same phenomenon does not repeat itself, because we're going to ask ourselves questions and there won't be anyone to respond. There were a whole lot of issues. I think Honorable Khwaban has touched on one of them. But others are forwarded to the MEC. I hope we'll finalize those with questions for written reply as well. The issue are independent schools. I think now is the second time I raised the issue of independent schools, but this time around it's with a different angle. I paid a visit, and I think I made you aware of a school called Academy of Excellence in Velkom, where I believed there was a whole lot of unfairness, where 7 kids were expelled from school without the department knowing. It's very wrong. It destroys our kids' futures and right under the nose of the department, so it should not be tolerated. But leave that. My biggest worry about it is the registration, the department granting this type of schools that shows us a middle finger. If you grant them permission to continue assisting with your core mandate, chances are we're exposing our kids to danger. And parents are less suspecting because they call some of these schools good schools. ICT procurement issues, it seems like Honorable Zama has covered me there, but it seems like there are a whole lot of procurement challenges in the department. I'm not so sure if they are only related to infrastructure, but it would seem like part of what I'm raising maybe is linked to what I raised initially in Bergman High School. Once we got assured that contractors were paid, it would seem like those subcontractors were not paid because I verified with them. Let's correct that. One other issue that was presented in this very meeting was your rate audit when it comes to COE. It seems like there you are punching way above your weight. You are spending the money that you do not really have, and it becomes a problem. And it seems like you're still going to do it because it would seem like should anyone goes on maternity leave or any form of leave, kids cannot be left unattended, so you still are going to overspend when it comes to that. The issue of 54 learners in Hop House in grade 10B, I think it was touched. Underspending HOD, especially when it comes to maths and science. The very problems that we're having as a province in basic education. I think we would need to be taken into confidence with what is happening in second last. There's a school in Tabancho that's called Boitumelong Special School, where the bus or transport there has been a problem for past weeks or so. And parents, these poor parents are expected to bring their kids to school, and in a two weeks or 3 weeks time, only then will the school bus be fixed. And these kids, some of them because of the financial status of their parents, cannot go to school. And I think this is a serious problem. Lastly, sexual harassment in schools. With St. Bernard being in the forefront, where I realized was suspending and perhaps dismissing these teachers who are embroiled in this issue. But I'm worried about the programs that the department is undertaking. Either, one, to make sure that learners, should they be exposed to such acts, who do they talk to? And I'm also worried that if specialists in schools are not employed in time, who do we resort to when we need to deal with psychological issues, especially with such learners being... and Bartimia is not only in the list as well, in Tibulua, in Kwak. So it seems like the list is growing. Every time we get a case of sexual harassment in school, it breeds 2-3 more other cases. What is the department doing about it except suspending and dealing with? And there are also cases of sweeping some of these cases under the carpet and only to address them when certain groups of interest are starting to voice them out. So those are a few ones. I think after this, we'll wrap it up. I think we're highly behind schedule. We still have to drive a long way. Thank you, HOD.
Thank you very much, Chair. It's quite a lot of questions, and forgive me if I may not do justice to all of them. Honorable Leach, we won't put temporary classes there. What I need to advise about the LHP is that there's a great need for English medium schools. We are inundated with parents who are trying to force their learners into UNICE, into your St. Michael's, into St. Andrews. The fact is that we are tampering with the SGB's function of determining the number of learners in a class, and the schools were not built for that. Some of these schools don't even have enough space to even accommodate extra classes or even mobile classrooms. Mobile classrooms were made to be a stopgap. What is really a silver bullet in solving this thing? Is actually to build a school incrementally, as you were saying, to ensure that we test the appetite. So that's what you will see at Langenhoven Park. What put off many parents is the fact that they would want their schools, their children to be put elsewhere. They do not like the idea. And it will intertwine with what has been raised now about independent schools. why they become ineffective or non-viable during the course of the year. The next issue was you're talking about the school in Bothaville. We're quite affair with what was happening in Bothaville, but this is the problem of public works, where there was lack of contract management in there. There were people who were terminated, given another lease on life to come back. The school is almost finished. 3 schools, we have agreed with them that we are going to take 3 projects from them and complete them, like we have done with Tolo, Maleboho, as well as Caleb Motsabi, which we completed within 5 months after taking the schools over. And we recommissioned the schools. The schools have got children, they are functioning communities. We have decided, because they have got projects that are 55 to 58, if not 60 weeks, 60 months above the completion period. Obviously, not only service delivery suffers there, it's also an element of, the right to learn of learners. So we took a decision, and they've agreed that we're taking over that school in Bothaville. We're taking over Leboning Hostel in Lejwele Putswa. We're also taking a school in, I think it's another hostel, Breda. Because we need to have these farm learners in those hostels. The hostels there's been inordinate delay in getting hostels finished. So those learners are the learners that the committee will come and say, but we saw learners walking in the streets, going all over, simply because now they have not been given their birthright to learning. So we are going to we have already agreed to take over the school. It will come with costs, because if you understand, some of these schools have been under construction for over 4 years. Then just VAT was 14%. When you want to recommission the school, you call someone to finish the school, VAT is 15%. That variance, including cost escalations, is going to be denoted as possible fruitless and wasteful expenditure. But I'm the accounting officer. I don't have the latitude of doing nothing, because I'm damned if I do, and I'm damned if I don't. Whichever way you go, there is something to pay for. So we will actually take those schools. We'll actually ensure that we pay people legitimate money that is due to them, but enforce that the schools are finished and the learners are there. Then our objectives would have been met. Disciplinary hearings, you said it a number of times, Honorable Leach. The challenge that we have internally is that for the past 5 years, we have not appointed people in office. It will talk to what Honorable Mapeula raised about our COE. Can I let this issue stay over until I reach there? It's important that I read them in tandem. How many teachers are on incapacity and maternity leave? I'm under oath, and I know this matter is going to answer. I don't want to be seen to have lied under oath. If the committee prefers, is that I could actually provide that information in writing. Latif Oshie, yes, it is our school. It belongs to the Department of Education. Thank you very much. Honorable Meko, Lady Brent, children hiking to school. Where I am, I don't have a distress in that area that comes over school transport. But you have seen it. Some of them I see them myself. So I will just ensure that I talk to the circuit manager in that area, just to check why learners are walking. And then Bartimea, there is harassment. I'm aware of Bartimea. The Bartimea is being investigated as we speak, including Tibulua. Tibulua, I'm in consultation with Nahau. They talk to me about the issue. We're investigating these colleagues. Look, I admit that we are running a very complex ecosystem. I think the biggest ecosystem in this province. When we are on our own, we are 33,000 with about 800,000 learners. But when we expand our employment space, we are 54,000. Surely not everything will be perfect in that environment. What we just need to ensure is that things don't become pervasive. We just need to ensure that we keep on telling our people things that they are not supposed to. The sexual harassment has got no place in our school environment. And we take adverse influence, whether you're a teacher or anybody who goes and violates our children. That person has got no space in this department. Please, when you see the reports, they are not reminiscent of our posture as the department. We are really brutal when it comes to people who commit this kind of senseless and actually, morally reprehensible conduct. And the same attitude goes to Bartimea and Tibula West. Our children there, they call for compassion because they are brittle. Hope House, I will check where these learners come from, and I'm not so sure whether the principal was able to say these learners, they were brought here, or they've been part of his system. If they've been part of his system, you had a culprit right there in front of you. Because today we say learners are progressed. Progressed by who? So that's why we force time on task, we force curriculum coverage to ensure that learners are taught when they're supposed to be taught. But I'll go to the circuit manager as well, and with Mr. Moloi, and go and check what could have been the case. It's actually worrisome that learners at grade 10, if I heard well, could not read. I don't really understand where they have been. The Tromsbeek hostel, this a series of facilities that we are going to open. Before we open a hostel, we must ensure that there is the parents, mothers, factotums that are going to run the hostel. So the hostel is finished. The Public Works wanted to open the hostel, said no, we don't want another crisis that we've got children there, but the system was not ready to receive them. That will be one of the first projects that the MEC is going to open now in the third quarter, together with Public Works. Tromsbeek School, in Afrikaans will say it is a swart call op a Bethlej. It has been a problem, Chair. Sitting here and trying to paint a rosy picture, it will just be maybe being disingenuous. The fact is that Tromsbeek as a project was handed over to Public Works in 2017. The procurement was a conundrum that you could not understand. Finally, they found that where the school is supposed to be built, there is serious rock and extended rock downwards. Then I said, at a particular time, because you've got experts, why didn't you change the sites? Because we spent a lot of time digging rock and just on the surface. It's only now, Chair, that they've gained traction. Now they've gone way above the wall plates, but it has been a tall order for them to get there. We have created a special dispensation to accelerate that project. Is both the school and the hostel, and even the school in Leboning, the hostel in Leboning, just to ensure that they are finished on time. Remember, Harib does not have a special school, and we've got serious cases of children having alcohol fetal syndrome in there, and they don't even have a single hostel. So we're working with Public Works. We've changed the designs. Stop digging pits, rather use lifts. That's where we've been. We hope to turn the corner very soon. ICT for teachers. There is ICT for teachers, but we keep on, supplying teachers with ICT. But the rule of thumb is that you don't give people new equipment, you don't teach them how to use it. And some of us, we know we don't even use 30% of the capabilities of our phones. So we don't want that. We want them to use them and be able to teach using that. But the procurement becomes a problem because ICT issues like laptops and all, we don't procure them conventionally. We go through CEDA. They come with their own process, and then the delivery becomes a problem. Fortunately, the minister has now ruled that provinces can now procure ICT equipment directly, recently. There's been various cost-saving measures. We have self-imposed austerity measures on ourselves. Our projection is that through such cost-saving measures, we're projecting a saving of almost 700 million. Jimmy Ruos is under the department, but we understand this, we call it, formerly used to call them footstone school. You need to, there are children who have been found guilty and they are in conflict with the law and they are put in that space. It has been a problem, but we've got Rosenhof, such a beautiful school. The same situation with girls. Those girls have become doctors, engineers after the fact. But there seems to be something with systemic deviance at that school. I think it's the issue of getting social development and other state departments to come and help us. Because as things stand, Chair, with education being what it is, with the complexities of every society, it has become difficult to teach. Because ideally, a teacher wants a child to pitch up and teach the child and go home. But the teacher must be a social worker, must be there's just so much that we want from them. So we need help, if in whatever way, whatever format. We'll keep on crying to other sister departments to help us, so that we can counterbalance the two issues. Because a school is a microcosm of society. What happens in society plays itself in the schoolyard. So the problem is in the society, which has now been mortgaged to the schools. And on hundreds of schools dropping math, it is a national problem. It's not a Free State problem. The society still puts too high a premium on his number one. Human beings are human beings. When, instead of supporting learners to the bitter end, they would rather say, no, leave maths, do maths lead, because it's an easier way for the school to get 100%. So it is a culture that comes as an unintended consequence of this rat race between provinces. But what we have done, which is what I raised when I came to one indicator, where you see that there are a lot of children at grade 10, because our matric in the Free State starts with grade 10. Learners that are in grade 10 must finish matric. So we've got more numbers now in math as well as and physical science as the key gateway subjects, including subjects that were called specializations. It augurs well. You are happy, because we put higher premium on mathematics. But we must also think that we cannot create academics. No economy will be built by academics. We must now focus on the three-stream model and put learners into trades to ensure that they can work this country and its economy. And then on issue of Lakeview, Tweesprade, we will actually ensure that, and Bergman, the rule of thumb is the 8-kilometer radius. If children walk 4 kilometers, they don't qualify for learner transport. It must be the 8-kilometer radius. But still we'll go and investigate whether in doing that, they are not being exposed to the elements. Because when you go to those areas, you may find that they walk, but they get killed, they get abducted, and that happens. In such special circumstances, well motivated, were able to deal with those issues. I think the CFO will answer this one of a management plan and school electricity and how the department is helping. I'll deal with ECD teachers who were on strike. Chair, these teachers were not qualified. We took them to school. But the unfortunate part is that we cannot absorb them with the current situation of our COE that is passed without being fully funded. Everything else that we do compounds our unauthorized expenditure. I will stop at that. And Hope House, nobody showed up, and there is a consultant from a company called ETSO that you find there. When I asked Mr. Moeti about what could have happened, because I heard that the committee was not happy, I'm advised that the person that we had deployed there was given an impression that the meeting was going to start at 11. So the person left at around 2. The committee was not yet there, but Mohali was able to meet the convoy coming in. The advice that I've provided is that we wait on the committee, and only he could have used that school to clock out. Because probably at 4 o'clock he could have left if he doesn't see anybody else. We apologize profusely for that and ensure that it won't happen again, Chair. And we should have the contact numbers of our community coordinators so that we are in the same space in future. We'll take responsibility for that and guarantee the community that it will never happen again. Academy of Excellence, Chair, you did speak to me about it. I've deployed Mr. Mohobo to go and deal with this matter with the district director. Yes, registrations by our department it is us who are accrediting these independent schools. But when they start, they would meet all the criteria. Whether it is, they say they have teachers, they have that. But you find that these people are fielding 10 learners in grade 12. And you give them 8 choices for curriculum streaming. It's not possible. You will never be viable having to pay someone competitive salary, but you only have got 10 learners in grade 12. How are you going to do it? So you then find those schools being financially non-viable, then I'm forced to take those learners. Because by law, I stand in loco parentis. I have to take those learners and force them into Grey and all these schools. It happened with a school called at Lorem or something like that. Even the current ones, Chair, the parents think that private schools or independent schools are a better alternative to public schools, but the facts are giving a different picture. I'll leave it at that, because I'm not here to talk about our grade 12 achievements. The team will be here, Chair, tomorrow. Mr. Mueti is going to lead the team, is the Chief Director Infrastructure, when the team goes to Fontaine. Chair, I can guarantee you of our cooperation and support to the committee. COE, it's a discussion for another day. I know Honorable Meko is a very good resource in this space, but the long and the short of it is that our department is underfunded now. When we look at what we need to get the department back to where it was last year, Treasury confessed it for it to have been 8.8 billion that got taken out of the department through fiscal consolidation. From 2013-2014, we can come and present to the committee year on year as to how much was taken to us. Now I've just returned from our technical MINMEC in Cape Town. After all the figures have been consolidated, what has been the financial burden on the department equates to 11 billion. It requires a different setting, seeing that, Chair, it's graveyard shift. For when we present, we need members fresh and very early in the morning, as it were. Chair, I think underspending on maths and science, I suspect it's MST grant. It is always hamstrung by provision of this. It's math, science, and technology. That's where we buy this equipment. That's the funding source for all this ICT. Bitumelong, I will investigate this. Bitumelong is notorious. It's not for the first time that I have this issue with transport. I know the Hawks were also investing a case here. I will leave it at that. Sexual harassment and suspending and discipline. The St. Bernard issue is an issue almost after the fact. These teachers had already just been charged, but these learners were in St. Bernard, I think in 2023. And it was sparked by what is in social media space. We are on top of it. One of the teachers, when the learners called him out, he actually is now suing the learner. We are now defending the learner through the state attorney to ensure that learners are not going to be gagged. Because once we get that situation where people can use their financial muscle to escape liability, then we are just as complicit. So we are actually going to appoint a senior counsel to defend the learner. Then I just wanted the committee to be sure that we really assume a very negative stance towards sexual harassment. I think, Chair, that's all that I could capture with the time that I had, and then the CFO has got a question to respond to.
Thank you, Chair. Thank you, Chair and members. Let me just explain the issue of staff debt versus the debts of schools. The staff debt is pure staff debt. It doesn't include the debt of schools where it affects issues of electricity and what. However, in staff debt, it's all of us. If I have a debt, it gets recorded in our register, goes to loss control, which is the issue that we spoke about also, the automation, to say. We must avoid the issues of where I leave the system but I'm still paid. It's easier for me at head office or at administration that it can be detected, but at district level, at schools, those are the things that we are trying to sort out. However, coming to the issue of schools with challenges of electricity, if the members allow me, let me start also with the issues of water. We are having a big committee that involves our provincial treasurer, municipal service side, district management and head office, where we meet with municipalities and we are trying to solve the issues of water. That's why we want a prepaid system of water. However, we differ with them when it comes to the issues of the old debt, because we say, give us the prepaid. We can buy ourselves water, the schools can buy, while we deal there. So we cannot see eye to eye on that matter. That will be sorted out over time. However, coming to electricity, from our unit of infrastructure, what we are doing, we have installed generators as well as solar panels in some of the schools. 50 of them are already covered in that space. This year we are planning to deal with around 13. So it depends on the amount or the funds that we have, but we are helping. So when we have to include, give the school a generator, at least the least they can do is just to buy diesel. So that's the process that is running, and it will reach a point probably where we'll cover all our schools, especially at the rural areas or in particular our Harib district, where we know the challenges. So our infrastructure, that portion of the budget, we are able to use the money of maintenance and assist the schools. Thank you, Chair.
No, thank you very much, Lefapha. Under the stewardship here, Dr. Maboya and yourself, HOD, please follow up Tabaya, the subcontractors and Barahman. I think Honorable Meko raised this matter passionately with earlier departments. So please follow it up. We can't continue pushing small contractors and business people down because the department is not meeting up its obligations. So that being said, I think Lefapha le lokoleng, and we must have come to the end of our business day, at least for today. And tomorrow it's going to be a long day, but hopefully not. Honorable Meko is the one who likes to knock off very early. He can knock in and knock off, he will not have a problem. But hopefully we've got only 3 site visits tomorrow, and I think the challenge for tomorrow, it will just be a distance between the 3. But I'm, however, advised that tomorrow on our first site visit, there is going to be members of the community, and I would want to urge members of the committee to ensure that we engage those members, at least lend them an ear. Have a sense that when you sit down and discuss, you do it in the best interest of these people. That being said, honorable members, the department, this meeting is officially adjourned.